Hi, welcome to our community health center. My name is Dr. Jones. May I confirm your name, please?
Yes, you can call me Mary.
All right, Mary. I can see that you are here in behalf of your mother, right? So, what can I do for you today?
Well, my mom has been discharged home, and I am a little bit worried about her further care. I'm already 57 years old, so I don't know if I would be the best person to take care of her. Besides that, I don't know if it will be possible to take care of her at home, or if we should be considering a nursing home.
Thank you for sharing your concerns with me, Mary. First, I would like to reassure you of the support of the community and health center for both you and your mom. You can always count on us. Let me tell you a little bit more about what happened to your mom. She has suffered a stroke. A stroke happens when something blocks blood supply to part of the brain, or when a blood vessel in the brain bursts. After a stroke, the patient might have difficulty to communicate, restricted physical abilities, weakness or paralysis of limbs on one side of the body, and difficulty gripping or holding things. That is why it is important to have someone with her every day now that she is at home. Is it clear so far?
Yes, it is.
Do you have any other questions about a stroke?
Yes, I do. Do you think she will recognize me on a daily basis?
Well, Mary, your mum is still recovering. She will have good days and bad days, but we have to focus on providing the best care for her. About your mother's further care, it is important for her to take her medication every day at the same time. We might also need to do some modifications around the house, such as installing rails and moving your mom's bedroom to the ground floor. I will refer your mother to an occupational therapist who will assess your mother's home to see if there are any other risks that we must avoid. Do you have any questions about your mother's further care?
Yes. I was wondering if we can take care of her at home, or if we should be considering a nursing home.
That's an excellent question, Mary. You mentioned that you don't know if you would be the best person to care of her because of your age. In this case, we could be considering a nursing home. However, I believe your mum would feel more comfortable if she were staying in a place that is already familiar to her. You don't have to make a decision right now, but remember that she will need someone to check on her every day and to help her with activities and chores around the house.
And how long is she going to live?
Unfortunately, that is a question that none of us can answer. We have to focus on giving her the best care we can.
Is it true that she might have another stroke in the future?
That is a possibility. And it is important to always have someone with her to pay attention to some signs that can be suggestive of another stroke. If you see that your mom is having difficulty speaking, vision problems, loss of balance, or weakness in the face, please call 911 immediately because she might be having another stroke. Is there anything else you would like to ask me?
No, doctor. That would be all, thank you.
Here you have a pamphlet that explains more about a stroke, and in the back, you have my phone number. Feel free to give me a call if you need anything.
Hi, Susan. Welcome to our clinic. My name is Dr. Jones, and I am one of the doctors here at the clinic. What brings you here today?
Well, doctor, I have been having these recurrent urinary infections for the past 12 months or so. I don't know if these infections are so frequent due to my lifestyle, and if there is anything I can do about it. I'm really tired of them because they interfere in my lifestyle and in my daily activities. I was also reading on the internet that there might be some kind of surgical management for my condition, and I would like to know more about it.
Thank you for sharing that with me, Susan. Before we can talk about the possibility of a surgery, I need to ask a few questions to understand a little more about your condition. Would that be all right?
Sure, doctor.
Great, Susan. First, could you tell me what you do on a regular day?
Certainly. From Monday to Friday, I go to the gym early in the morning, or sometimes I go hiking. Right after that, I go to work. I arrive home in the evening, and I normally take a shower at that time. But sometimes I'm too tired, and I only take a shower the next morning before I go to the gym again.
All right. And how much water do you drink a day?
I only drink a small bottle of water while I'm working out early in the morning.
I see. Do you drink anything else during the day?
Yes, I normally drink coffee, juice, and soda.
Thank you for this information, Susan. Let me reassure you that good hydration can help you avoid future urinary tract infections. I want you to start drinking more water every day. You can use the same bottle that you carry to the gym and get 3 refills during the day, 1 in the middle of the morning, 1 in the afternoon, and 1 refill in the evening. This way you will start drinking around 2 liters of water a day. Can you do that from now on?
Yes, sure.
Great. That's a fantastic beginning. Now the second step is just as important. You must take a shower immediately after your workout. This will prevent the growth of bacteria, which then leads to urinary infections. Are you willing to make this change in your routine?
Well, doctor, actually, I don't feel comfortable taking a shower at the gym. There are too many people who use that shower every day.
I understand your point, Susan. However, you said that you are tired of having so many urinary infections. Having proper hygiene is the second most important step to prevent future urinary tract infections. If you don't feel comfortable taking a shower at the gym, no problem. Do your workout in the morning, then go home to take a shower, and only after the shower you can go to work. You must do this in order to avoid future UTIs. Will you do that?
Yes, I will. But how about the surgery?
That's a good question, Susan. We have a very strict protocol here at the clinic. We could only proceed to surgery in more severe cases. First, I want you to make these lifestyle changes for 30 days. Then, you are going to come back here for a review appointment. At that appointment, in case you haven't seen any changes in your symptoms and in your quality of life, we might be discussing about the possibility of a surgery. Is that clear?
Yes, it is.
Is there anything else you would like to know, Susan?
No, that would be all, thank you.
All right. Your next appointment is already booked 1 month from today. If you have any questions, give me a call, and I will be more than happy to help you. Have a great day. Hi, my name is Dr. Jones. May I please confirm your name? Yes, you can call me John. All right, John. What brings you here today? I have been coughing a lot for the past week, and I am worried because it has got worse. I understand, John. Would you mind if I asked you a few more questions about your symptoms? Not at all. Go ahead. Thanks. Could you tell me how this cough started? Yes. I was teaching a group of teenagers at school, and I shouted at them to get their attention. As soon as I did it, I started coughing, and I haven't stopped. Besides the cough, have you noticed any mucus? Yes, when I cough, there is a yellow mucus. Have you experienced any fever? Yes, I have, especially at night when I try to sleep. And have you taken any medication to alleviate these symptoms? For the cough, I have tried tea with honey, but it hasn't helped at all. For the fever, I've been taking ibuprofen. It works for 5 or 6 hours, but as soon as the medication wears off, the fever comes back. Thank you for sharing this information with me, John. Based on the symptoms you have described, and in my physical examination, my first diagnosis is pulmonary infection. The medication you have taken tries to alleviate the symptoms, but it doesn't treat the root cause. First, I need you to stop taking home remedies. Then, I would like to encourage you to start taking antibiotics in order to fully recover and to avoid recurrence and complications of the symptoms. Well, doctor, to be honest, I'm afraid of taking antibiotics. Thank you for sharing your concerns with me, John. Could you tell me a little bit more why you are afraid of antibiotics? Yes. I have heard people talking about them on the internet and the nasty side effects they have experienced after they've taken antibiotics. I don't want to go through that. I understand, John. This is a common concern among patients. Let me tell you that there are a couple of side effects that we could be expecting as you start the course of antibiotics. However, these side effects are minor problems if we compare them to the benefits of taking antibiotics. Antibiotics are safe, and they are the only way for you to fully recover and to go back to your regular activities as soon as possible. The advantages of taking antibiotics are far greater than its possible side effects. After my explanation, do you feel more comfortable about taking antibiotics? Yes, I do, doctor. I'm glad to hear that, John. In addition, I would like to suggest you a few ways for you to minimize the strain of your vocal cords. You work as a teacher, and you use your voice all the time. For this reason, it is extremely important for you to drink plenty of fluid, talk slowly, and avoid raising your voice. Do you have any other questions, John? No, that would be all, doctor. All right, I'm going to give you the prescription for the antibiotics, and I would like to see you again in a week to see how you are recovering. During this week, I would like you to rest at home, so I am also going to give you a doctor's note for you to send to your employer. Thanks a lot, doctor. You're more than welcome. Here is your prescription and your doctor's note. Have a great day, and I'll see you in a week.
Hi, welcome to our health center. My name is Dr. Smith. May I please confirm your name?
You can call me Susan.
Nice to meet you, Susan. I can see from my notes that you have booked this appointment for your 4-year-old child. May I confirm her name?
She is Mary.
Thank you for the confirmation. So, tell me, Susan, what has happened to Mary?
She has had this very itchy skin for the past 4 days, especially on her legs, behind her knees. It's not the first time this has happened, but this time it is lasting much longer. Because of this, she hasn't been sleeping well, and she has been quite moody.
I'm really sorry Mary is going through that, but don't worry, I'm here to help her. If you don't mind, I would like to ask a few questions to understand a little more about Mary's condition. Would that be all right?
Sure.
Thank you, Susan. You mentioned that this is not the first time it has happened. Could you tell me a little bit more about that?
Certainly. This itchy skin normally comes and goes, especially in the warmer days of summer. But it usually lasts only for a day or two.
I understand, Susan. And when did the itchy skin start this time?
About 4 days ago.
Got it. Have you noticed anything that could have triggered this itchy skin?
Well, the only thing different that happened was 5 days ago when Mary was playing with her friends in the swimming pool.
Okay. Does Mary have any allergies?
Not that I know.
I understand. Thank you for your answers, Susan. Based on the symptoms you have described and on my physical examination, my initial diagnosis is eczema. Have you ever heard of eczema?
Not really.
So let me tell you more about it. Eczema is a skin condition very common on children. But don't worry. It is not that serious, and most children grow out of it.
Is there any treatment for it?
Yes, there is. First, I would like to order a skin test and a blood test just to confirm my diagnosis. The first part of the treatment can be started even before we get the results of the tests. You are going to apply some ointment in the region where her skin is itchy, and you will keep Mary's fingernails short to avoid scratching. Then, once the allergy is confirmed, I am going to prescribe antihistamines for your daughter. Is it clear so far?
Yes, it is, doctor.
You mentioned in the beginning of our conversation that Mary has been moody, and she has also been having difficulty to sleep. Let me reassure you that both her sleep and her mood will be improved as soon as we start the treatment. Is there anything else you would like to know, Susan?
No, that would be all, doctor.
Okay. I am going to order both the skin test and the blood test, and my secretary will book Mary's review appointment for next week, when the results of the tests should be ready. In addition, I will leave you my phone number, so you can call me at any time if you have any other concerns about Mary. Hi, Jennifer. Welcome to our clinic. My name is Dr. Smith, and I will be with you today. So tell me, what brings you here today?
Well, doctor, I have been suffering from tonsillitis since I was a kid, and this condition really bothers me. I have already decided to have a tonsillectomy done, but I'm afraid because I've never had any kind of surgery before.
Don't worry, Jennifer. You've come to the right place. I would like to start by explaining how the surgery is performed. The surgery is done while you are under general anesthesia. You will be asleep and pain-free. The surgeon will place a small tool into your mouth to hold it open, and then he will remove your tonsils. Tonsillectomy is usually an outpatient procedure. This means you can go home on the same day. Complications are rare, but if they arise, your provider might keep you in the hospital overnight to monitor your progress. Is it clear so far?
Yes, it is, doctor.
Great. After the surgery, we will continue your treatment. You will need from 3 to 4 weeks to recover. During this time, it is important for you to rest at home and limit your activities and speaking. You might expect a possible voice change immediately following surgery, but this is only temporary during the recovery process. As there might be a small possibility of bleeding while you are recovering, I suggest you to have a liquid diet for the first week at home.
Doctor, when you said bleeding, could it happen while I'm asleep?
That's an excellent question, Jennifer. If it happens while you are sleeping, there should not be a lot of blood. If you notice any taste of blood in your mouth, the first thing to do is to remain calm. You should rinse your mouth and then keep your head elevated. If the bleeding continues, please call the clinic immediately so that we can assist you. Is there anything else you would like to ask?
Yes, doctor. Is it all right if I work from home while I'm recovering?
Thank you for asking me this, Jennifer. First, let me understand a little bit more about your job. What do you do for a living?
I work as an accountant in an office.
Okay. And do you normally have many meetings in a week?
Not really. It is a pretty lonely job.
I understand. And do you usually have to make many phone calls?
Almost never. I basically sit in front of a computer the whole day, working with different files and a lot of numbers.
Well, Jennifer, in this case, you might do some light work from home, starting in the second week of your recovery. However, the first 7 days at home, you should rest in order to recover completely and also to avoid complications. Is that clear?
Yes, it is.
Okay. I would like to arrange a review with you 2 weeks from today. I'll give you this leaflet with more information on tonsillectomy, and in the back you have my phone number. Feel free to give me a call if you need anything. Good morning, I am Dr. Smith. You must be Mary, am I right?
Yes, you're right.
Mary, I have received a referral letter from your factory physician, but I would like to hear from you in your own words. Do you know the purpose of today's visit?
Yes. I was having the annual checkup at the factory when the doctor said that my blood pressure was too high. I don't want to have any problems at work, so now I need to have a full examination before I can go back to work.
That's correct, Mary. Your factory physician wrote a letter saying that you were having high blood pressure. To begin with, I would like to ask what you know about high blood pressure.
Not much, to be honest.
No problem. Let me tell you about it. High blood pressure is a condition in which the force of the blood against the artery walls is too high. If we leave it untreated, it might lead to heart disease, heart attack, stroke, and even kidney disease. Is it clear so far?
Yes, it is. I didn't know that it could be so serious. The funny thing is that I feel fine right now.
I understand that you feel fine now, Mary. However, high blood pressure, also known as hypertension, is called a silent killer because it can go undetected for a long period of time. Most people who have high blood pressure do not have any symptoms, and testing is the only way to determine if someone has it. Do you understand?
Yes, I do. Does that mean that I must start taking medication?
Not yet, Mary. The first part of the treatment consists of introducing changes in your life. I would like to ask a few questions about your lifestyle to evaluate which changes need to be made. Would that be all right with you?
Sure.
Thank you, Mary. First, do you exercise on a daily basis?
No, I don't.
Okay. In this case, the first change that we need to make is to introduce a 30-minute daily walk in your routine. Do you think you can do it?
Certainly.
That's great news, Mary. Now, my next question. Do you have a healthy diet?
Well, I try to eat as healthily as I can for breakfast, lunch, and dinner. I avoid soda, sweets, and junk food.
That's fantastic, Mary. We are off to a great start. Next, do you drink alcohol?
No, I don't.
Fantastic. And my last question, do you drink coffee?
Yes, I do. I work night shifts at the factory from 7 p.m. to 7 a.m. So, in order to stay awake, I have to drink 4 to 5 cups of coffee every night.
I see. I understand that coffee helps you to stay awake at night. However, 5 cups of coffee every night is a little too much, and it might be one of the reasons your blood pressure is so high. I would like to suggest you to reduce the amount of coffee you drink per night. Do you think you could drink from 2 to 3 cups of coffee per day?
It might be too hard in the beginning.
I know, Mary. But if you are able to reduce the amount of coffee to 3 cups per night, we might be avoiding the need to add medicine to your routine. I believe that reducing the amount of coffee is much better than having to take medicine every day. Don't you agree?
Yes, doctor, you're right. I will start drinking only 3 cups of coffee per day.
Wonderful, Mary. I know that this change is going to bring you many benefits. Last but not least, I would like to educate you on regular monitoring of the blood pressure. You will have to buy a blood pressure monitor. Then, you will check your high blood pressure every day, in the morning and in the evening. Every time you measure your blood pressure, I want you to write down the numbers of the reading that will show in the screen of the monitor in this leaflet here. In our next appointment, you are going to bring me this leaflet with the readings, and I am going to analyze if the changes we have discussed today have been working to control your high blood pressure. Will you do that?
Sure, doctor.
Thank you so much, Mary. I would like to see you back here in 1 month to see how you are doing after introducing a 30-minute daily walk and reducing coffee intake. Hi, Susan. Welcome to our health center. My name is Dr. Smith. I have here in my notes that you have come here to talk about your son, Jack. So tell me, what can I do for you today? Well, doctor, we received Jack's diagnosis at the hospital a couple of days ago, and it has been tough. He was diagnosed with cerebral palsy. I know the doctors explained to us what that means, but I don't remember much. That's why I came here today, to try to understand more about his condition and to know what we as parents can do to help him. Thank you for sharing that with me, Susan. I appreciate it must have been a difficult moment for your family. Let me reassure you that our health center is here to help you and your family during this difficult time. First, I would like to explain to you what cerebral palsy means. Cerebral palsy is a group of disorders that affect a person's ability to move and maintain balance and posture. For this reason, it is difficult for your child to walk, eat, and even talk. Is it clear so far? Yes, it is. Is there any cure for it? Unfortunately, there is no cure for cerebral palsy. However, there are many treatment options that may help improve Jack's daily functioning. Selecting care depends on your child's specific symptoms and needs, which may change over time. Early intervention can improve outcomes. We have to focus on providing Jack with the best care we can.
Is there any chance that he might have a good childhood in future?
Well, Susan, there are many schools for children like Jack. They are safe places where he will be able to interact with other children and where they will always have someone watching over them. In addition, with the help of a multidisciplinary team, such as a neurologist, pediatrician, and physiotherapist, there is a chance that Jack might walk in the future.
This is so hard, doctor. Jack is so young, and my husband and I are only 28 years old. He is our first child, and we are going to love him no matter what. But sometimes I feel that it is much more than we can handle.
I understand how you feel, Susan. We talk to parents and other family members who have children with cerebral palsy every day. It requires a lot of effort from the family, but it also requires a lot of love. Rest assured that you are not alone. We are always here to support you and to guide you all the way through. Once a week, we have a support group here where parents of children with cerebral palsy meet to share their experiences and their stories. This way, it gives people a feeling of hope knowing that they are not alone and that many other families go through the same challenges every single day. This support group meets here at the clinic every Tuesday at 7 p.m. Would you like to come next Tuesday to see how it works?
Yes, doctor. That would be interesting.
I'm glad to hear, Susan. In addition, we also have a counselor here at the clinic who can talk to you and your husband once a week. She is a psychologist, specialized in children with cerebral palsy. She will help both you and your husband to understand what Jack is going through and also how you as parents can support him in his everyday life. Would you like to meet her?
Yes, thanks a lot.
You're more than welcome, Susan. I will invite her in just to meet you today. Then, we can schedule an appointment when you can meet her together with your husband and Jack. And remember, you are not alone. Whenever you need anything, feel free to give us a call or to come here to the health center, and we will always be available for you. Hi, welcome to our clinic. My name is Dr. Smith, and I'll be with you today. First, could I please confirm your name?
Yes, you can call me Susan.
It's nice to meet you, Susan. Could you tell me what brings you here today?
Certainly. I have been suffering from ankle arthritis for a long time, and I was reading that there might be some kind of surgical management for my condition. However, I am hemophilic, so I am worried about the recovery and success rate of the surgery due to my bleeding disorder. Then I decided to come here today and understand what my options would be.
You did the right thing, Susan. I'm glad you've come here so we can discuss all the possibilities to help you out. First, I would like to reassure you that ankle arthritis is a well-known comorbidity for hemophilic patients. As you mentioned that you are interested in the surgery, I will explain to you how the procedure works. Using general or spinal anesthesia, Surgeons make an incision above the ankle joint, then remove the damaged bones and cartilage. 2 metal pieces are implanted to replace the movable joint, and a plastic spacer is inserted between them to ensure that the joint has a smooth motion. Is it clear so far?
Yes, it is. And is surgery my only option?
Not really, Susan. There are other options for your treatment. One of these alternatives is to manage your pain with medication such as Tramadol. Together with the medication, we can order orthopedic shoes for you. These special shoes should reduce plantar pressure and stress while stabilizing the foot and ankle. Are you following?
Yes, I am. If I decide to wear these orthopedic shoes, would that mean that I won't have to go under surgery?
Only time will tell us, Susan. But I can reassure you that if you need to go under surgery in the future, having hemophilia is not a contraindication for surgery. Do you have any other questions?
Yes. Am I going to need a blood transfusion during the surgery?
That's an excellent question, Susan. The surgeons and the other doctors that will be assisting with the surgery will be checking all your vital signs, including your blood. If needed, the team will be ready to start a replacement therapy with concentrates of clotting factor. This infusion will help replace the clotting factor that's missing or low. This way, the doctors will make sure to control coagulation, which is an important process that prevents excessive bleeding when a blood vessel is injured. Is it clear?
Yes, it is. And what is the recovery process like?
Great question, Susan. At the surgery, the doctors will perform an invasive joint cleaning. Consequently, it will require a long rehabilitation for at least 6 months. You don't have to make your decision right now, but if you want to go under surgery, we will be ready to help you all the way. Is there anything else that you would like to ask me?
No, that will be all for today. Thank you, doctor.
You're more than welcome, Susan. I would like to give you this leaflet here that explains a little bit more about the ankle arthritis surgery, the pain management, and the orthopedic shoes. In the back of the leaflet, you have my phone number, so feel free to give me a call if you have any questions. I will give you some time to think about your options, and I would like to see you in 2 weeks. Hi, Susan. My name is Dr. Smith, and I am one of the doctors here. So, tell me, what brings you and your daughter here today?
Well, doctor, Jennifer was recently diagnosed with COPD, and we have to start her treatment. The problem is that I'm worried about the costs of her treatment. Our family is on a tight budget right now, you know.
Thank you for sharing this with me, Susan. I appreciate it must have been a difficult time for you and your family to deal with her diagnosis, and at the same time worry about the cost of Jennifer's treatment. But don't worry. We are here to help you in every step of the way. Before we talk about your daughter's treatment, I would like to talk to you a little bit about COPD. Would that be all right?
Sure, doctor.
Thanks, Susan. Could you tell me what do you know about COPD?
Not much, to be honest.
No problem. Let me tell you a little bit about it. COPD is a group of lung diseases that block airflow and make it difficult to breathe. Smoking and air pollution are the most common causes of COPD. Is it clear so far?
Yes, it is, doctor. I actually feel guilty of Jennifer's condition. Most of our neighbors smoke, and many times the smoke comes through the window. I feel responsible for her condition.
You shouldn't feel this way, Susan. I can reassure you that COPD is not your fault. Cigarette smoke is a common cause for this disease, but it is not the only one. It might have been caused by irritants, lung infections, air pollution, and even genetics. Do not take this on yourself because there could be numerous reasons why Jennifer has developed COPD.
I'm glad to hear that. And what are her treatment options?
That's a great question, Susan. Jennifer's doctor has prescribed her oral and inhaled corticosteroids, bronchodilators, and inhaled antibiotics.
Oh, wow. Just by hearing you saying, I can already see that she will have to take 3 different types of medications, and I don't know if we will be able to afford all that.
Thank you for sharing your concerns with me, Susan. I really appreciate it must be something complicated to add to your budget. On the other hand, it doesn't mean that Jennifer is going to need all the 3 medications at the same time, all the time. We are going to make sure she receives the right amount of medication according to her symptoms. The management of the medication is individualized for each patient. This means that we will make sure she only takes the minimal amount of medicine necessary for her symptoms, so there will be no unnecessary use of medication for her. By being very careful with the amount of medication Jennifer will take, we can make sure that it won't be a huge burden on your budget. Do you have any questions about it?
I still feel that there is too much for us to handle, you know, buying 3 different medicines for her.
I understand, Susan, but you are not alone. We are going to contact your health insurance to check if the medication that Jennifer needs is included in their approved list. This way, your health plan will help you pay the cost of the prescription medications, so it will be less expensive for you. What do you think about it?
Wow, this is great news, Doctor. Thank you very much for all your help.
You're more than welcome, Susan. So let me call and check with your health plan to see if they can help you pay for Jennifer's medication. Then you can start your daughter's treatment as soon as possible. How does that sound?
It sounds great.
Awesome. Is there anything else you would like to ask me?
No, that would be all, Doctor.
All right. I will call your health plan, you will buy Jennifer's medication, and you will start her treatment right away. Then, I would like to see Jennifer here in 2 weeks to see how she is doing. Hi, John. Welcome. My name is Dr. Smith, and I'll be taking care of you today. Could you tell me what brings you here today?
Yes, doctor. I have been suffering from back pain, and it has already started to affect my daily activities.
I'm really sorry you have been experiencing this pain, John. To start with, I would like to ask you a few questions about your pain. Would that be all right?
Certainly.
Thanks, John. Do you remember when this pain first started?
Probably 3 months ago, but it got worse about 3 weeks ago.
On a scale from 1 to 10, how much does it hurt?
I'd say it is a 7.
Okay. Does it hurt all the time?
The pain is more severe when I'm at work. If I'm at home, lying on the sofa or in bed, then it doesn't hurt that much.
Got it. Have you tried any pain medication?
I've tried some painkillers that I bought at a drugstore. They helped during the first few days, but now I feel a lot of pain even when taking these pills.
I understand. Do you exercise daily?
No, I do not. I haven't been to the gym for more than 15 years.
What type of work do you do?
I work as an accountant in an office, morning and afternoon, from Monday to Friday.
Do you have a healthy diet?
Not really, doctor. Many times I wake up late for work, so I skip breakfast. For lunch and dinner, I don't like cooking, so I always order fast food.
I see. Based on your symptoms and on the information you have given me, it is essential for us to treat your pain. Back pain can be caused by arthritis, herniated disc, or spinal stenosis. If we leave it untreated, it might lead to more serious problems such as permanent disability. Is it clear so far?
Yes, it is. Is it possible to treat it?
Yes, it is. The main treatment involves changing your lifestyle in order to strengthen the muscles on your back. While you are at work, you shouldn't spend so many hours only sitting in a chair. Every hour you must stand up and walk around the office for at least 5 minutes. Use this time to go get a glass of water or to exchange information with your coworkers. In addition, to strengthen your back muscles, we need to start doing a few lifting exercises at least 3 times a week. These exercises can be done at home, but it is important to do them every week. I will give you this leaflet here that explains how to do these exercises at home. If you can scan the QR code in the back of this leaflet, it will show you a YouTube video showing how to perform these exercises. I strongly recommend you to continue taking over-the-counter painkillers for the first 2 weeks. Will you be able to do all this?
Yes, I will.
That's great, John. I will refer you to an occupational therapist who is going to assess your occupational risk at work. I would like to encourage you to talk to your employer about providing you with better working conditions, such as a new chair and even a new desk. Can you do that?
Yes, doctor.
Wonderful. In addition, let's try to improve at least one of your meals every day. I imagine you don't have a lot of time for lunch. Am I right?
Yes, you are.
Okay. So for lunch, you may occasionally eat some fast food. However, try to replace burgers and pizzas for sandwiches, for example, and substitute soda or juice for water. As far as dinner goes, I would like you to have a proper, healthy meal every night. Will you do that?
Yes, I will, doctor.
That is a very important decision, John. Having a healthier diet will help you lose weight, and this will help you to have more energy, strengthen your health as a whole, and reduce the load on your muscles. We have talked about quite a few changes to be made in your lifestyle from now on. Just to make sure you have understood everything, could you tell me what these changes are in your own words?
Sure. I have to walk around every hour at the office, do lifting exercises, keep taking the painkillers for 2 weeks, talk to my boss about some possible changes in my work environment, and have a healthier diet. Did I miss anything?
You were spot on. I would like to see you again in 2 weeks to see how you have been doing after starting these changes in your life. My secretary will talk to you on your way out to book your review appointment. Is there anything else you would like to ask me, John?
No, that would be all. Thank you so much, doctor. Hi, Jennifer. Welcome. My name is Dr. Johnson, and I'll be taking care of your child today. Could you tell me what has happened to Jack?
Yes, doctor. He has had diarrhea for 3 days, and I'm worried he might be dehydrated. I suspect this diarrhea might have resulted from Jack consuming something toxic when we were having the fence painted the other day.
I understand, Jennifer. I would like to ask a few questions about Jack's condition to assess what has happened to him. Would that be all right with you?
Sure, doctor.
Thank you, Jennifer. Has Jack had any fever?
Yes, he has, especially at night when he has night sweats.
I see. Has he lost his appetite?
Yes, he has.
Have you given him any medication?
No, not at all. I was afraid of giving him anything before talking to a doctor.
You did the right thing, Jennifer. Has Jack ever had any allergies?
No, not really.
Thank you for all this information, Jennifer. First, let me reassure you that we are going to send a sample of Jack's stool to a lab in order to confirm if it is down to bacteria.
I'm so worried about him, doctor.
I know how you feel, Jennifer. Don't worry because Jack is in good hands. We are going to make sure he recovers as fast as possible. This prolonged diarrhea may have been caused by cross-contamination, summertime, or even improper hand washing. As soon as the exams come back from the lab, we will have a clearer picture.
Is there any medication that we can give him right now?
Not yet, Jennifer. The best thing I recommend him right now is rehydrating. It is important for you to give him some over-the-counter solutions because Jack needs to drink plenty of fluids. However, make sure he doesn't drink any sodas or sweet drinks, as these will only worsen his symptoms. Is it clear so far?
Yes, it is, doctor.
Wonderful, Jennifer. I must also advise you about which foods he can consume for a few days. It would be best to give him rice, apples, and potatoes to help ease his stomach. Can you manage that?
Certainly, doctor.
All right. Is there anything else you would like to ask me?
No, that would be all, doctor.
Great, Jennifer. My secretary will call you to schedule another appointment with Jack as soon as the test results from the lab are ready. Meanwhile, I'll give you this leaflet here that explains more about diarrhea in children, and in the back of the leaflet, you have my phone number in case you need anything.
Hi, Jennifer. Welcome to our health center. My name is Dr. Smith. May I ask what brings you here today?
Yes, doctor. I have received a diagnosis of deep vein thrombosis, but I don't really know what it means. I came here today to understand it better and to learn more about my treatment.
You've come to the right place, Jennifer. First, I would like to explain to you what thrombosis means. Deep vein thrombosis occurs when a blood clot forms in one or more of the deep veins in the body, usually in the legs. Deep vein thrombosis can cause leg pain or swelling. Sometimes there are no noticeable symptoms. We have to be careful with it because complications can lead to gangrene or a stroke. Is it clear so far?
Yes, it is, doctor. Does that mean that I'll have to start taking medication?
Not yet, Jennifer. The first step in order to prevent further damage from the thrombosis is to start a daily walk, every day, for 30 minutes, without any stop or chat with a neighbor. Can you do that?
Well, doctor, another change? I mean, I have already quit drinking and smoking after a heart attack I had 2 years ago and the cancer I had last year. I feel that if I have to start exercising now, it will be another change in my life, and I'm really fed up with continuous lifestyle changes. Wouldn't it be better to just start taking medication instead of walking?
I really appreciate your concern, Jennifer, and I know that introducing yet another change in your life can be tough. However, if we start walking, you'll be avoiding medication. Taking medication might seem like an easier way to recover, but it will actually make you dependent on medication for the rest of your life. From my experience, treating hundreds of other patients with the same symptoms as you, I can reassure you that daily walk is the best medicine you could ask for. Let's do the following. You will start with a 5-minute walk for the first week, then a 10-minute walk for the second week, a 15-minute walk for the third week, and so on. This way, we will give your body time to adjust to this new routine. Will you be able to start with the 5-minute walk for 7 days?
Yes, I will, doctor.
I'm so happy for you, Jennifer. I can reassure you that you have just made the best decision. As you keep on going with your daily walks, in as little as 1 week, you will already notice the difference in your health. You will have more energy to do your activities, and the symptoms of your deep vein thrombosis will be gone before you know. I would like to see you here again in a month to see the results of your daily walks. Is there anything you would like to ask me?
No, doctor. That would be all, thanks.
You're more than welcome, Jennifer. I'll give you this pamphlet here that explains more about deep vein thrombosis and the benefits of regular exercise such as walking. In the back of the pamphlet, you will find my phone number, so please feel free to call me if you have any questions. Hi, Jennifer. My name is Susan, and I am the nurse in charge here at the emergency department. I heard you wanted to see me, so tell me, what can I do for you?
Yes, nurse. I was told that I will need a blood transfusion, and I am really scared of it.
Thank you for sharing that with me, Jennifer. It's totally normal to feel a bit scared the first time you have a blood transfusion. Would you mind telling me what is on your mind?
Well, I have heard that people have contracted HIV through blood transfusion, and I don't want that to happen to me.
You are right, Jennifer. It has happened in the past. Nowadays, there is a very small possibility of infection in blood transfusions. In order to prevent it from happening, all our blood donors are screened, and the blood is always tested for viruses. This way, we keep risks to a minimum. Is there anything else you would like to know?
Yes, nurse. What is the procedure like?
That's a great question, Jennifer. The first thing you must know is that we are very careful to have sterile conditions during the blood transfusion. All the blood is stored in special medical bags. We then have a bag connected to an intravenous line, and a sterile needle is inserted into one of your veins. During the whole process of blood transfusion, we monitor your vital signs in order to make sure everything is all right with you. Is it clear so far?
Yes, it is very clear. Thank you. However, I'm still a little bit afraid of it. Is there any other way to avoid a blood transfusion?
I appreciate you sharing your concerns with me, Jennifer, and I understand how you might be afraid of it. However, you have lost quite a lot of blood during the road accident. Thus, a blood transfusion is the only way for you to fully recover. This way, we will be replacing the blood you have lost, and it will have a positive effect on blood volume and circulation. After my explanation, do you feel more comfortable about starting your blood transfusion?
Yes, I do, nurse.
Wonderful, Jennifer. I am so happy you have agreed to it. Now I will call the doctor for you to sign the patient consent form. Then I will establish an IV access and check your identification. Do I have your permission to bring the doctor for you to sign the consent form?
Yes, you do.
Great, Jennifer. I will be back in a second. Good morning, Ms. Smith. My name is Jennifer, and I am one of the nurses in charge at the local hospital. Your general practitioner has asked me to visit you today to talk about your diabetes. May I come in?
Sure, come on in.
Thank you, Ms. Smith. Dr. Johnson asked me to come here to talk about your diabetes. As you know, he has mentioned that you have had high blood sugar levels lately. Due to this situation, only diet and oral medication have not been enough to keep your diabetes under control. From now on, your doctor has decided to commence insulin injections, and you will need to start taking insulin injections every day. How do you feel about giving yourself insulin injections?
Well, actually, I am a little bit afraid of it.
Do you mind if I ask you why?
It's because I'm afraid of hurting myself while giving myself the injections.
Thank you for sharing that with me, Ms. Smith. It is totally fine to feel a little bit nervous about giving yourself the insulin injections, and I am here to help you feel more confident about it. Let me reassure you that you will be able to apply the injections by yourself, and I will be with you while you do it for the first time to make sure you do it right. It is all about practice. Let me tell you about the procedure of injecting insulin. First, it is important for you to choose where you are going to inject the insulin. The most common area is in your tummy. Then, you're going to pinch your skin and insert the needle into the pinched skin at a 90-degree angle. The needle should be all the way into your skin. Push the plunger of the syringe until all of the insulin is out of the syringe. Finally, quickly pull the needle out. Is it clear so far?
Yes, it is.
In order to avoid bruises, it is important to choose different parts of your tummy every time you inject insulin. Sometimes you will choose the right side of your tummy, sometimes the left side, and sometimes in the middle of your tummy. Are you following?
Yes, I am. But I am still afraid that I will make a mistake and hurt myself while trying to inject it.
I appreciate you sharing this with me, Ms. Smith. But let me tell you that the needle for the insulin injection is very thin and very short, so there is no chance that you will hurt yourself. Let me reassure you that you are going to be able to do that by yourself, and I'm here to guide you all the way through. Besides that, today I will be observing you as you inject your first insulin. Then, I'll be checking on you tomorrow again, just to make sure you are doing it the right way. By the second day, you will feel more comfortable, but I will still check on you every day for a week in order to help you. Will you feel more comfortable if I come here every day for a week to watch you inject yourself insulin?
Oh, yes, nurse, I'd appreciate it.
Then it is set. I will also leave you this leaflet here that explains in detail how to inject yourself with insulin. In the back of the leaflet, you have my phone number, so feel free to give me a call if you need anything. The last thing I would like to teach you is about safe needle disposal. You must not reuse the insulin needles. You will use each injection only once. Immediately after you inject yourself, you must put the used needles in this cardboard container that I have brought for you. This is the only container that can keep the needles out of the reach of anyone, making sure nobody gets hurt. Is that clear?
Yes, it is, nurse.
All right then. Are you ready to give yourself your first insulin injection?
Yes, I am.
Hi, John. My name is Dr. Smith, and I am one of the doctors in charge of the emergency department. I am here to discuss the details of your discharge. How are you feeling right now?
Well, doctor, to be honest, I am a little disappointed. I was supposed to travel to Europe this weekend, but now I guess I'll have to postpone my plans.
I'm really sorry your plans have changed, John. But at the same time, I would like to reassure you that the most important thing you can do right now is to rest. Are you feeling any pain right now?
At the moment, I am feeling fine. I'm just afraid that the pain might get worse as I arrive home.
Thank you for sharing this with me, John. I would like to reassure you that you can take painkillers at home if you continue feeling pain. In addition, I would like to tell you a little bit on how you can take care about the cast when you arrive home. Would that be all right with you?
Sure, doctor.
Great. In order to fully recover, you must keep your leg raised on a pillow and avoid damping. If it is itchy, do not poke any objects in it because you might hurt yourself. Is it clear so far?
Yes, it is. And when am I going to have the plaster cast removed?
The plaster cast will be removed in 2 months. At that time, we are going to take another X-ray of your leg to see if the tear in your anterior cruciate ligament has healed. Now, an ACL tear does not heal easily. This ligament is a strong band that helps connect the femur to the shin bone. Even if we take the best care possible of your leg, you still run the risk of not being 100% healed in 2 months.
But what would happen then? Would I need some kind of physiotherapy?
Not yet, John. First, we will have to take a look at that second X-ray that will be taken 2 months from today. Only then we will be able to decide on what to do next. But I have to warn you that there is a small possibility of surgery in case your ligament is not 100% healed by the time the 2 months are over.
Oh, wow. I was not expecting that at all. Surgery? How long will I be able to walk after that?
Well, John, first let me reassure you that you do not need to worry about the surgery right now. What I can tell you for sure is that by resting at home, you will be reducing the risk of surgery considerably. If your ACL tear is completely healed after this 2-month period, I am sure going to prescribe you physiotherapy sessions. If it has not healed completely, we might need to consider surgery. But right now, you shouldn't worry about the surgery. You should focus on resting to make sure we give your ligament all the time it needs to fully recover. Is it clear so far?
Yes, it is, doctor.
Great, John. I'll go ahead and proceed with the paperwork so that you can be discharged home today. I will be back in 5 minutes.
Hi, Jennifer. Welcome to our clinic. My name is Dr. Jones. So, tell me, what brings you here today?
Well, doctor, I had never thought of being pregnant before, but now I want to have a child. However, I am already 39 years old, so I feel I'm already too old to become a mother. I came here today to discuss my possible options.
Thank you for sharing this with me, Jennifer. You've come to the right place. In order to present you possibilities for you to have a child, I would like to first ask you a few questions to understand your lifestyle nowadays. Would that be all right with you?
Sure, doctor.
Great. First, do you have a healthy diet?
Not really. Normally, I wake up late to go to work, so I skip breakfast. I have half an hour for lunch, which only allows me to grab something quick to eat, such as a slice of pizza or a burger. For dinner, I also eat some junk food.
Got it. Do you smoke?
Only 2 cigarettes a day.
Okay. Do you drink alcohol?
Yes. Normally 2 cans of beer every night, or sometimes half a bottle of wine.
Okay. Would you say you have a stressful routine?
Not really. I mean, I have quite a few demands at work, with deadlines and such, but nothing too stressful.
Thank you for all this information, Jennifer. Based on what you have told me, let me reassure you that it is possible for you to conceive naturally. However, there are some changes we need to make in your lifestyle in order to help you prepare to become a mother. The first thing we need to do is avoid alcohol. In addition, I am going to refer you to a dietitian so that you can start having a healthy diet, and she might even recommend a couple of supplements that you may take, such as vitamins. Finally, it is important for you to include exercises in your daily routine as well. Is it clear so far?
Do I really need to do all this?
Yes, Jennifer. I would like to stress out the importance of a healthy lifestyle and diet for both you and your baby.
What if I can't conceive naturally?
That's an excellent question. In case you can't conceive naturally, we will try alternative therapies. The first one we are going to try is egg donation. It is similar to sperm donation, and the child can still adopt to your womb.
But in this case, the baby will not have my DNA, right?
You're right, Jennifer, but the most important thing is the love and upbringing of your child. You don't have to decide on it right now. Take your time, and I will write the referral letter to your dietitian. It is important to start the lifestyle changes as soon as possible in order for you to have your baby, either conceiving naturally or with the aid of therapy. Is there anything else I could help you with?
No, that would be all, doctor.
All right. I would like to see you again in 4 weeks to see how you have been doing with the changes I've mentioned, and at that time, I can also answer new questions that you might have about different therapies to help you conceive. Please take this leaflet with you, as it explains more about the benefits of having a healthy and active lifestyle before you conceive your child. In the back of the leaflet, you have my phone number. Feel free to give me a call if you have any questions. Hi, Mr. Jones. I have just completed an assessment of your wife's needs, and I would like to discuss full-time care options with you. Would that be okay? Sure, nurse. Wonderful, Mr. Jones. Tell me, how have you been managing to take care of your wife since our last visit?
Well, to be honest, it hasn't been easy. I had been caring for her at home for 2 years, but recently I felt obligated to return to work in order to make more money to pay for her medical bills. Since I have to be at the office morning and afternoon, I feel worried that I have to leave Mary alone at home.
Thank you for sharing this with me, Mr. Jones. Let me reassure you that you are doing an excellent job, doing all you can to provide for your family and to take care of your wife at the same time. It is not easy to both work and take care of Mary. I have just assessed your wife, and due to her condition, she needs constant monitoring and round-the-clock assistance. Would it be possible for you to give up work again in order to take care of Mary all day long?
No, that is not an option. Unfortunately, I need to work in order to make more money to pay for exams, consultations, and medicine.
I totally understand, Mr. Jones. I appreciate it must be a challenge for you. In this moment, your wife needs someone to help and to watch over her during the whole day. Since you can't be with her during the day because you have to work, we have to find a way not to leave her alone. I would like to outline 2 different options, a full-time carer or a nursing home.
I don't think we would be able to afford a full-time carer.
No problem, Mr. Jones. I would like to suggest another option. How about a nursing home?
Do you think they will take good care of her in a nursing home?
Certainly. At a nursing home, she will have benefits such as a high level of round-the-clock care, experienced staff, and even the change of meeting other people with whom she can talk during the day and make new friends. This would allow you to work during the day while someone is taking care of her. Then you can spend the evenings together. How does that sound?
It sounds interesting, but there are so many nursing homes around the city. How can I choose the right one?
I can help you with that for sure. I have made a list of the requirements needed for your wife so that we can make sure the location you choose will be ready to provide her with the best care possible. With this list in hand, you can visit different locations around the city and even talk to staff and residents to see where Mary would feel more comfortable. I have brought a leaflet for you with all the nursing homes in your area. This way you can give them a call and schedule visits to check them out. In the back of the leaflet, you also have my phone number. Feel free to give me a call if you have any questions while searching for a nursing home. Is there anything else you would like to know?
No, that would be all, nurse. Thank you so much.
You're more than welcome, Mr. Jones.
Good morning, John. Welcome to our clinic. My name is Dr. Smith, and I'll be taking care of you today. I'm really sorry our appointment is running late. There have been too many patients here today, more than we had expected. But tell me, what brings you here today?
I have been suffering from a sore throat and difficulty speaking for 3 days in a row, and I'm starting to worry that there might be something wrong with me.
Don't worry, John. I'm glad you've come here so I can examine you and help you find out what is happening. To begin with, I would like to ask a few questions in order to understand your symptoms. Would that be okay?
Yes, doctor.
All right. Is it the first time you've ever felt these symptoms?
Yes, doctor.
Okay. When did these symptoms first appear?
3 days ago.
Besides the sore throat and difficulty speaking, have you experienced any other symptoms?
Yes, I've had a mild fever and an irritating cough.
I'd like to examine you, John. Can you open your mouth, please? All right. Based on the symptoms you have described and on my physical examination, I have concluded that you are suffering from laryngitis. Laryngitis is an inflammation of the voice box from overuse, irritation, or infection.
Is it possible to treat it?
Most definitely. Let me reassure you that there is no need to worry, as laryngitis usually goes away within 7 days.
7 days? I'm sorry, doctor, but that is too long. I have a very important meeting with a client, and I will have to present our new project for her. I need to recover faster for this meeting. Is there any kind of medication that I could take in order to heal faster?
Unfortunately, there is no quick way to recover. In order to heal completely, you need to avoid whispering, drink plenty of fluid, and especially rest your voice.
Rest my voice? But how about my meeting where I have to speak?
I appreciate you've been worried about your job, John. However, your health is not 100% right now, and you must focus on not using your voice in order to recover well. Using your voice right now will just make your symptoms worse, and it will take you much longer to heal. Don't you agree that it is better to stop speaking for 4 more days in order to recover?
Yes, I agree, doctor.
Another important part of your treatment is drinking tea and honey, along with gargling and ginger root. But again, the most important thing to do is to rest your voice. Will you do that?
Yes, I will, doctor.
I'm happy to hear that, John. I want to schedule another appointment 5 days from today so that I can see how you have recovered. I really encourage you to follow my guidelines in order to heal completely and to avoid worsening your symptoms. Is there anything else you would like to ask me?
No, that would be all, doctor. Thank you so much.
You're more than welcome, John. Have a great day, and I'll see you in 5 days.
Good morning, Jennifer. My name is Dr. Smith, and I will be taking care of your child today. May I confirm his name, please?
Sure, you can call him Ryan.
Thank you, Jennifer. So tell me, what has happened to Ryan?
He has been bitten by a tick. We've tried to remove the tick to the best of our skills, but anyway, we brought him to the emergency as soon as we could. Right now, he is not in so much pain, but I overheard my neighbors saying that there have been many cases of Lyme disease in our city, and that got me really worried. I brought him here to see if he needs to be hospitalized or something. Better be safe than sorry, right?
You've made the right decision to bring him here, Jennifer. Let me reassure you that there is no need for concern right now. I have just examined the area where he was bitten, and you did an excellent job removing the tick. We have already checked all his vital signs, and fortunately, everything is all right with Ryan. I would like to explain to you a little bit more about Lyme disease. Would that be all right?
Sure, doctor.
Lyme disease is a disease caused by spirochetes bacteria transmitted by an infected tick from the blood of deer, horse, dog, or mice. Its signs and symptoms include fever, headache, and specific rash. We have already checked your son's temperature, and right now he doesn't have a fever. As I can see in the area where he was bitten, there are no signs of rash. Has Ryan complained of any headaches?
No, he hasn't.
Has he actually complained of anything else?
No, not really.
All right. These are good signs.
Do you think he will need to be hospitalized and maybe have a few exams done?
Those are very good questions, Jennifer. I appreciate your concern towards Ryan, but let me inform you that it is too early to have an examination done. A blood test for Lyme disease does not show positive results until 6 weeks after the person has been bitten. Of course, we will keep Ryan here for a couple of hours to monitor vital signs before we can discharge him home, but there is no need to worry.
What if he has Lyme disease after 6 weeks? Wouldn't that be too late to start treatment?
Thank you for your questions, Jennifer. In case Ryan presents symptoms of Lyme disease after 6 weeks, I will prescribe him a course of antibiotics, which are safe and effective against Lyme disease. While we wait for this 6-week period, it is important for you to continue monitoring Ryan to see if he develops fever, or if he has any headaches or rash near the area where he was bitten. If you notice any of these symptoms, bring Ryan here so we can take care of him. Aside from that, he can go on normally with his school life, playing with friends, and even participating in all sports activities he enjoys.
I'm so glad to hear that, Doctor.
Is there anything else you would like to ask me, Jennifer?
Not really, Doctor. That would be it for today.
Let me give you this leaflet here, which contains more information on Lyme disease. In the back of the leaflet, you have my phone number. Feel free to give me a call if you have any questions.
Thanks, Doctor.
You're more than welcome, Jennifer. My nurse will continue observing and checking on Ryan for about 2 hours. Then, I'll come back here, and if everything is fine with Ryan, you'll be able to take him home with you today.
Hi, Mrs. Smith. My name is Jennifer, and I am the nurse in charge here at the Children's Hospital. How is Mary feeling right now?
She is a little bit better, thanks for asking. But I'm nervous because we have been waiting here for a long time, and the doctor hasn't seen her yet.
I'm really sorry you and your daughter have to go through such a long waiting here. I would like to apologize in behalf of our hospital. The emergency department has been busy, much more than usual. As soon as the doctor becomes available, he will be over here to see your daughter. While we are waiting for the doctor, I need to take Mary's vital signs. Would that be all right with you?
Sure, nurse.
Thank you so much, Mrs. Smith. Right now, Mary is doing great, but I'm going to continue observing her. While we wait for the doctor, I would like to ask you a few questions about Mary's condition. Is it okay with you?
Certainly.
Could you tell me what Mary was feeling when you brought her here?
Yes. She was suffering from chest tightness, wheezing, and dyspnea. I am very anxious to talk to the doctor so we can figure out what is happening with Mary.
I understand, Mrs. Smith. And how long has Mary been having these symptoms?
They actually started 2 days ago. Do you think she might have asthma?
Unfortunately, I cannot give you any diagnosis at the moment. Only the doctor will be able to tell you what is happening to Mary. He will perform a thorough medical assessment in order to provide a diagnosis. While you are talking to him, feel free to ask him any questions you might have about your daughter's symptoms. Right now, I can reassure you that your daughter is fine. I have been checking all her vital signs, and everything is in normal range. I am doing everything possible to take care of your child, and she is stable now. We just have to wait a little bit longer for the doctor to attend. Don't worry, because I will be with you and Mary the whole time, and if anything changes in her condition, I will be able to assist her right away. Feel free to grab a cup of water for both you and Mary while we wait for the doctor. I need to continue taking Mary's vital signs in order to inform the doctor of any changes that might have happened in her symptoms from the moment she arrived here, or the hospital. Is there anything you would like to ask me?
No, that would be all, nurse.
All right, Mrs. Smith. If anything comes to mind, feel free to ask me while I continue taking your child's vital signs.
Hi, Miss Johnson. Welcome to our clinic. My name is Dr. Smith, and I will be taking care of you today. How have you been since you were discharged home last week?
Well, I am still walking slowly, but I feel that I am improving a little bit more each day.
That's great to hear, Ms. Johnson. And you are here today to talk a little bit more about your diagnosis. Am I right?
Yes, you're right.
Great. First, I would like to explain you what osteoporosis is. It is a disease which makes the patient have fragile bones. This disease develops over time and is normally diagnosed after a fracture. Is it clear so far?
Yes, it is. Does this disease happen to me because I am old?
Well, Ms. Johnson, age is one of the factors that might contribute to osteoporosis, but it is not the only one. It might happen due to many other factors, such as family history, changes to hormones, diet, hyperthyroidism, and so on.
And is it possible to treat it?
Well, Ms. Johnson, unfortunately, osteoporosis is not reversible, but medication, a nutrient-dense diet, and weight-bearing exercises can help prevent further bone loss and rebuild bones. In addition, I would like to prescribe vitamin D supplement and calcium to be taken every day. Any questions until here?
Not yet.
Great. Let me reassure you that you may have day-to-day social care arranged. This way, every day one of our nurses is going to visit you to make sure you're taking your vitamins, you are doing your exercises, and also making sure you have any help that you might need around the house. This way, we will be always checking on you, and you will not feel alone. How does that sound?
That actually sounds very good, Doctor.
I'm glad to hear it, Ms. Johnson. I would also like to encourage you to participate in the senior exercise group that we have here at our clinic. It is a social prescribing program where you will meet other senior citizens, and a highly qualified physical educator will guide you and the group through gentle exercise to keep your body moving.
Well, dear, don't you think I'm too old to start exercising?
Not at all, Ms. Johnson. My father also takes part in this program, and he is already 91 years old. He couldn't be happier. Besides helping to protect your bones and muscles, it can be a lot of fun to make new friends. And don't worry about your age. The instructor is well aware of the condition of each and every patient, and he knows how to be careful with the group and also with the exercises performed. You should come to one of the classes next Wednesday just to meet the instructor and watch the class from afar to see if you will like it. If you do, in the following week you can start attending the class. What do you say?
I will give it a try.
I'm so happy for you, Ms. Johnson. I know you won't regret it. Finally, I am going to arrange a home assessment with an occupational therapist. He is a professional who will assess your home in order to see how we can prevent future falls. Is there anything else you would like to ask me?
No, that would be all, Doctor. You've been very kind. Thank you so much.
You're more than welcome, Ms. Johnson. So I will tell the exercise group instructor that you will go to his class as a visitor next week. I would like to see you again in 2 months to see how you are progressing. And if you need anything, feel free to give me a call or send me a message through the nurse that will provide you with daily social care. Hi, John. Welcome. My name is Dr. Smith, and I'll be taking care of you. What brings you here today?
Well, doctor, I have had this horrible pain in my left ear, and it really bothers me. It has been hard to concentrate at work or at university. To make matters worse, this morning, I noticed some pus on my pillow when I woke up, and that really scared me.
Thank you for sharing this with me, John. I'm sorry you have been going through that. Would you mind if I examined your left ear?
No problem. Go ahead.
Thanks, John. Based on your symptoms and in my examination, I can conclude that you are suffering from severe otitis media. Have you ever heard of it?
Not really.
I will explain it to you. Otitis media is inflammation or infection located in the middle ear. Otitis media can occur as a result of a cold, sore throat or respiratory infection.
And why was there pus on my pillow?
Let me explain the mechanism to you. There was an infection buildup of pus behind your eardrum. The recent small perforation that I saw on the left eardrum allows to reduce the pain. The pus, which was previously under pressure, is released to flow freely to the outside. Is it clear so far?
Yes, it is, doctor. Do you think this might affect my hearing somehow?
That is an excellent question, John. Let me reassure you that this is not an unusual occurrence with this condition. This perforation will heal readily, and there will be no permanent effect on hearing.
That's a relief, doctor.
It sure is.
And is there any way we can treat it?
Sure, John. Let me outline the treatment for you. I'm going to prescribe you a 7-day course of broad-spectrum antibiotic. At the end of the course, we are going to have a review appointment to see how you are doing, and I will also be able to reassess the perforation. If your hearing deficits continues after this 7-day period, it will be necessary to order audiological testing, but I can only tell you that 7 days from today.
Besides taking the antibiotics, is there anything else I should do?
I'm glad you asked, John. I must advise you against any activities that involve pressure change, such as aircraft flights and diving.
Oh no, that's terrible. You see, I really enjoy scuba diving with my friends every weekend.
I appreciate it must be frustrating for you to hear this, John. I wish there was something we could do about it. Unfortunately, if you want this inflammation to heal completely, you must give up diving while you are recovering. Otherwise, your inflammation will only get worse, to a point where there is no return and where you would have permanent hearing loss. You don't want that to happen to you, do you?
No, not at all. I guess I will just have to wait.
That is the best decision you could make, John. Here is the prescription for the antibiotics. You will take them for 7 days. My secretary will make an appointment for you 7 days from today, when we are going to review your condition. I will also give you this leaflet here that explains more about otitis media and the best practices to avoid this kind of inflammation in the future. Is there anything else you would like to ask me?
No, that would be all, doctor. Thank you very much.
You are more than welcome, John. Have a great day, and I will see you in a week.
Hi, John. Welcome to our general practice. My name is Dr. Smith, and I will be taking care of you. I read from my notes that your team coach brought you here today. Could you tell me what happened?
Sure, doctor. I was warming up during basketball practice when all of a sudden I got this strong pain in my left knee to the point that I couldn't walk.
I'm really sorry you're going through that, John. Would you mind if I asked you some more questions about your injury?
Not at all.
Thanks, John. Is it the first time you felt this pain in your left knee?
No, it has happened before. But when it happened, it didn't used to hurt as much as it does now.
I understand. When did it happen for the first time?
About 3 months ago.
Were you doing the same activity when it happened?
Yes, I was warming up at the basketball practice.
I see. What did you do the first time you felt this pain?
I stopped walking for about 20 minutes. Then the pain kind of disappeared, so I went back to practice.
Got it. Would you mind if I examined your left knee?
No problem. Go ahead.
Thank you, John. Based on your symptoms and in my examination, I can conclude that you have a meniscus tear. The meniscus is a C-shaped piece of cartilage that acts as a cushion between the shin bone and thigh bone. Each knee has 2 menisci. Also referred to as a cartilage tear, a meniscus tear can occur as a result of a forceful twist or rotation of the knee. Is it clear so far?
Yes, it is, doctor. Is there any way we can treat it?
Sure thing. We are going to start with an immediate treatment called RICER. RICER stands for Rest and Protect the Injured or Sore Area. Ice or a cold pack used as soon as possible. Compression or wrapping the injured or sore area with an elastic bandage. Elevation of the injured or sore area. Referral to a physiotherapist. Do you have any questions so far?
Yes, would it be possible to take some painkillers?
In this case, pain medication is not effective on its own. You might take nonsteroidal anti-inflammatory medications such as ibuprofen and naproxen, which can help to reduce inflammation and pain caused by a meniscus tear. However, dealing with the pain is only part of the process. You actually need to rest in order to allow your meniscus to heal.
And why do I need to see a physiotherapist?
That's a great question, John. The physiotherapist will provide you with an appropriate exercise plan. He will create a recovery strategy, and he will also guide you through more specific treatments that will make sure you can recover completely.
Is there any chance I could start this regimen that you've mentioned and the physiotherapy sessions next week? I have a very important game this weekend, and I don't want to miss it.
I am sorry to be the bearer of bad news, John, but unfortunately, you will not be able to play this weekend. Actually, you won't be able to play at all for several weeks. You must start your RICER regimen right away. Delaying this treatment, and even worse, practicing sports before healing completely, will only make your meniscus tear worse. It might lead even to a point where you might never be able to play basketball again. If you ignore my advice and try to play this weekend, it might be the end of your career as a basketball player. Is it something that you would like to see?
No, doctor, not at all.
I'm glad to hear that. Then, let's start the RICER regimen right away so we can avoid further damage to your knee. You will start with the rest, ice, compress, and elevation today. Your first session with the physiotherapist will be 7 days from today. During that session, he will talk to you about the amount of exercise that can be done in order to guarantee a full recovery of your meniscus. Is there anything else you would like to ask me?
No, that would be all, doctor.
Great. Your appointment with the physiotherapist is already booked for next week. I would also like to see you in 2 weeks to check on how your recovery process is going. If you need anything, here is my phone number. Feel free to call me anytime. Hi, Susan. My name is Jennifer, and I am the nurse in charge here at the dialysis unit. I heard you wanted to see me. What can I do for you?
Hi, nurse. Today is my father's first hemodialysis treatment, and I would like to know a little bit more why he is doing this and what is the procedure like.
I understand, Susan. First, I would like to explain to you why your father is having these dialysis sessions. He suffers from a condition called kidney failure, which is the end stage of kidney disease. Your father's kidneys are unable to remove waste and unable to control fluid levels. Is it clear so far?
Yes, it is.
Good. About the hemodialysis process itself, the blood is slowly removed via thin needle. It is filtered by machine and then returned to the body via second needle. It takes approximately 4 hours per session.
4 hours? Isn't it too long? My father is already 81 years old, so I'm worried that he might not be able to wait that long.
Thank you for sharing your concerns with me, Susan. Let me reassure you that your father will be comfortable during hemodialysis. The chair where he will be sitting is very comfortable, and he will be able to sleep, read books, and even watch TV. It is extremely important for your father to attend these dialysis sessions because they reduce the risk of emergency hospitalization, and they help to increase life expectancy. Is there any question you would like to ask me about the sessions?
No, it is very clear.
I'm glad to hear that. There is something else I would like to ask you. Do you have anyone else in your support network who can help you take care of your father?
Yes, there is. When I have to work or to run some errands, my sister stays with him. This way, he is never left unattended. Our only difficulty is that we don't have a car nowadays, so when we have to bring him to the dialysis sessions, we need to take 1 bus and 2 trains.
Thank you for sharing this information with me, Susan. I'm so happy to hear that you have your sister to help you. As far as taking public transportation, let me advise you to use our hospital assistance, which is available for carers. This way, we can schedule our van to bring you and your father here for the dialysis sessions and take you both back home when the sessions are over. This is a service free of charge, and it will be much better for your father to come here and to go home using our transportation. Are you interested in this free service?
I sure am, nurse. Thank you so much.
You're more than welcome, Susan. You can book our community transport right here at the reception. Is there anything else you would like to ask?
No, that would be all. Thanks.
Hi, John. Welcome to our clinic. My name is Mary, and I will be assisting you today. Just to confirm the reason for your visit today, you are here to remove the stitches, clean, and redress your wound. Am I right?
Yes, you are right, nurse.
Before I remove the stitches, I would like to talk to you a little bit about the lesion on your hand. Would that be all right with you?
Sure.
Thank you, John. The diagnosis of what happened to your hand is called squamous cell carcinoma. This is a type of skin cancer caused by sun exposure and by ultraviolet radiation. Let me reassure you that your surgery was very effective, as the lesion was completely removed and the cancer is unlikely to spread. I would like to emphasize that it is extremely important for you to monitor your skin by checking new or changing spots, as well as having regular doctor checkups with the doctor. Is it clear so far?
Yes, it is.
Is there anything you would like to ask about carcinoma?
Yes, there is. Do you think I might need another surgery in the future?
That is a very good question, John. However, I do not have permission to give you information about further surgery. I strongly suggest you speak with your doctor in order to find that out. Do you understand?
Yes, I do.
How have you been handling your exposure when in the sun?
I have been wearing long sleeve shirts, a hat, pants, and I have been applying sunscreen on my hands and ears. In addition, I always avoid leaving the house between 10 a.m. and 4 p.m.
Those are excellent habits, John. Please continue that way in order to fully recover from your surgery and to avoid future skin problems. From now on, you need to be extra careful with prevention of skin problems in order to prevent further damage. Have you felt any pain, or have you noticed any discharge post-surgery?
As far as pain goes, I felt a little bit of pain and discomfort around the area of the stitches on my hand on the first 2 days. Starting from the 3rd day, I didn't feel so much pain. As for discharge, I haven't noticed anything on the stitches.
Thank you for that information, John. So, now we are going to proceed with the removal of your stitches. We have waited these 2 weeks after your surgery to make sure the wound had enough time to heal. Your doctor has already assessed you, and he wrote here in your medical record that you are ready to have your stitches removed. After I redress your wound, you have to keep it clean, covered, and dry. Do I have your consent to have the stitches removed?
Yes, you do.
Thanks, John. Hello, Mr. Smith. Welcome back to our clinic. My name is Dr. Johnson, and I will be with you today. I have received the results of your biopsy. I'm deeply sorry to have to tell you this, but the results have confirmed that you have a 2-centimeter tumor confined to your bowel wall.
Tumor? What do you mean, doctor?
I know this is incredibly difficult to hear, but you have cancer.
My goodness, I can't believe it.
It's completely understandable if you're feeling overwhelmed right now. Please know that you're not alone, and we're here to provide you with the care and support you need.
And what do I have to do now?
I am going to write an urgent referral to a surgeon. Surgery is the best option for you right now because we don't want this tumor to grow or to spread. I want to emphasize that we'll do everything we can to fight this together. Your well-being is our top priority.
Am I going to need chemotherapy?
Yes, Mr. Smith. The management of the illness after surgery may include chemotherapy and radiotherapy, depending on the spread of the tumor. However, you will only go through these therapies if you consent. You are not going to be obligated to do them. Do you have any questions about the surgery?
Yes. Am I going to need a colostomy?
Based on the results of your colonoscopy, it is unlikely that you will need a colostomy, considering that the tumor is confined to the descending colon.
I don't know what to say. How can I tell this to my family?
I appreciate this is a difficult moment for you, Mr. Smith. I would like to encourage you to be optimistic about the surgery. The success rates of this type of surgery are usually high, especially because the biopsy indicates that the tumor is limited to the bowel wall. When it comes to how to tell your family, in most cases, doctors have an ethical obligation to respect patient confidentiality and privacy. However, there are situations where informing the patient's family about a cancer diagnosis may be necessary or beneficial. If you consent to sharing your medical information with your family members, I can communicate the diagnosis to them. As hard as it can be, family members often serve as a crucial support system for patients facing serious illnesses like cancer. Informing them about the diagnosis can help facilitate emotional and practical support for you. Another important point is that knowing about a family member's cancer diagnosis can be important for other family members' medical histories and may influence their own healthcare decisions. However, if you explicitly request not to disclose the diagnosis to your family, healthcare providers must respect your wish. You don't have to make your decision right now, but I would like you to consider these points that I have just presented to you. Do you have any other questions at this time?
Not really, doctor.
All right, then I am going to contact the surgeon that is going to perform your surgery. I will write your referral letter for him, and I want you to meet with him as soon as possible to discuss details of the surgery. Hello, Mr. Smith. Welcome to our clinic. My name is Dr. Johnson, and I'll be taking care of you today. I have here in my notes that you have been experiencing pain and swelling in your right shoulder. Am I right?
You're right, doctor.
All right. In order to help you, I will need to ask you a few questions about your symptoms. Would that be all right with you?
Sure thing.
Thanks, Mr. Smith. Could you tell me when you began experiencing this pain?
It was about 3 weeks ago.
Do you remember what you were doing at that time?
Yes, I was playing cricket with my friends.
Did you fall during that game?
No, I didn't.
Did you feel any acute pain that day?
No, I didn't. Do you think I injured my shoulder at that game?
Not really, Mr. Smith. If you had injured your shoulder, you would have experienced some serious pain. How often do you play cricket?
I normally play it in my spare time on weekends.
Is it every weekend?
Yes, every weekend.
I see. Have you ever injured your shoulder?
Not that I can remember.
Do you mind if I examine your shoulder?
No problem. Go ahead.
Thanks, Mr. Smith. Based on your symptoms and in my physical examination, I have concluded that you have bursitis. Bursitis is an inflammation of the fluid-filled pads that act as cushions at the joints. Bursitis occurs most often in joints that perform frequent repetitive motion. Symptoms include pain, swelling, and stiffness. Common areas include the knees, shoulders, elbows, and hips. Do you have any questions about it?
Yes, is it possible to treat it?
Sure, Mr. Smith. Treatment includes rest, ice, and pain relievers. You must rest your shoulder and not resume playing cricket until the swelling has gone down. Is it clear so far?
But cricket is my favorite activity. Isn't there even a small chance to play it?
No, there isn't. If you go back to playing cricket before healing completely, you will be putting your shoulder at risk. There will be a higher chance for it to become a chronic condition, even including the need for surgery. Let me tell you that if you need to go under surgery, recovery, rehabilitation, and physiotherapy will take you from 6 months to a year, and then you will have to abandon cricket forever. Is it something worth risking?
No, not at all, doctor.
Then I strongly suggest you follow my recommendations. Besides resting your shoulder, I would suggest you start physiotherapy 7 days from today. This way, we will be better able to manage your condition. In addition, it would be good for you to start wearing joint protections so that your shoulder will not move so much during daily activities. Will you be able to do that?
Sure, doctor.
Great, Mr. Smith. I will also schedule a follow-up appointment with you 30 days from today to see how your shoulder is healing. Would that be okay with you?
Yes, doctor.
Wonderful. I'll give you this leaflet with more information on how you can be more careful in the future while playing cricket so that you can avoid new injuries. Hi, Mrs. Smith. My name is Dr. Johnson, and I have received the result of your CT scan, and we have confirmed that you have been diagnosed with diverticulitis. Have you ever heard of diverticulitis?
Not really.
Don't worry, I'm going to explain it to you. Diverticulitis is an inflammation of the diverticula, which are outpockets of the bowel mucosa. The exact reason why diverticula develop is not known, but they are associated with not eating enough fiber. Is it clear so far?
Yes, it is.
Good, Mrs. Smith. Does anybody in your family have any history of diagnosis related to the bowels?
Yes. My mom died of bowel cancer. Do you think I might have bowel cancer?
At this moment, you do not have bowel cancer, Mrs. Smith. Knowing that you have a family history of bowel cancer is very important for us. With this information, it is highly advisable for us to work on the prevention and early detection of any further complication in your bowel system. Do you have any questions about it?
Yes, I do. Am I going to need to undergo surgery?
No, Mrs. Smith. Surgery related to the gastrointestinal system is a lengthy and complex process, requiring a team of specialists to carry out the operation. Therefore, it is only used as the last resort. The best decision for your case right now is to have a 7-day course of antibiotics here at the hospital, where we will be able to monitor your progress and wait for your condition to settle down.
But how could you be so sure I don't have cancer?
I appreciate your concern, and it is totally normal to feel anxious. Let me reassure you that we are doing everything possible to identify any changes that could lead to early detection of cancer. Besides taking this 1-week course of antibiotics, we need to modify your diet in order to have a healthier one. We are also going to heighten awareness of subtle changes in bodily functions that can aid in the early detection of potential cancerous symptoms, prompting timely medical intervention for better prognosis. We are going to schedule regular checkups to monitor your progress, and you might need to have a colonoscopy done. A colonoscopy is a medical procedure involving the examination of the large bowel and of the small bowel. This examination is performed using a fiber optic camera that will allow us to see how well your bowels are recovering. Is it clear, Mrs. Smith?
Yes, it is.
It is crucial for you to avoid constipation and to maintain a high-fiber diet and soft stool consistency. Are there any other questions that you would like to ask me?
No, that would be all, doctor.
All right. I will talk to the nurse in charge, and we are going to start your treatment with antibiotics right away.
Hi, Mr. Smith. My name is Dr. Roberts, and I am the doctor in charge here at the intensive care unit of the Children's Hospital. The nurse said you wanted to ask me a few questions about your daughter's condition. How could I be of assistance?
I'm a little bit worried about her diagnosis. The nurse said the test results are not ready yet, and my wife and I are concerned about our daughter's condition.
I understand how you feel, Mr. Smith. Thank you for sharing that with me. I have just spoken to the nurse, and she said that Mary is stable right now, and she is out of risk. Let me reassure you that she is receiving the best care possible. We haven't received the full test results yet, but as soon as we do, I will analyze them and share the results with you. What I can tell you for sure is that when Mary was admitted to the emergency yesterday, she was suffering from anaphylactic shock, almost certainly as a result of a food allergy. She is currently recovering after the administration of adrenaline. We are going to confirm the allergen as we administer diagnostic tests. Are you familiar with what an anaphylactic shock is?
Not really, doctor.
Then let me explain it to you. An anaphylactic shock is a severe and sometimes life-threatening immune system reaction to an antigen that a person has been previously exposed to. The reaction may include itchy skin, edema, collapsed blood vessels, fainting, difficulty in breathing, and even death.
My goodness, I didn't know that it could be so serious.
Yes, it is very serious. Thankfully, you were able to bring Mary to the hospital as soon as you noticed there was something wrong with her.
Is it something that she is going to have for the rest of her life?
We don't know for sure yet, Mr. Smith. It is a fact that many children outgrow allergies.
Will she need any kind of medication?
That's an excellent question, Mr. Smith. When the allergen is identified, Mary must always avoid it. In order for the prevention to be effective, we have to inform all supervising adults of the problem, the causes, and the dangers it can lead to.
And what happens if she accidentally comes in contact with the allergen again?
We are aware of this possibility. That's why, from now on, you must always have an EpiPen auto-injector in Mary's backpack. In case she has an allergic episode in the future, you or any other supervising adult must be ready to give her this adrenaline injection. All you have to do is to place the orange tip of the EpiPen against the middle of the upper leg, at a right angle to the thigh. Then, you have to swing and push the auto-injector firmly until it clicks. The click signals that the injection has started. Hold firmly in place for 3 seconds, counting slowly 1, 2, 3. Is it clear?
Yes, it is, doctor.
Good, Mr. Smith. Immediately after you inject her with the EpiPen, you must seek urgent medical assistance at the closest hospital. This way, the doctors and nurses will make sure nothing happens to her. Will you do that?
Sure thing, doctor.
Wonderful. We'll keep Mary under observation for a few more hours. As soon as she is ready to be discharged, I will let you know. Is there anything else you would like to ask me?
No, that would be all, doctor. Thank you so much.
You are more than welcome, Mr. Smith. I will give you this leaflet here that explains more about anaphylactic shocks and how to use an EpiPen. In the back of the leaflet, you have my phone number. Please don't hesitate to call me if you need anything.
Good morning, Mr. Smith. I am Patrick, the occupational therapist from the hospital. May I come in?
Sure, come on in.
Thank you, Mr. Smith. It is a lovely house you have.
Thanks, Patrick.
Well, Mr. Smith, I would like to confirm the reason for today's visit. You have requested a home reassessment because of a recent escalation of your symptoms. Am I right?
Yes, you're right.
Good. Could I ask you what are your main concerns nowadays?
Sure. I want to make changes to my home to make my life easier and to be safer when my symptoms get worse.
Got it. I would like to ask you a couple of questions about your symptoms. Would that be all right?
Yes.
Great. Could you explain to me a little more which of your symptoms have worsened?
Definitely. The main thing that I have noticed is the trembling in the hands and legs, and also the loss of balance. Both started getting worse a few weeks ago.
And have you been taking your medication regularly?
Yes, every day at the same time. In the beginning, these symptoms were well controlled with medication, but now the medication isn't working as well.
I'm sorry to hear that, Mr. Smith. May I ask who lives with you?
Yes. That would be my wife and my 2 teenage children.
Understood. Could you tell me more about your difficulties with activities of daily living?
Yes.
Let's start with cleaning.
Well, if I'm feeling tired, I don't want to waste my time cleaning. I'll always do it later on, or sometimes on the next day.
Do you have any difficulties while showering?
Yes, I do. I've been having baths because I'm worried about losing my balance and falling over in the shower.
Okay. How about cooking?
Cooking is difficult and a little dangerous because my hands tremble.
Thank you for sharing this information with me, Mr. Smith. The first recommendation I would like to give you is to simplify tasks in the kitchen. In order to conserve energy, you can ask your wife or your kids to do certain activities such as chopping or slicing vegetables and peeling fruits. It is interesting to keep kitchen items such as utensils and appliances accessible. Can you do that?
Sure.
Great, Mr. Smith. As far as cleaning goes, your children are already teenagers. So, there are quite a few activities related to cleaning that you can delegate to them. For example, vacuuming the floor, clearing the table after meals, and doing the laundry. You can still supervise them, but they will be doing the heavy work. Do you have any questions so far?
Yes, I do. I was wondering what else can be done to make the hallway safer.
That's an excellent question. My suggestion would be to install rails both in the hallway and in the bathroom. This way you can feel safer while walking in the hallway and when standing in the shower. Additionally, we can improve the lighting of the hallway and make sure we leave fewer power cords visible, thus reducing the risk of falls. Will you be able to do that?
Yes, I will.
Very good, Mr. Smith. Let me reassure you that today I am going to perform a home assessment, where I am going to observe you doing your activities of daily living. Then, based on my observation, we are going to discuss the need for additional aid or equipment that will make your life easier. Together, we will decide what are the priorities when it comes to modifications in the house, and we will set an action plan to make sure these changes will be made as soon as possible. Is there anything else you would like to ask me?
Yes. Many times I don't feel very safe when I am home alone.
Thank you for sharing that with me, Mr. Smith. In this case, it is essential for us to plan what you are going to do when you are home alone. We are going to print an emergency contact list, which will include your wife's contact number, as well as the telephone number for the hospital, police, and firemen. We are going to save all these numbers on the speed dial of your phone to make sure you can easily access them at any time. Another important point is to regularly talk to your wife and children about your symptoms and the kind of help you need. You can have increased community support and involvement from our hospital, such as participating in support groups and even having a nurse coming here to check on you at least 2 times a week. How do you feel about these ideas?
I believe these suggestions sound very helpful.
I'm glad to hear that, Mr. Smith. If it is okay with you, I would like to start the home assessment now. Do I have your consent to start the assessment?
Sure.
Good morning, Deborah. Welcome to our Community Health Center. My name is Claire, and I am the nurse in charge. I can see this appointment was scheduled on behalf of your mother. Am I right?
Yes, you're right.
Could you please confirm her name?
Yes, it is Susan Smith.
Thank you for the confirmation, Deborah. So tell me, how has your mother been?
She is doing fine, thanks for asking.
I'm glad to hear. And what brings you here today?
I'm a little concerned about her health condition. She couldn't explain exactly what her diagnosis was, so I decided to come here to try to understand it a little bit better.
You've come to the right place, Deborah. Your mother has a condition called high cholesterol. Cholesterol is a waxy, fat-like substance made in the liver and found in the blood and in all cells of the body. Cholesterol is important for good health and is needed for making cell walls, tissues, hormones, vitamin D, and bile acid. There are 2 main types of cholesterol: low-density lipoprotein, LDL, or bad cholesterol, and high-density lipoprotein, HDL, or good cholesterol. Too much LDL cholesterol in your blood increases your risk for coronary artery disease and other heart diseases. Is it clear so far?
Yes, it is. Now I'm really worried about her.
Let me reassure you that your mother's diagnosis is a common condition. When we are able to manage the levels of cholesterol, we reduce the risk of cardiovascular disease.
Does that mean that my mom will have to start taking some kind of medicine?
Not yet, Deborah. But in order to manage her cholesterol levels, we might need to introduce a few changes in her lifestyle. To tell you more about these changes, I would need to ask you a few questions about your mother's lifestyle. Would that be all right with you?
Sure.
Thanks. First, could you tell me what is her diet like?
Yes. In the morning, I know that she likes to drink black coffee with sugar and eat at least 3 slices of bread with butter. For lunch, she normally eats fried chicken, and she doesn't like eating any salad. For the afternoon snack, she enjoys black coffee again, with 3 or 4 slices of bread with butter. In the evening, she eats fried chicken again, no salad.
Okay. Does she do any regular physical activity?
No, not really. After she retired, she spends the whole day at home watching TV or browsing the internet.
And does she drink any alcohol?
Yes, she drinks about half a bottle of wine every night.
Thank you for your answers, Deborah. Based on the information you have provided me, I would like to suggest a few changes to help control your mother's cholesterol levels. The first thing we need to do is to reduce the amount of fried food that your mother eats. Not only for the saturated fats present in the oil used to fry the chicken, but also because restaurants normally add a lot of salt when preparing the food to be fried. Second, it is important to reduce the amount of wine that your mother drinks. I can see that she likes wine, and we don't have to remove it completely from her diet. However, half a bottle of wine every evening is too much for her. My suggestion would be to allow her to drink a small glass of wine only 3 times a week. If we make these changes in her eating and drinking habits, we will be contributing to better control her cholesterol levels. Will you help your mom with these changes?
Yes, I will.
That's great, Deborah. Another important activity to help keep your mother's cholesterol under control is to introduce gentle exercise. She doesn't need to go to the gym, but it is important for her to walk at least 30 minutes a day, 5 days a week. Can you help her with this change as well?
Sure, nurse.
If you are able to help your mom to introduce these changes in her diet and in her physical activities, she will start seeing the benefits in the levels of her cholesterol. Is there anything else you would like to ask me?
No, that would be all, nurse. Thank you so much.
You're more than welcome, Deborah. I will give you this leaflet here that contains important explanations and information about cholesterol. In the back of the leaflet, you will find my telephone number. Please do not hesitate to give me a call if you have any questions about your mom's condition or treatment. Hi, Deborah. Welcome to our clinic. My name is Dr. Smith, and I'll be taking care of you. Could you tell me what brings you here today? Sure, doctor. I have had very itchy eyes for the past 3 days. It had never happened to me before, so I'm a little worried about it. I'm really sorry you've been going through that, Deborah. I'm glad you came here so that we can find out what is happening to you. To begin with, I would like to ask you a few more questions about your symptoms. Would that be okay with you?
Yes.
Good. Could you tell me how long the discharge has occurred?
It started 3 days ago.
Is the discharge clear or purulent?
It is a green, sticky discharge from the eyes, which has made my eyelids stick closed together, especially when I wake up from sleep.
I see, Deborah. Have you had a cold recently?
I had a cold a little over a week ago.
Which symptoms did you have for that cold?
I had a fever, a sore throat, and runny nose.
Thank you for sharing this information with me, Deborah. Based on your symptoms and on my physical examination, my initial diagnosis is conjunctivitis. Viral conjunctivitis is typically caused by a virus that can also cause the common cold.
Is it possible to treat it?
Sure thing. It often resolves on its own, but treatment can speed the recovery process. Allergic conjunctivitis can be treated with antihistamines. You will also need to apply a compress to your eyes. To make a compress, soak a clean, lint-free cloth in water and wring it out before applying it gently to your closed eyelids. Is it clear so far?
So far, so good. Will I need to have any kind of test done?
While not common, if we think that bacteria are causing pink eye, or if the infection is severe, we may want to do testing. In this case, I'll use a soft-tipped stick, swab, to collect secretions from around your eye, then send the sample to a lab. The lab will run tests to find out what's causing your pink eye. Do you have any other questions about conjunctivitis?
And could this happen again in the future?
Unfortunately, yes. If you come into contact with the bacteria or virus again, you could get conjunctivitis again.
Could this also affect my vision?
Let me reassure you that it should not affect your vision permanently. In order to prevent recurrent conjunctivitis, there are a few things you must do. It is essential for you not to touch your eyes with your hands. It is important to wash your hands often and to use a clean towel and washcloth daily. You must not share towels, washcloths, or even bed linen with your family as this condition is contagious. I strongly recommend you to throw away old eye cosmetics and do not share eye cosmetics or personal eye care items. Can you do that, Deborah?
Yes, I can, doctor.
That is wonderful. Most of the time, conjunctivitis, also known as pink eye, clears up within a few days to 2 weeks. I would like to schedule an appointment with you 2 weeks from today, just to see if you are recovering well. Would that be all right with you?
Yes, doctor.
Great, Deborah. On your way out, please talk to my secretary in order to schedule a review appointment. I'll also give you this leaflet, which explains in more detail what to do when we have pink eye. Is there anything else I could do for you?
No, that would be all, doctor. Thank you so much.
You're more than welcome, Deborah. In the back of the leaflet, you have my phone number, so feel free to give me a call if you need anything. Hi, Deborah. My name is Dr. Smith, and I am the doctor in charge here at the clinic. The nurse has told me that you presented here with severe flank pain. Am I right?
Yes, doctor.
Okay. She also told me that you looked pale and were walking with difficulty due to the pain. Is that right?
Yes, it is.
All right. What I would like to do first is to take a urine specimen in order to send to the lab so we can understand more clearly what is happening to you. Would that be all right?
Sure, doctor.
Okay, Deborah. I have just received the results from the lab, and we have found blood in your urine. This is a very serious condition, and I advise you to go to a hospital immediately.
What do you think is happening to me, doctor?
Based on your symptoms and on the results of the lab exams, I suspect you might have renal calculi, most commonly known as kidney stones. Kidney stones are hard deposits of minerals and acid salts that stick together in concentrated urine. They can be painful when passing through the urinary tract, but usually don't cause permanent damage. The most common symptom is severe pain, usually in the side of the abdomen, that's often associated with nausea. Treatment includes pain relievers and drinking lots of water to help pass the stone. Hospital treatment is necessary because medical procedures may be required to remove or break up larger stones. Is it clear so far?
Yes, it is. And what are they going to do with me at the hospital?
First, the doctors will take an X-ray to find the position of the stones. Then, they will use laser treatment to break up the stone. And open surgery is very unlikely. Do you have any other questions?
Yes, I do. I am terrified of hospitals. Isn't it possible to have these procedures here at the clinic?
Thank you for sharing your concerns with me, Deborah. Let me reassure you that you will be in good hands at the hospital. Unfortunately, it is not possible to have these procedures here at the clinic because we don't have the necessary equipment for it. Is there anything else you would like to ask me about the hospital?
Yes. I am allergic to penicillin. Can you make sure they know that?
Of course, Deborah. I am writing this information in your medical records right now. In addition, I will send a transfer letter to the hospital with all your medical records, the results of today's exams, and also your allergy to penicillin. I would like to assure you that this way, the team at the hospital will be ready to give you all the attention you need, and you will not be given penicillin. Is there anything else you would like to ask me?
No, doctor. That would be it. You've been very helpful. Thank you so much.
You're more than welcome, Deborah. I will now write your transfer letter so you will be taken to the hospital as soon as possible. Do I have your permission to call an ambulance for you?
Yes, you do.
Great, Deborah. I will call an ambulance for you right now, and I will be back in 1 minute with your transfer letter. I have already contacted the hospital, and everything is ready for your arrival there. Hi, Deborah. Welcome to our clinic. My name is Dr. Smith, and I'll be assisting you today. I can see that this appointment is on behalf of your son, Daniel. Am I right?
Yes, you're right, doctor.
All right. Could you tell me what has happened to Daniel?
He has had a sore throat and fever for 2 days, and I noticed blood in his urine this morning.
Okay. Thank you for this information. Daniel looks unwell right now. I have just measured his temperature, which is quite high at 38.5. Would you mind if I examined him?
Not at all, doctor. Go ahead.
Thanks, Deborah. I can see that his throat is swollen and red, and there is exudate on the tonsils. I am going to order a full ward test for him. Okay, now the results of the test are back, and it confirms that there is blood in the urine. Based on the symptoms you have described on my examination and on the results of the test, my initial diagnosis is bacterial tonsillitis with kidney involvement. Tonsillitis is an inflammation of the 2 oval-shaped pads of tissue at the back of the throat. Tonsillitis is usually caused by a bacterial infection, and the symptoms include sore throat and difficulty swallowing. Is it clear so far?
Yes, it is.
Good. Daniel's condition requires further investigation and an urgent appointment with a pediatrician. To begin his treatment, I would like to start a course of antibiotics, with penicillin to be more precise.
But doctor, are you sure we need to give him penicillin? It might be just a sore throat after all.
I understand your concern, Deborah. If it were only the sore throat, we could decide on a different treatment. However, blood in the urine is quite dangerous. For this reason, we'd better start with antibiotics in order to prevent his symptoms from getting worse over time. There is a connection between the infection and the blood in the urine. The body produces extra antibodies to fight the infection, and these settle in the kidneys, causing inflammation. Is it clear why we must start with antibiotics right away?
Yes, it is. And what are the next steps?
That's an excellent question, Deborah. Daniel will start taking the antibiotics right now. Meanwhile, I will book you an appointment with the pediatrician right here at the clinic. I'm just adding a few notes to Daniel's medical records, then I will write a referral letter for the pediatrician so that she will know what to do. The pediatrician is going to monitor Daniel's urine and blood pressure and make sure his recovery is complete. Do you have any other questions?
Yes, I do. Will Daniel have to stay in the hospital?
Yes, Deborah. That will be the best decision right now. Being at the hospital, we can observe his symptoms and his initial response to the antibiotics. In addition, the pediatrician will be able to check on him in a few minutes. Don't worry, because Daniel is in good hands. We will be constantly checking his vital signs, and you can stay with him so that he won't feel alone here at the hospital. I will go and call the pediatrician to meet you and Daniel right away, but if you have any questions, do not hesitate to ask me or her.
Thank you, Doctor.
You're more than welcome, Deborah. I'll be back in a minute. Hi, Ms. Smith. Welcome to our clinic. My name is Dr. Jones. How have you been since you were discharged from hospital?
I've been recovering little by little. Thanks for asking.
I'm glad to hear that. May I ask what is the purpose of your visit today?
I came here because I've felt much weaker and very tired since the heart attack. I am worried that any physical activity, such as walking, gardening, or swimming, might bring on another heart attack.
Thank you for sharing your concerns with me, Ms. Smith. First, let me reassure you that fatigue is to be expected as you were discharged from hospital only 4 days ago. It will probably take you from 4 to 6 weeks for the return of your full energy levels. I would like to remind you that the heart attack recovery is a gradual process. In order to help your recovery, we might need to introduce a couple of lifestyle modifications and even make use of medication in order to aid. I would also like to emphasize the importance of exercise for your heart health. Exercises strengthen your heart, and they are important for your overall health as they help to lower your cholesterol levels. Do you have any questions so far?
Yes. I'd like to know how much physical activity is advisable.
That's an excellent question, Ms. Smith. In terms of exercising, I will recommend you to practice moderate physical activity. Your recovery has been uncomplicated, and it has already been 2 weeks since your hospital admission. It is advisable to join a cardiac rehabilitation program where you will have increasing exercise tolerance under supervision. May I ask what type of work you do?
I am an office worker, so I sit at a desk all day, and I don't get much exercise at work.
In this case, I would only suggest a gradual return to work after at least 4 to 6 weeks after discharge. It is important for you to be physically and mentally ready to go back to work. There is no need to rush back to work. We should plan your return to work and check with your employer what kind of assistance and support they will be able to give you. Do you have any other concerns?
Yes. I'm actually worried about having another heart attack, so I'd like to know what I can do to reduce the risk of further attacks.
That is an excellent question, Ms. Smith. Let me reassure you that it is totally normal to have this type of concern. In order to prevent future attacks, I would like to recommend 2 major changes in your lifestyle. The first one is related to your diet. You must include more vegetables and whole grains to your daily diet. The second one is related to being physically active. The more you exercise, the more your body will be fit, and you will be able to be better prepared to live a healthy life. Do you have any other questions?
No, that would be all, Doctor. All this information has been very helpful. I will try to gradually do more exercise, and I will look into the rehabilitation program.
I'm glad to hear that, Ms. Smith. I will give you my phone number, so do not hesitate to contact me at any time if you have any other questions. Hi, Deborah. Welcome to our clinic. My name is Dr. Jones, and I'll be assisting you today. First, I would like to confirm the reason for today's appointment. You are here for a follow-up on your son's asthma diagnosis. Am I right?
Yes, you're right, Doctor.
Got it. So tell me, how has John been since he was discharged from the emergency department?
Actually, his asthma hasn't been so bad. He has had only 1 attack since he was diagnosed at the emergency department.
And were you able to manage his condition at home?
Yes. I used the inhaler and the spacer that were given to him at the hospital.
And how was the effect of that treatment?
It seemed to help his symptoms.
I'm so glad to hear that, Deborah. I would like to ask you a few questions on further relevant details for his follow-up on his asthma diagnosis. Would that be all right with you?
Sure, doctor.
Good. Does anybody in your family have a history of asthma, eczema, or hay fever?
No one in our family has asthma or eczema, but I usually get mild hay fever in the summer.
All right. Does anyone in your family smoke?
No, nobody.
Good. How often do you clean the house?
We usually keep the house really clean.
I'm glad to hear that. Have you noticed anything that could have triggered his attack?
I think he has attacks after he has been running about outside.
That could be. Exercises could trigger asthma attacks, especially when done in cold air. Childhood asthma is a chronic lung condition when we observe tightening or narrowing of muscles and airways, as well as swelling, inflammation, and production of extra mucus. One of the risk factors that may contribute to it is family history of hay fever. Do you have any questions so far?
Yes. I found the diagnosis really overwhelming, and I'm not sure how I'm going to be able to help him manage his asthma.
Thank you for sharing this with me, Deborah. Let me reassure you that a child's asthma is manageable. We are going to monitor John constantly, and you will have full support available here at our clinic. Asthma is managed by identifying and controlling triggers, assessing the severity of the symptoms, knowing how to respond in urgent situations, and informing your child's school. You are not alone, and we will do everything we can to provide the best care for both John and you. You can count on us anytime.
Thank you for the comforting words, doctor. Now I feel a bit more reassured about managing my son's asthma.
I'm glad to hear that, Deborah. Our next steps are very important. First, I would like to examine John. Then, we are going to create an action plan where we are going to discuss his treatment. In addition, we are going to organize all the support you will need, and I am going to schedule monthly follow-up appointments in order to help you take care of your child's symptoms. If you don't mind, I would like to examine John now. Would that be possible?
Sure, doctor. I'll go and get my son right away so that you can examine him.
Excellent. I'll be waiting for you both here. Hi, Mr. Smith. Welcome to our clinic. My name is Dr. Jones, and I'll be taking care of you today. Could you tell me what brings you here today?
Sure, doctor. I think I am a bit overweight and I am concerned that I may have diabetes. Recent publicity about diabetes on the internet has made me decide to get a checkup.
I'm glad you've come here so we can talk about your worries. Besides being a little overweight, have you felt anything different lately?
Yes, I have been feeling tired and unwell lately. Sometimes I feel dizzy, thirsty, and breathless. And I also have itchy skin.
I'm really sorry you have been going through that, Mr. Smith. I would like to ask a few questions about your lifestyle in order to understand your symptoms. Would that be all right with you?
Yes, doctor.
How often have you exercised lately?
Unfortunately, I haven't exercised at all lately. I have a very busy and stressful office job and 3 teenage children, which leaves me no time to exercise. If it is diabetes, I would like to know how it would be treated.
Thank you for sharing this information with me, Mr. Smith. I would like to discuss with you the possible significance of your symptoms. It might be possible that these symptoms might have been caused by an underlying condition such as diabetes. However, I would like to reassure you that your symptoms could also have different causes. Diabetes is only one of the possible causes. If it comes to diabetes, don't worry about it because this is a condition that can be managed. Is it clear so far?
Yes, it is.
As you mentioned that you have seen publicity on the internet about diabetes, I would like to explain for you the 2 types of diabetes. Diabetes type 1 and type 2 come from different causes. In diabetes type 1, the pancreas does not make insulin because the body's immune system attacks the islet cells in the pancreas that make insulin. In diabetes type 2, the pancreas makes less insulin than used to, and your body becomes resistant to insulin. In order to treat diabetes, we can make use of medication, establish a diet, start exercising, and monitor your blood glucose. Do you have any questions so far?
Well, doctor, this information is very helpful, but I'm not sure what to do next.
Thank you for sharing your concerns with me, Mr. Smith. Let me tell you about your next steps. First, I'm going to order a diagnostic blood test. When the test results are ready, My secretary will call you to schedule a return visit for me to show you these test results. If diabetes is confirmed, we will assess your health and lifestyle. You will have an appointment with a dietitian. We will set a plan for your exercises, and I will prescribe you the daily medication you will take to keep your symptoms under control. Is that clear?
Yes, it is, doctor. I will do a blood test and make an appointment to discuss the test results.
I'm glad to hear that. Is there anything else I could do for you today?
No, doctor, that would be all.
All right. Our nurse will take you to the lab to collect your blood. I would like to give you this leaflet here that explains more about diabetes and also shows the benefits of doing exercises and controlling one's diet in order to make the most of the treatment. In the back of the leaflet, you also have my phone number, so feel free to give me a call if you have any questions. Hello, Mr. Smith. My name is Dr. Jones, and I am the doctor in charge here at the emergency department. How are you feeling?
I'm feeling a little bit better, doctor.
I'm glad to hear it, Mr. Smith. I've just received the results of your examination, and fortunately, there is nothing wrong with your stomach. You will be able to go back home as soon as I prepare your discharge papers.
But doctor, isn't it better for me to spend the night at the hospital just in case the pain gets worse?
No, there is no need to, Mr. Smith. According to hospital policies, only patients with acute symptoms are allowed to spend the night at the hospital. I know that you arrived here with acute stomach pain, but the pain has subdued, hasn't it?
Yes, it has.
For this reason, you will be able to go home, get some rest, and then you will need to book an appointment with the GP in your area. Is that clear?
Well, doctor, actually, I am a little afraid of going to the doctor. I normally feel anxious around doctors, and I get a high blood pressure reading.
Thank you for sharing this with me, Mr. Smith. We quite often see patients who have the white-collar syndrome, and it is okay for you to feel a little bit nervous about talking to a doctor. However, the emergency department should only be used by patients who need urgent care. From what I read in your notes, you started having this acute stomach pain after eating too much at a wedding reception. Is that right?
Yes, it is a...
Okay, so this is not exactly an emergency. Next time you must book an appointment with the GP in your area, and if needed, he can refer you to a specialist. When was the last time you were at your GP?
Well, doctor, I'm new to the city, so I haven't been to the GP yet.
Okay, Mr. Smith. In this case, I strongly recommend you see the GP in your area, talk about your symptoms, and he will provide a treatment plan for you. Do you have any other questions?
Shouldn't I stay a bit longer at the hospital and maybe perform a few more tests just in case the pain comes back?
I'm really sorry, Mr. Smith, but you cannot stay longer at the hospital. There is no urgency in your condition. If the pain comes back, you may take some painkillers that you can find over the counter at drugstores. We will not perform additional exams because they are not necessary. The most important step now is for you to go home, get some rest, and call your local GP first thing in the morning to book a follow-up appointment with him. Is that clear?
Yes, it is, doctor.
Great. I will go ahead and prepare your discharge letter, and you will be ready to go home. Good morning, Miss Smith. My name is Dr. Jones. Thank you for coming in today. How have you been feeling?
I've been experiencing this intense pain and rash along my side. It's been really uncomfortable.
I'm sorry to hear that. Let's delve into your symptoms a bit more. When did you first notice the pain and rash?
It started about a week ago with this tingling sensation, and then the pain gradually got worse. The rash appeared a couple of days after that.
I see. It sounds like it might be shingles, which is caused by the varicella zoster virus, the same virus that causes chickenpox. Have you had chickenpox before? Yes, I had it when I was a child. That's important information. So, let me explain a bit more about shingles. It's a viral infection that causes a painful rash, usually on one side of the body. The rash typically develops into clusters of blisters that can be quite uncomfortable.
That sounds exactly like what I'm experiencing.
Based on your symptoms, I'll prescribe some antiviral medication to help alleviate your symptoms and speed up the healing process. Additionally, it's important to get plenty of rest and avoid any activities that may exacerbate the pain. Applying wet compresses to the blisters can also provide some relief.
Okay, thank you for the advice. Is there anything else I should know about managing shingles?
Yes, it's important to keep the affected area clean and dry to prevent infection. Avoid scratching or picking at the blisters, as this can lead to further irritation and potential scarring. And if the pain becomes too severe, Over-the-counter pain relievers like ibuprofen or acetaminophen can help.
Got it. Is there anything I should be aware of in terms of complications?
While most cases of shingles resolve on their own within a few weeks, there can be complications, especially in older adults or individuals with weakened immune systems. These can include post-herpetic neuralgia, where the pain persists even after the rash has cleared, or bacterial skin infections. However, with prompt treatment and proper care, the risk of complications is greatly reduced.
Thank you for explaining that. I'll make sure to monitor my symptoms closely.
You're welcome. Now, regarding your living situation, since shingles is contagious to those who haven't had chickenpox or been vaccinated against it, I advise against visiting your parents for the next few days.
I understand. I'll let them know.
Great. And let's schedule a follow-up appointment for 3 weeks from now to assess how you're progressing and adjust your treatment plan if necessary. In the meantime, if you have any concerns or notice any changes in your symptoms, don't hesitate to reach out. Thank you, Doctor. I really appreciate your thoroughness and guidance. Of course, Miss Smith. It's my pleasure to help. Take care, and we'll see you soon.
You too, Doctor. Have a good day.
Thank you. Goodbye, Miss Smith. Good morning, Mr. Smith. My name is Dr. Jones. I understand you're here on behalf of your father, Harry. How can I assist you today?
Yes, doctor. Thank you for seeing me. It's about my dad, Harry Smith. He's been having some trouble since he fell at home a couple of days ago. He's got a lot of bruising and pain in his thigh.
I see. I'm sorry to hear that. Given his history of atrial fibrillation and anticoagulant use, any fall or injury can be worrying. Have you brought him in for an assessment?
No, not yet. I was hoping you could prescribe something for the pain. Maybe Panadine Forte.
I understand your concern for your father's comfort, but I can't prescribe medication without first examining him. It's essential to ensure the most appropriate treatment and avoid any complications, especially considering his medical history.
But he's just in a lot of pain, and I thought this would help.
I appreciate your perspective, but with patients on anticoagulants like warfarin, it's crucial to assess the extent of any injury thoroughly. There's a risk of internal bleeding or other complications that might not be immediately apparent. That's why a proper evaluation is necessary.
I hadn't thought of that. I just wanted to alleviate his pain.
I completely understand. We want to ensure his well-being while also managing his pain effectively. Given his situation, a prescription without assessment could pose more risks than benefits.
I see your point, but what can we do then? He's in so much pain.
How about we arrange a home visit for your father? That way, I can assess his condition in the comfort of his own home, where he may feel more at ease. With his consent, we can ensure he receives the appropriate care and medication tailored to his needs.
That sounds like a good idea. I'll speak to my dad about it and let you know.
Excellent. Please do let me know, and we'll schedule the visit at a time convenient for your father. In the meantime, if his pain worsens or there are any concerning symptoms, don't hesitate to contact us.
Thank you, doctor. I appreciate your help and understanding.
It's my pleasure. We're here to support you and your father every step of the way. Let's work together to ensure he gets the care he needs. Good morning, Miss Smith. How are you feeling today?
Good morning, Doctor. I've been better. I've been experiencing some chest pain and breathlessness over the past few months.
I'm sorry to hear that. Could you please describe the pain for me? How does it feel, and when do you usually experience it?
Well, it usually happens when I'm doing something active, like walking up the stairs or carrying groceries. It feels like a tightness or pressure in my chest, and sometimes it spreads to my shoulders and neck. It lasts for a few minutes and then goes away when I rest.
Thank you for explaining that. Based on what you've described, it sounds like you might be experiencing a condition called angina. Angina occurs when the blood and oxygen supply to the heart muscle is reduced, often due to narrowed or blocked arteries. It's quite common, and the good news is that it can be effectively managed with the right treatment and lifestyle changes.
Oh, that sounds serious. Should I be worried?
It's understandable to be concerned, but with proper management, we can help you live a healthy life. The first step is to assess other risk factors that can contribute to heart disease. I'd like to check your fasting glucose levels, cholesterol levels, and blood pressure. These will give us a better picture of your overall heart health.
Okay, that makes sense. What else should I do?
I recommend an immediate assessment by a cardiologist. They specialize in heart conditions and can provide a more detailed evaluation and treatment plan. In the meantime, it's important to avoid strenuous exercise as it can put extra stress on your heart.
I see. I'll be careful with that. Is there anything else I should know?
Yes, one of the most important things you can do for your heart health is to quit smoking. Smoking significantly increases the risk of heart disease and can worsen angina. There are several ways we can help you quit smoking, such as medications, counseling, and support groups. Would you like to discuss some options?
Yes, I've been thinking about quitting for a while. I guess now is a good time to start.
That's great to hear. Quitting smoking is one of the best things you can do for your health. I can provide you with resources and support to help you through the process. Let's take this step by step, starting with today's assessments and getting you set up with a cardiologist.
Thank you, Doctor. I appreciate your help.
You're welcome, Miss Smith. We're here to support you every step of the way. Let's get started with those assessments and we'll go from there. Hi, I'm Nurse Smith. How can I help you today?
Hi, I'm Emily. I'm here because I've been having these panic attacks and they're really scaring me. I'm in my last year of high school and I have this big exam coming up.
I'm sorry to hear that, Emily. Panic attacks can be very distressing. Can you tell me more about your panic attacks? What symptoms are you experiencing?
Sure. My heart starts racing. I feel like I can't breathe, and sometimes I get really dizzy. It feels like I'm going to faint or something bad is going to happen. They usually last about 10 to 15 minutes, but it feels like forever.
That sounds very frightening. How often have these panic attacks been happening?
They've been happening more frequently over the past month. I used to get them maybe once or twice a year, but now it's like once or twice a week.
I see. Have you noticed any particular triggers or situations that seem to bring them on?
Well, it's mostly when I'm thinking about my exams or when I'm trying to study. I get overwhelmed with everything I need to do, and then it just hits me out of nowhere.
It's understandable to feel anxious with such an important exam coming up. What you're experiencing, while distressing, is a normal response to feeling very anxious, nervous, and fearful about your exams. Many students go through similar feelings during this time.
Really? I thought there was something seriously wrong with me.
It's very common, Emily. You're not alone in this. Many students experience panic attacks around exam time due to the pressure and stress. The good news is that there are ways to manage and reduce these attacks.
That's a relief to hear. What can I do to stop them from happening?
There are several strategies you can try. First, when you feel a panic attack coming on, try to go to a quiet space where you can sit comfortably. Close your eyes and take slow, deep breaths. Visualizing something peaceful, like a calm beach or a serene forest, can also help.
I'll try that. Anything else?
Practicing healthy habits is very important. Make sure you're getting enough rest, eating well, and staying hydrated. Regular physical activity, even something as simple as a daily walk, can help reduce stress levels. Also, try to maintain a consistent sleep schedule, as lack of sleep can increase anxiety.
Okay, that makes sense.
Additionally, I would recommend attending our community health center for weekly visits. We can provide you with exercises for relaxation and breathing techniques. These sessions can be very helpful in managing anxiety and preventing panic attacks.
That sounds like a good idea. I could really use the help.
We're here to support you, Emily. You don't have to go through this alone. With the right techniques and support, you can manage your anxiety and get through your exams successfully.
Thank you so much, Nurse Smith. I feel a lot better knowing there's something I can do about this.
You're very welcome, Emily. Remember, you're doing your best, and that's what matters. We'll get through this together. If you need anything, don't hesitate to reach out.
I will. Thanks again.
Take care, Emily. See you at your next visit.
See you then.
Good morning, Mrs. Johnson. Thank you for coming in today. How are you and Max doing?
Good morning. We're hanging in there, thank you. Max has been having a bit of a tough time lately, especially during mealtimes. It's been quite challenging.
I understand. Could you tell me a bit more about what you're experiencing with Max during mealtimes? What are your main concerns?
Well, Max has been having difficulty sitting with the other children during meals at his childcare center. He becomes quite upset, and it's been a struggle for the staff there. I'm worried about his nutrition and social interaction skills.
I see. That sounds tough for both Max and the staff. How are mealtimes structured at home? Are there any similarities or differences compared to the childcare center?
At home, we try to keep things calm and relaxed during meals. We usually let Max watch his favorite show while he eats, as it helps to keep him focused. But now I'm thinking that might not be the best approach.
It's great that you're considering different approaches. Establishing a mealtime routine without distractions like TV can be beneficial. We can work on gradually transitioning Max to the table without the TV. How do you feel about that?
I think that sounds like a good idea. It might take some time for Max to adjust, but I'm willing to try anything that could help him.
That's a positive attitude. Let's set some realistic goals together. How about we aim for regular meals and snacks every 2-3 hours and gradually transition Max to the table for meals over the next few weeks?
That sounds like a plan. I think we can manage that at home.
Excellent. Now, in addition to dietary changes, would you be interested in exploring other services that could support Max's development, such as speech therapy for oral motor skills or an integration aid for the childcare center?
Yes, definitely. I think those services could really benefit Max. Do you have any recommendations or resources you could provide?
Absolutely. I can provide you with some information on local support groups, as well as contacts for speech therapists and integration aides. We'll work together to ensure Max gets the support he needs.
Thank you so much. I really appreciate your help and guidance.
You're welcome. Remember, you're not alone in this journey. We're here to support you and Max every step of the way. Hi there, John. How are you feeling today?
Hi. I'm a bit worried, actually. I've been on lithium for my bipolar disorder, and I have some concerns.
I understand. It's completely normal to have questions when starting a new medication. Can you tell me a bit more about what's worrying you? Are you experiencing any side effects?
Well, I've been feeling a bit off. And I've heard some scary things about lithium. I'm also worried about having to take it forever. I haven't noticed any major side effects yet, but I'm really anxious about what could happen.
It's good that you're sharing your concerns. Let's talk about how lithium works and what you might expect. Lithium is a very effective mood stabilizer. It helps to control the mood swings that come with bipolar disorder by balancing certain chemicals in your brain. Many people who take it find that it significantly improves their quality of life.
But do I really have to take it forever?
For many people with bipolar disorder, lithium is a long-term treatment. Think of it like managing any chronic condition, such as diabetes or hypertension. The goal is to keep your mood stable and prevent episodes. The dose might be adjusted over time, but staying on the medication is crucial to managing the disorder effectively.
What about the side effects? I'm really worried about those.
It's completely understandable to be concerned. Let's go over some of the common side effects first. Some people experience acne and hair loss, which can be distressing, but there are ways to manage these. More serious side effects, like seizures, are very rare. Regular monitoring through blood tests helps us keep an eye on lithium levels in your system to avoid any serious issues.
So the blood tests are important.
Yes, they are essential. These tests help us ensure that your lithium levels stay within a safe and effective range. We usually start with more frequent testing, and as things stabilize, the frequency decreases.
I see, that makes sense. I guess I'm just scared about what might happen in the long run.
It's normal to feel that way. Remember, you're not alone in this. We are here to support you and monitor your progress. By staying on top of your treatment and keeping open communication with us, we can manage any side effects together.
Thanks, that's reassuring to hear. I guess I just needed to talk it out.
I'm glad you did. Have my explanations helped clear up some of your concerns?
Yes, definitely. I feel a bit more at ease now.
That's great to hear. Do you have any other questions or need further advice on anything?
Not right now, but it's good to know I can reach out if I need to.
Absolutely. You're doing the right thing by taking your medication and discussing your concerns. We're here to help every step of the way. Remember, you're taking important steps toward managing your health, and that's commendable.
Thanks so much. I feel a lot better about continuing with the lithium now.
You're welcome, John. Take care, and don't hesitate to contact us if you need anything. Good evening, Sarah. How are you feeling now?
Hi, I'm feeling a bit better, thanks. The pain relief is helping a little with the headache.
That's good to hear. Can you tell me more about your symptoms? Are you still experiencing a headache?
Yes, the headache is still there, but not as bad as before.
How about your neck? Any stiffness or muscle spasms?
My neck is really stiff, and I feel these occasional muscle spasms.
I'm sorry you're going through this. Based on your observations, we're planning to discharge you later today. However, this will depend on your condition, and the observations will do every 2 hours.
Okay, that sounds good. What should I do about the pain once I'm home?
You can take paracetamol or acetaminophen for the next 2 to 3 days to manage the pain. Applying an ice pack to your neck can also help reduce any swelling and discomfort. Make sure you don't keep the ice on for more than 20 minutes at a time.
All right, I'll do that.
It's important to focus on self-care. Try to get back to your normal activities gradually. Using a firm support pillow when you sleep and maintaining good posture during the day can help. These measures can ease your symptoms and support your recovery.
I'll make sure to follow those tips.
Staying active is crucial too. It helps strengthen your muscles, reduces anxiety, and assists in your recovery. I recommend seeing a physiotherapist. They can provide you with exercises and relaxation techniques, as well as a regular stretching routine that can be very beneficial.
I've never seen a physiotherapist before, but I'll give it a try.
Do you have someone at home who can help you out during your recovery? A spouse, family member, or friend?
Yes, my husband is at home. He'll be able to help me.
That's great to hear. One more thing, it's important to know when to seek medical advice after you go home. If you experience increased pain or discomfort, nausea or vomiting, vision problems, or any numbness or weakness in your arms or legs, you should contact a healthcare professional immediately.
I'll keep an eye on those symptoms and reach out if anything gets worse.
Excellent. We'll continue to monitor you here for a bit longer, and if everything looks good, you should be able to head home later today. If you have any questions or concerns, feel free to let us know.
Thank you so much for your help.
You're welcome, Sarah. Take care and rest up. Hi there, I'm Nurse Kelly. I see your little one has had a bit of an accident. Can you tell me how it happened?
Hi, Nurse Kelly. Yes, he was helping me in the kitchen and somehow managed to cut his finger with a knife. It's bleeding quite a bit, and I'm really worried.
I understand your concern. Let's take a closer look. The cut isn't too deep, which is good news. It doesn't look like he'll need stitches.
Oh, that's a relief. But it's still bleeding a lot. How long will it take to heal?
Since it's a shallow cut, it should start to heal in about a week. You might see some improvement in a few days. The bleeding should stop soon once we get it properly dressed.
Will it leave a scar?
It's unlikely to leave a significant scar since it's not too deep. As it heals, just make sure he doesn't pick at the scab, and that will help minimize any scarring.
That's good to know. So, what do I need to do to take care of it?
First, we need to clean the cut with some warm water and mild soap. It's important to remove any dirt or debris. After that, we'll apply some antiseptic to prevent infection. Finally, we'll dress the cut with a sterile bandage. I'll show you how.
Okay, thank you. I'm worried about keeping it clean. He's always getting into things.
It's crucial to keep the bandage dry and clean. Change it once a day or whenever it gets wet or dirty. Try to keep him from using that hand too much to avoid reopening the cut.
I'll do my best. Anything else I should know?
Yes, just a few more things. Make sure he doesn't soak his hand in water for too long, so no long baths or swimming until it's healed. Also, watch out for signs of infection like increased redness, swelling, or pus. If you notice any of these, come back here or see your doctor.
Got it. I'll keep an eye on it. He was so excited to help in the kitchen, but now I'm worried about having sharp things around.
It's wonderful that he wants to help, but we need to make sure he's safe. Try to keep sharp tools out of his reach and perhaps use child-safe utensils when he's helping. Maybe he can help with tasks that don't involve knives for now.
That's a good idea. I'll definitely be more careful. Thank you so much for your help.
You're welcome. It's always good to encourage their enthusiasm, just with a little extra caution. If you have any more questions or concerns, don't hesitate to come back. Take care.
Thanks again, Nurse Kelly. We'll be careful from now on.
Good morning. How are you feeling today?
Good morning. I'm feeling a bit better, but still quite worried. Last night was really scary.
I can imagine. Asthma attacks can be very frightening. You're in good hands here, though. Do you have any questions about asthma or your condition?
Yes, actually. What exactly is asthma?
Asthma is a chronic disease that affects your airways, the tubes that carry air in and out of your lungs. When you have asthma, your airways can become inflamed and narrow, making it hard to breathe.
That sounds serious. What causes it?
Asthma can be caused by a combination of environmental factors and an inherited predisposition. Things like pollen, dust mites, pet dander, and even stress can trigger asthma symptoms. If you have family members with asthma, you're more likely to develop it too.
I see. How is asthma treated?
One of the most common treatments is a Ventolin inhaler, which contains a medication called salbutamol. This helps to relax the muscles around your airways, making it easier to breathe. Let me show you how to use it properly.
Okay, please do.
First, you need to shake the inhaler well. Then, remove the cap and breathe out fully. Place the mouthpiece in your mouth and close your lips around it. As you start to breathe in slowly, press down on the inhaler to release the medication. Continue to breathe in slowly and deeply. Hold your breath for about 10 seconds, then breathe out slowly. Do you think you can try that?
Yes, I think so. It seems straightforward.
Great. Now let's talk about the prognosis for asthma. While there is no cure for asthma, it can be very well controlled with the right treatment and lifestyle adjustments. Many people with asthma lead normal, active lives.
That is reassuring. But what about the anxiety I feel whenever I think about having another attack?
It's completely normal to feel anxious after an experience like that. The important thing to remember is that with proper management, you can reduce the frequency and severity of asthma attacks. Keeping your inhaler with you and avoiding known triggers can help. We're also here to support you, so never hesitate to reach out if you have concerns.
Thank you. That makes me feel a bit better.
You're welcome. Remember, you're not alone in this. We're here to help you manage your asthma and live a full, healthy life. If you have any more questions or need anything, just let us know.
I will. Thanks again for your help.
Anytime. Take care, and I'll check on you again soon. Good morning, Emily. How are you feeling today?
Morning, Anna. I'm okay, I guess. Just a bit worried.
I understand. Your family mentioned that you have some concerns about your recovery. Can you tell me more about what's been on your mind?
Well, I'm scared that I'll never fully recover from this subarachnoid hemorrhage. I'm always so tired, and I worry that I'll have another one. It's overwhelming.
It's completely normal to feel that way after something as serious as an SAH. Fatigue is a common part of the healing process, but it will lessen over time as your brain continues to heal. Your physical endurance and memory will also improve gradually.
I hope so. It's hard to believe right now.
I know it's tough, but many patients do make significant recoveries. Some even return to work and live independently again. It just takes time and the right support.
Really? How could I possibly live on my own again?
There are many ways to make living independently safer and easier. For example, using assistive devices like a walker or cane can help you move around more confidently. Installing grab bars in your bathroom can prevent falls.
That makes sense. I hadn't thought about those things.
Visual cues can also be very helpful for memory. You can use post-it notes or pictures as reminders for daily tasks. Setting alarm clocks for medications or important phone calls is another great strategy.
I do tend to forget things easily these days. That sounds like it could help.
Absolutely. And speaking of medications, it's crucial that you take your blood pressure medications as prescribed. Keeping your BP under control is vital to prevent another SAH.
I'm worried I'll forget to take them.
A 7-day pill organizer can be a lifesaver in that regard. It helps you keep track of your medications and ensures you're taking them correctly every day.
I think I could manage that. It sounds like a good idea.
You're doing great, Emily. Remember, recovery is a step-by-step process, and it's okay to ask for help along the way. You have a strong support system, and we're all here to assist you.
Thank you, Anna. I feel a bit more hopeful now.
That's wonderful to hear. Just take it one day at a time, and don't hesitate to reach out if you need anything. We're here for you every step of the way.
Thanks again. I appreciate it.
Anytime, Emily. You're stronger than you think. Let's focus on your progress and take it from there. Hi, Sarah. How are you feeling right now?
I'm fine. I just want to know what this drip is for. How long do I have to stay here?
The intravenous drip is giving you potassium to stabilize your electrolytes. Your heart rhythm was abnormal due to a low level of potassium, which is essential for your heart to function properly. This treatment will help prevent any further complications. As for how long you'll need to stay, it depends on how quickly your levels normalize, but we'll keep you updated every step of the way.
I don't need this. I'm perfectly healthy. It's just a one-time thing.
I understand the situation is very stressful for you, and it can be hard to process. Sometimes, our bodies can give us signals that something might be off, even if we feel okay otherwise. Can I ask you a few questions about your eating habits to help us understand what might have caused this?
Why do you need to know about that? I'm fine. I eat normally.
I hear you, Sarah. The reason I'm asking is that our food intake directly affects our body's chemistry and overall health, including our heart. Knowing more about your diet can help us give you the best care and prevent future issues like the one you're experiencing now. It's all about making sure you stay healthy and strong.
Whatever. Fine. Ask your questions.
Thank you, Sarah. Can you tell me about what you typically eat in a day?
I don't know. Just regular stuff. Sometimes I skip meals if I'm busy, but that's normal, right?
Skipping meals can sometimes lead to nutrient imbalances, which might affect your heart and overall health. Do you find yourself skipping meals often, or do you sometimes avoid certain types of food?
I don't see why it matters. I eat when I'm hungry. I just don't like feeling full.
It's important to listen to our bodies, and feeling full is a natural part of staying nourished. Balancing your meals can help prevent issues like the one you face today. I appreciate you sharing this with me.
Are we done? Can I leave now?
Almost. There's one more thing. A mental health doctor will be coming to see you shortly.
A mental health doctor? I'm not crazy. I don't need to see someone like that.
I understand how you feel, Sarah. It's not about being crazy. Mental health is a part of our overall health, just like physical health. The doctor can help address any stress or underlying issues that might be affecting your eating habits and health. It's important to take care of both your body and mind to prevent situations like this in the future.
I still don't see the point. I'm not talking to them.
I get that this is frustrating and overwhelming. Sometimes, talking to someone can help us understand and manage our health better. It's about preventing future emergencies and keeping you healthy. You deserve to feel your best in every way, and this is a step towards that.
Fine, whatever. But I'm only doing this because you're making me.
Thank you, Sarah. We're here to support you every step of the way. If you have any more questions or need anything, just let us know. Good afternoon, Mrs. Thompson. I understand you're here to discuss some concerns about your son. How can I help?
Good afternoon, Dr. Carter. Yes, I'm worried about my son, Jason. I think he might be taking illegal drugs.
I'm sorry to hear that you're dealing with this. Can you tell me what makes you suspect that Jason might be using drugs?
Well, he's been acting very differently lately. He's more secretive, his grades have dropped, and I found some rolling papers in his room. He also seems more irritable and distant.
I see. It sounds like you're noticing some significant changes. Could you tell me more about Jason? What's his daily routine like? Who does he spend time with?
Jason used to be very active in sports, but he's dropped out of all his teams. He spends most of his time in his room or out with friends I don't really know. His old friends, the ones I knew well, don't come around anymore.
That's quite a shift. What about his schoolwork? You mentioned his grades have dropped.
Yes, he was always a good student, but now he's failing several classes. The teachers have noticed too, and they've reached out to me about his sudden lack of interest and attendance issues.
It sounds like there's been a noticeable decline in several areas of his life. What would you like to happen next? Would you be open to Jason coming in to see me so we can talk about this together?
I'm not sure if he would come willingly. He's very defensive whenever I try to talk to him about anything serious.
That's understandable. Adolescents can be quite resistant, especially when it comes to sensitive topics like this. How would you feel about referring Jason to an adolescent psychologist for an assessment and appropriate treatment?
I think that could be helpful. I'm really worried about him and I don't know how to get through to him.
It's a good step. A psychologist specialized in adolescent behavior could help identify any underlying issues and provide the right support. Also, it's important to be aware of the effects of marijuana, which is a common drug among teenagers. It can affect alertness, concentration, coordination, and even motivation.
Yes, I've read some about it. It's scary to think he might be putting himself at risk like that.
It can be very concerning, but the important thing is that you're taking action. We'll need to handle this delicately. Would you like me to give you some information on local psychologists, and we can also schedule a follow-up appointment for Jason here?
Yes, that would be great. Thank you, Dr. Carter. I really appreciate your help.
You're welcome, Mrs. Thompson. You're doing the right thing for Jason. I'll provide you with the information, and we'll take it from there. If you have any more questions or need further support, don't hesitate to reach out.
Thank you, I will.
Hi, Jack. How are you today?
Hi, doctor, I'm okay, but I'm a bit worried about these bruises on my legs and these red spots that have appeared all over my body.
I see. Can you tell me when you first noticed these bruises and red spots?
I noticed the bruises about a week ago. They just seemed to appear out of nowhere. The red spots started showing up a couple of days later.
Have you done anything to try and manage them so far?
Not really. I've just been trying to be more careful to avoid bumping into things. My mom gave me some over-the-counter painkillers, but they haven't really helped with the bruising.
Okay. Thanks for letting me know. From what you're describing, it sounds like you might be dealing with scurvy. Have you heard of it before?
Scurvy? I thought that was something pirates got.
It's true that scurvy is often associated with sailors from long ago, but it can still happen today. Scurvy is caused by a deficiency in vitamin C. Without enough vitamin C, your body can't make collagen, which is important for your skin, blood vessels, and healing processes. This can lead to symptoms like bleeding gums and bruising easily, which sounds like what you're experiencing.
Oh, I didn't know that. So I'm not getting enough vitamin C?
That's likely the case. Vitamin C is essential for your body. It helps repair tissues, boosts your immune system, and keeps your skin healthy. Without enough vitamin C, your body starts to struggle with these functions, leading to the symptoms you're seeing.
How can I make sure I get enough vitamin C then?
The best way is through your diet. Fruits and vegetables are excellent sources of vitamin C. Oranges, strawberries, kiwi, and bell peppers are all great options. Green leafy vegetables like spinach and kale are also very good.
I guess I don't eat a lot of those things.
It's common for teenagers to not get enough fruits and vegetables, but it's important to try and include them in your diet every day. Maybe you could start with some fruits you enjoy and gradually add more variety.
Yeah, I could do that. I like strawberries and oranges.
That's a great start. Adding those into your meals or snacks can make a big difference. Also, drinking orange juice can help, but try to go for fresh juice when you can.
I'll definitely try that.
Excellent. I'd like you to come back in a week for a review so we can see how you're doing. If your symptoms persist or you notice anything new, we might need to consider other tests or treatments. But for now, let's focus on increasing your vitamin C intake.
Okay, I'll come back next week. Thanks, doctor.
You're welcome, Jack. Take care and see you soon.
See you next week. Bye.
Bye. Good morning, Officer Martinez. How are you feeling today?
Good morning, Dr. Thompson. I've been feeling pretty breathless lately, especially when I'm exerting myself, like climbing stairs or chasing suspects. It's becoming a concern.
I see. Well, let's start by discussing your lifestyle a bit, especially your eating and drinking habits. Can you tell me what a typical day looks like for you in terms of meals and beverages?
Sure. For breakfast, I usually have coffee and maybe a muffin if I'm in a rush. Lunch is often something quick, like a sandwich or fast food. Dinner varies, but it's usually something like pasta or takeout. I drink a few sodas during the day and occasionally have a beer or two in the evening to unwind.
Thank you for sharing that. From what you've described, there are a few areas we could improve to help with your breathlessness and overall health. Your BMI is currently 25.9, which is on the higher side of the normal range, bordering on overweight. Losing some weight can significantly reduce your symptoms.
I know I could stand to lose a few pounds, but with my schedule, it's really hard to eat healthily or find time to exercise.
I understand that, Lisa. Being a police officer comes with its own set of challenges. However, it's crucial for your health and job performance that we find a way to incorporate some healthy habits into your routine. Weight loss can improve your breathing, reduce the risk of heart disease, diabetes, and improve your overall quality of life.
That makes sense. What changes should I start with?
Let's begin with your diet. It's important to have a well-balanced, healthy diet. Try to incorporate more leafy vegetables and whole fruits into your meals. These are packed with essential nutrients and can help you feel fuller longer, reducing the temptation to snack on unhealthy options.
I like fruits, but I don't eat many vegetables. I'll try to add more to my meals.
That's a great start. Also, it's important to avoid junk and sugary foods. These contribute to weight gain and don't provide the nutrients your body needs. Try to cut back on sodas and replace them with water or herbal teas. And about the alcohol, while it's fine to unwind occasionally, try to limit your intake to 1 drink per day or less.
I see. Less soda and beer, more water and vegetables. Got it.
Exactly. Physical activity is also essential. I know your job is physically demanding, but incorporating regular exercise can make a huge difference. Even a 30-minute walk each day can improve your cardiovascular health and help with weight loss.
I'll need to find the time for that. Maybe I can start walking during my lunch breaks.
That's a wonderful idea. Small changes like that can add up. Remember, it's not about making drastic changes all at once, but rather about building sustainable habits over time. Do you have any questions or concerns about these recommendations?
Not at the moment. This all sounds manageable. I'll give it a try and see how it goes.
Fantastic. Let's schedule a follow-up in a few months to see how you're progressing. And remember, you can always reach out if you have any questions or need support.
Thank you, Dr. Thompson. I appreciate your help.
You're welcome, Lisa. I'm here to support you. Take care, and we'll talk soon.
Thanks, you too.
Good morning, Mr. Jones. How are you today?
Morning, Dr. Carter. I'm doing all right, but I've been having some issues with my sleep lately.
I'm sorry to hear that. Could you tell me more about what's been happening?
Well, ever since I had that nose injury from the car accident 6 months ago, I've started snoring really loudly. My wife says it's gotten so bad that she's been sleeping in the guest room. I'm also feeling really tired during the day, even after a full night's sleep.
That sounds quite challenging. Snoring can definitely affect sleep quality for both you and your partner. From what you're describing, it sounds like you might be experiencing obstructive sleep apnea. Have you heard of it before?
I've heard the term, but I don't really know what it is. Could you explain it to me?
Of course. Sleep apnea is a condition where your breathing stops and starts repeatedly during sleep. The most common type, obstructive sleep apnea, happens when the muscles in the back of your throat relax too much to allow normal breathing. When this happens, your airway narrows or closes as you breathe in, and you can't get enough air, which can lower the oxygen level in your blood. Your brain senses this inability to breathe and briefly rouses you from sleep so that you can reopen your airway. This awakening is usually so brief that you don't remember it. This pattern can repeat 5 to 30 times or more each hour, all night long, impairing your ability to reach the deep, restful phases of sleep.
Wow, I had no idea it could be that serious. What can be done about it?
One of the most effective treatments for obstructive sleep apnea is the use of a CPAP, or continuous positive airway pressure machine. This device keeps your airway open by providing a steady stream of air through a mask that you wear while you sleep.
How does that work exactly?
The CPAP machine includes a mask that fits over your nose, or sometimes both your nose and mouth. The machine provides a continuous stream of air pressure that keeps your airway open, preventing pauses in your breathing. It might feel a bit strange at first, but many patients get used to it and find it really helps with their symptoms. Would you like to see how it works?
Yes, please. I'd like to understand it better.
So, this is the CPAP machine. This part here is the mask, which you would wear over your nose and mouth like this. The machine pushes air through this hose and into the mask, which keeps your airway open while you sleep. The goal is to prevent the airway from collapsing, so you don't stop breathing during the night.
I see. It does seem a bit bulky. Is it uncomfortable?
It can take some getting used to, but most people adapt quite well. There are different types of masks available, so we can find one that is most comfortable for you. Some people find nasal pillows, which fit directly into the nostrils, to be less intrusive.
All right, I think I could give it a try.
Great. We'll arrange for you to have a sleep study, which will confirm the diagnosis and help us determine the best settings for your CPAP machine. In the meantime, there are a few lifestyle changes that might help as well. Do you drink alcohol?
Occasionally, yes. Maybe a couple of drinks in the evening.
Alcohol can relax the muscles in your throat, which can make sleep apnea worse. I would recommend limiting your alcohol intake, especially in the hours before bedtime.
Okay, I can do that. Anything else I should be aware of?
Maintaining a healthy weight is also important, as excess weight can contribute to sleep apnea. Regular exercise and a balanced diet can help. Avoiding sleeping on your back can also be beneficial, as this position can cause your tongue and soft tissues to block your airway.
That all makes sense. Thank you, Dr. Carter.
You're welcome, Mr. Jones. We'll set up the sleep study and follow up once we have the results. If you have any questions or concerns in the meantime, don't hesitate to contact me.
Thanks, I appreciate it. I'll see you soon.
Take care, Mr. Jones. Goodbye.
Goodbye, and
Good morning, Mr. Smith. How are you today?
good morning, Dr. Carter. I'm doing well, thank you. I have an upcoming trip to Vietnam next month, and I wanted to discuss any necessary vaccinations.
That's great to hear. Vietnam is a beautiful country. How long will you be staying there?
I'll be there for about 3 weeks.
Wonderful. Have you traveled internationally before? And do you remember what vaccinations you've had in the past?
I traveled quite a bit for work, but it's been a few years since my last trip. I can't recall all the vaccinations I've had, but I know I've been vaccinated for some common things like tetanus and the flu.
That's helpful to know. For travel to Vietnam, the World Health Organization recommends certain vaccinations due to the risk of specific diseases. Two important ones are typhoid and hepatitis A.
Typhoid and hepatitis A? Why are those necessary?
Typhoid fever is contracted through contaminated food and water, and it's more prevalent in countries like Vietnam, where sanitation conditions can vary. Hepatitis A is a liver disease also spread through contaminated food and water. Given that Vietnam is a medium-risk country for these diseases, it's prudent to protect yourself.
I see. And how far in advance should I get these vaccinations?
It's best to get vaccinated at least 2 weeks before you travel. This allows your body enough time to build up immunity, ensuring you're well protected by the time you arrive in Vietnam.
That makes sense. Are these vaccinations painful?
The discomfort is usually very mild. Most people experience only a small pinch at the injection site and possibly some minor soreness afterward. The benefits of staying healthy during your trip far outweigh the brief discomfort.
That's reassuring. I think I'd like to go ahead with the vaccinations then.
Excellent decision, Mr. Smith. We can get you started with those today. I'll just need to check your current vaccination records and make sure everything else is up to date. We'll also discuss any other health precautions you might need for your trip.
Sounds good. Thank you, Dr. Carter.
You're welcome. Let's get started with those records, and we'll have you ready for your trip in no time. Good morning, Mr. Smith. How are you feeling today?
Good morning, Dr. Carter. I'm managing, I suppose. It's been a bit of a tough adjustment.
I can imagine. It's only been 5 days since your prostatectomy, so it's perfectly normal to feel a bit out of sorts. Surgery, especially one involving the prostate, can be quite demanding on the body. I've reviewed your charts, and I see your vital signs are looking good. Your blood pressure, heart rate, and temperature are all within normal ranges, which is a positive sign.
That's good to hear. But, this catheter, it's really bothering me. I feel so embarrassed by it. It's awkward and uncomfortable.
I completely understand your concerns, Mr. Smith. It's very common for patients to feel embarrassed or self-conscious about having a catheter. They can be quite inconvenient and uncomfortable, but I assure you, it's an essential part of your recovery process right now.
I get that it's necessary, but I can't help feeling self-conscious. It's hard to move around, and it's just there all the time. I feel like it's affecting my dignity.
It's perfectly natural to feel that way. The reason we need to keep the catheter in for a few more days is to ensure that your bladder and urinary system can heal properly after the surgery. The catheter helps drain urine without putting any strain on the surgical area, which is crucial for avoiding complications.
How much longer will I need to have it in? It's really starting to wear on me.
Typically, we like to keep the catheter in for about a week following this type of surgery. This time frame helps us ensure everything is healing correctly and that there are no issues such as urine leakage or infection. Given that it's been 5 days, we're nearly there.
So maybe just a couple more days then?
Exactly. I'd like you to come back in 3 days for another review. At that time, we'll assess your progress, and if everything looks good, we can likely remove the catheter. This way, we can be sure your body has had enough time to heal internally.
That would be a relief. I'm really looking forward to getting back to some semblance of normalcy. This whole experience has been quite taxing.
I completely understand, Mr. Smith. In the meantime, try to take it easy and avoid any heavy lifting or strenuous activity. These activities can put unnecessary pressure on your healing tissues. Also, if you notice any significant changes, like a fever, increased pain, or if the catheter stops draining, please contact us immediately. It's important to catch any potential issues early.
I will, thank you. And thanks for the reassurance. It helps to know there's a light at the end of the tunnel. The support really makes a difference.
You're very welcome, Mr. Smith. You're doing great, and it sounds like you're taking all the right steps. I'll see you in 3 days for your follow-up. Remember, this is just a temporary inconvenience, and soon you'll be past this stage of your recovery.
Thank you, Dr. Carter. I appreciate your understanding and support. See you in 3 days.
Take care, Mr. Smith. If you have any concerns before then, don't hesitate to reach out. Good morning, Mrs. Johnson. How can I help you today?
Good morning, doctor. I'm feeling really upset and embarrassed. I just found out that my eldest daughter, Emma, has head lice. I always wash my children's hair regularly, so I don't understand how this happened. I've never had to deal with this before.
I understand how upsetting this can be, but please don't feel embarrassed. Head lice are quite common, and anyone can get them regardless of how often they wash their hair. It's not a reflection of your hygiene or care for your children.
Really? I've always heard it's a sign of poor hygiene.
That's a common misconception. Head lice are tiny insects that spread from person to person, typically through close contact or sharing personal items like hats, combs, or pillows. They don't discriminate based on cleanliness. The important thing is to take steps to treat it now.
Okay, that makes me feel a little better. But what should I do now? How do I get rid of them?
First, it's essential to check the entire family, as head lice are highly contagious. Everyone should be examined to ensure no one else is affected. This includes you and your wife as well.
Oh, I hadn't thought of that. I'll check everyone when I get home.
That's a good start. Also, you should inform Emma's school or kindergarten. Head lice can spread quickly among children, so it's likely other children may be affected as well. The school can notify other parents to check their kids and take necessary measures.
I'll definitely call the school today. What else should I do?
For treating head lice, one of the most effective methods is using a head lice comb. These are specially designed combs with very fine teeth that can remove lice and their eggs, or nits, from the hair. You'll need to comb through the hair thoroughly, section by section, to ensure you get as many lice and nits out as possible.
How often should I use the comb?
You should comb through the hair daily for at least a week to 10 days. This ensures that you catch any newly hatched lice before they can lay more eggs. In addition, there are over-the-counter treatments available at pharmacies that can be used to kill the lice. Make sure to follow the instructions carefully.
That sounds like a lot of work, but I'll do whatever it takes to get rid of them.
It can be a bit time-consuming, but it's very effective. Also, make sure to wash bedding, clothing, and any items that have been in contact with your daughter's head in hot water. This will help prevent reinfestation.
Got it. I'll start with the combing and make sure to wash everything. Thank you so much for your help and reassurance, Doctor. I was really worried, but I feel more confident now.
You're very welcome, Mrs. Johnson. Remember, you're not alone in this, and it's a common issue that many parents face. If you have any further questions or need more advice, don't hesitate to reach out. You're doing a great job taking care of your children.
Thank you. I really appreciate it.
Take care and good luck with the treatment. I'm sure you'll handle it just fine.
Thanks again, Doctor. Have a good day.
You too, Mrs. Johnson.
Good afternoon, Mrs. Johnson. How are you feeling today?
Oh, hello, Doctor. I'm feeling okay, I suppose. Just a bit tired.
I'm glad to hear you're doing okay. I brought your lunch for you. It's a lovely chicken salad today.
Oh, thank you. I guess I should eat something.
Mrs. Johnson, I see your breakfast is still here. It's important for your recovery that you eat regularly and get the nutrients you need.
I know, Doctor. It's just that I'm not very hungry these days. The food doesn't always appeal to me.
I understand, and it's quite common to experience a loss of appetite after surgery. But we need to get you back on your feet, and proper nutrition is a key part of that.
I try, but the meals, they're just not what I'm used to.
I hear you, Mrs. Johnson. Hospital food can be a bit different from home-cooked meals. Unfortunately, we have to stick to the hospital menu because it's planned to ensure you get balanced nutrition while you're recovering.
I understand. It just makes it hard sometimes.
How about we try this? Let's see if there are a few items on the menu that you do like. Maybe we can request those more often. In the meantime, try to have at least a little bit from each meal. Even small amounts can make a big difference.
That sounds manageable. I'll try to eat a bit more.
That's the spirit. Remember, the more you eat, the stronger you'll get, and the sooner you'll be back home.
I really want to get better and go home. Thank you, Doctor. I appreciate you checking in on me.
Of course, Mrs. Johnson. It's my pleasure. I'll leave your lunch here for you. If you need anything or if you have any concerns about the food, just let one of the nurses know, okay?
I will. Thank you again.
You're very welcome. Take care and I'll check in on you later. Enjoy your lunch.
I'll do my best. Thank you, Doctor.
Take care, Mrs. Johnson. See you soon.
All right, let's see what we have here.
Good afternoon, Mr. Johnson. How are you feeling today?
Not too great, Doc. I'm still trying to wrap my head around this emphysema diagnosis. I feel really guilty about it, especially since I smoked for 25 years. I can't help but think I brought this on myself.
I understand how you feel, Mr. Johnson. Emphysema can be tough to deal with, but it's important to focus on what we can do moving forward. Let me explain a bit about the condition. Emphysema involves air trapping, which means your lungs have difficulty expelling air completely. This trapped air makes it hard to breathe and can cause shortness of breath.
So my lungs are just holding on to air they shouldn't?
Exactly. The air sacs in your lungs are damaged, which reduces the surface area available for gas exchange. This makes it harder to get oxygen in and carbon dioxide out. However, we have several strategies to help manage your symptoms and improve your quality of life.
What kind of treatments are we talking about?
We'll start with medications. Bronchodilators can help open up your airways, making it easier to breathe. We might also use steroid inhalers to reduce inflammation in your lungs. These can significantly improve your breathing.
Okay, that sounds good. What else can I do?
Another effective approach is chest physiotherapy. This involves techniques like controlled breathing exercises to improve lung function and increase your tolerance to physical activity. It can help you clear mucus from your lungs and breathe more easily.
I've heard something about surgery for this condition. Is that an option for me?
There is a surgical option known as lung volume reduction surgery. It involves removing the most damaged parts of your lungs, which can help the healthier parts work more efficiently. This can improve your breathing and overall quality of life.
That sounds promising. Is there a catch?
Surgery is only an option for a narrow group of patients. Factors like your overall health, the extent of your emphysema, and your age play a significant role. The surgery is most beneficial if done within a certain window when you're still relatively healthy and before the condition progresses too far.
I see. What about preventing infections? I know my lungs are more vulnerable now.
Preventing secondary infections is crucial. The most important step you can take is to stop smoking immediately. Smoking further damages your lungs and increases the risk of infections. We can also prescribe antibiotics if you develop a respiratory infection, and it's important to get your flu and pneumonia vaccines to protect your lungs.
I'll definitely quit smoking. I just feel so guilty about having smoked for so long. It's hard to shake off the feeling that I did this to myself.
It's natural to feel that way, Mr. Johnson, but remember that beating yourself up won't change the past. The important thing is that you're here now, taking steps to improve your health. Many people with a history of smoking feel the same guilt, but focusing on positive actions and self-care is the best way forward.
Thanks, Doc. That helps a bit. I guess I just need to take things one step at a time.
Exactly. You're doing the right thing by seeking information and being proactive about your health. We'll work together to manage your condition and improve your quality of life. If you have any more questions or concerns, don't hesitate to reach out.
I appreciate that, Dr. Smith. Thank you for your support and guidance.
You're welcome, Mr. Johnson. Take care, and we'll see you soon for your follow-up.
Will do. Thanks again.
Good afternoon, Mrs. Johnson. How can I help you today?
Good afternoon, doctor. I'm having a lot of pain in my right big toe. It's swollen and really inflamed. This has happened a couple of times before, but this time it's much worse. I've taken aspirin, but it doesn't seem to be helping.
I see. Based on your symptoms and your history of previous attacks, it sounds like you're experiencing another gout flare-up. Let me explain a bit about what gout is. Gout is a type of arthritis caused by a buildup of uric acid in the blood. When there's too much uric acid, it can form crystals that deposit in your joints, causing intense pain, swelling, and inflammation like you're experiencing now.
That sounds awful. Why is it worse this time?
Gout attacks can vary in intensity, and sometimes they can be more severe, especially if the uric acid levels are higher or if there are more crystals accumulating in the joint. Entire TMs also possible that factors like diet, stress, or dehydration might have contributed to this more intense flare-up.
I see. I thought aspirin would help, but it hasn't. What can I do to relieve the pain?
Aspirin can actually make gout worse by affecting uric acid levels. Instead, it's better to use medications like ibuprofen or naproxen, which are nonsteroidal anti-inflammatory drugs, NSAIDs. These can help reduce inflammation and pain. Additionally, colchicine is another medication that can be effective during an acute gout attack. For more long-term management, we often prescribe allopurinol, which helps to lower uric acid levels and prevent future attacks.
How long will it take for the pain to go away?
It can take several weeks for a gout attack to completely resolve. The pain usually starts to improve within a few days once you begin the appropriate treatment, but the swelling and tenderness might linger for a while longer.
That sounds like a long time. Is there anything I can do to prevent this from happening again?
Recurrent attacks are common with gout, but there are several steps you can take to reduce their frequency. First, managing your diet can make a significant difference. Avoiding foods high in purines, such as red meat, shellfish, and certain types of alcohol, can help. Reducing your alcohol consumption overall is important, especially beer and spirits. Maintaining a healthy weight through diet and regular exercise can also help lower your uric acid levels.
I'll definitely try to change my diet. Is there anything else I should know?
Staying well hydrated is crucial as well. Drinking plenty of water helps to flush uric acid from your system. Also, regular checkups with your doctor to monitor your uric acid levels and adjust your medication as needed are important steps in managing gout.
Thank you, doctor. I appreciate all the information. I was really worried that this might be something I have to live with constantly.
You're welcome, Mrs. Johnson. Gout can be very painful, but with the right treatment and lifestyle changes, you can manage it effectively and reduce the frequency of attacks. If you have any more questions, or if the pain doesn't start to improve soon, please don't hesitate to contact me.
I will. Thank you so much for your help.
Take care, Mrs. Johnson. Feel better soon. Good morning, Miss Johnson. I'm Dr. Smith. Please take a seat. How are you today?
Morning, Dr. Smith. I'm okay, just a bit nervous about this health check.
That's completely understandable. Health checks can make people anxious, but I assure you there's nothing to worry about. This is a great opportunity for us to make sure you're in good health and address any concerns you might have.
I guess so, but I'm worried about my employer getting access to my medical information. I don't want them to know if something's wrong.
I understand your concern. Let me reassure you that your health information is strictly confidential. The details of your health check are shared only with you. The employer only gets anonymized data to understand overall workforce health trends, not individual specifics.
That's a relief to hear. I haven't had a health check in a long time because of that worry.
It's good that you're here now. Regular health checks are crucial because they give you immediate feedback and advice on your health. They help you catch any potential issues early on, which can make a big difference.
I've been afraid of what might come up, especially since diabetes runs in my family. What if I find out I have it?
It's natural to feel that way. However, knowing is better than not knowing because it allows you to take control of your health. If we catch something like diabetes early, we can manage it effectively and prevent complications. Plus, managing risk factors can significantly improve your quality of life.
I see. But I'm still not sure. I've heard that health checks benefit the workplace. But how exactly?
Great question. Health checks help create a healthier workforce. When employees are healthier, they're more productive, take fewer sick days, and there's a lower risk of workplace injuries. For you personally, it means getting insights into your health, which can help you make informed decisions about your lifestyle and well-being.
That makes sense. I've been feeling a bit off lately and wondering if it's something serious. Maybe it's time to face it.
I agree. And if you're concerned about diabetes, I strongly recommend visiting your local doctor for a comprehensive test. They can perform a full risk assessment and guide you on the best steps to take.
What does the risk assessment involve?
It typically involves checking your blood sugar levels, discussing your family history, and evaluating your lifestyle factors. Based on the results, your doctor can advise you on dietary changes, physical activity, and other ways to reduce your risk.
That doesn't sound too bad. What kind of lifestyle changes are we talking about?
Simple changes can make a big difference. Incorporating regular exercise like walking or cycling and modifying your diet to include more whole foods, fruits, and vegetables while reducing sugar and processed foods can significantly lower your risk.
I do want to be healthier, but it's hard to know where to start.
It can be overwhelming, but you don't have to do it all at once. Start with small, manageable steps. Your local doctor can help you create a personalized plan that fits your lifestyle. Plus, there are many resources and support groups available to guide you.
You're right. It's time to take better care of myself. I'll make an appointment with my doctor.
That's a great decision, Miss Johnson. Remember, the goal is to empower you to take charge of your health. If you have any questions or need further advice, don't hesitate to reach out.
Thank you, Dr. Smith. I feel much more at ease now.
You're welcome. Take care, and I wish you the best on your journey to better health.
Thanks again. Have a good day.
You too, Miss Johnson.
Good morning, John. How have you been feeling since your last visit?
Good morning, Dr. Parker. Well, up until about a week ago, I was managing okay with the NSAIDs, but then I had this flare-up and the joint pain and fatigue are really bad again.
I'm sorry to hear that, John. Flare-ups can be really tough. Rheumatoid arthritis is a chronic condition, which means it's something we'll need to manage over the long term. It doesn't just go away, but we can work together to keep it under control.
I was hoping it might just be a temporary thing. Is this flare-up going to settle down?
Yes, this flare-up will likely settle down, especially with the right treatment. However, RA tends to have periods of remission and relapse. The important thing is to manage the symptoms and reduce the frequency and intensity of these flares.
I see. What can I do to cope with it better?
There are several strategies that can help. Getting plenty of rest and sleep is crucial. Modifying your diet can also make a difference. Focusing on anti-inflammatory foods, such as fruits, vegetables, and omega-3 fatty acids, can be beneficial. Sensible exercise is important too. Long walks can help keep your joints flexible and improve your overall fitness. Massage and hot treatments, like warm baths or heat packs, can also relieve pain and stiffness.
I've been trying to stay active, but it's hard with the pain.
I understand. It's a balance. Listen to your body and don't overdo it, but also try to stay as active as you can. Gentle, low-impact activities are best.
That makes sense. Is there anything else I should be aware of?
Yes, I want to reassure you that early diagnosis and intervention are crucial for improving outcomes with RA. The fact that we've caught it and started treatment early is a good thing.
That's good to hear. But what about the smoking? Does it affect my RA?
Smoking can actually make RA worse. It can increase the severity of symptoms and reduce the effectiveness of some treatments. Quitting smoking is one of the best things you can do to improve your overall health and better manage your RA.
I've been thinking about quitting. I know it's not good for me.
That's great to hear, John. There are many resources available to help you quit, from nicotine replacement therapies to support groups. I can provide you with some information and refer you to a program if you're interested.
I'd appreciate that. Thanks.
Another thing we can consider is getting specialist advice from a rheumatologist. They can offer additional treatments, such as cortisone injections, which might help with severe flare-ups. Would you be interested in a referral?
Yes, I think that would be helpful.
Excellent. I'll arrange a referral for you. In the meantime, let's continue with your current medications and the lifestyle strategies we discussed. And remember, I'm here to support you. If you have any questions or need help with anything, don't hesitate to contact me.
Thank you, Dr. Parker. I feel a bit more hopeful now.
You're welcome, John. We're in this together. Take care, and I'll see you at your next appointment.
Thanks, Doctor. See you then.
Good morning, Miss Thompson. How can I help you today?
Good morning, Doctor. I've been feeling quite anxious lately because my boss has ordered everyone at work to get the flu vaccination. I'm worried because my uncle had a bad reaction to it a few years ago, but I've also applied for a promotion and I feel pressured to follow the boss's orders. I'm not sure what to do.
I understand your concerns, Miss Thompson. It's natural to feel anxious, especially when you've heard about someone having a bad experience. Let's go through this step by step so you can make an informed decision.
Thank you, Doctor. I really appreciate it.
First, it's important to know that the flu vaccine is generally safe. For most people, while anyone can get the vaccine, it's especially recommended for those in at-risk populations. This includes young children, pregnant women, the elderly, people with reduced immunity, and healthcare workers.
I see. But what about people like me, who are relatively healthy?
For healthy adults like yourself, getting the flu vaccine is still beneficial. It can reduce your chances of catching the flu and help prevent the spread of the virus to others who might be more vulnerable. However, it's worth noting that the flu vaccine doesn't protect against all respiratory illnesses. You might still get coughs and colds, which are caused by different viruses.
That's good to know. But what about the safety of the vaccine? My uncle had a pretty bad reaction.
The flu vaccine is considered relatively safe, especially when compared to the potential complications of the flu itself. Influenza can lead to serious health issues, such as pneumonia, inflammation of the brain or heart, and even hospitalization. Adverse reactions to the vaccine are rare, and most side effects are mild, like soreness at the injection site or a low-grade fever.
That makes sense. I was also worried about my boss finding out about my medical decisions. Can he access my medical records?
No, your boss cannot access your medical records without your explicit consent. Your health information is private and protected by law. Whether or not you choose to get the flu vaccine is a personal decision and should be based on what you feel is best for your health.
That's a relief to hear. I was worried about my promotion being affected if I didn't get the vaccine.
I understand the pressure you're feeling. However, the decision to get the flu vaccine should ultimately be yours. It's important to weigh the benefits and risks based on your health and personal circumstances, not just the workplace directive. Remember, your boss can't legally coerce you into getting the vaccine, and your medical choices shouldn't impact your job advancement unfairly.
I really appreciate your advice, Doctor. It's good to know that my health decisions are private and that the vaccine is generally safe. I'll think it over carefully and make a decision soon.
You're welcome, Miss Thompson. Take your time to consider all the information, and if you have any more questions or need further reassurance, don't hesitate to contact me. Your health and peace of mind are very important.
Thank you so much. I feel a lot better about this now.
I'm glad to hear that. Take care and have a great day.
You too, Doctor. Thank you again. Good afternoon, Mr. Johnson. How are you doing today?
Not great, Doctor. I'm really stressed out and need your help.
I'm sorry to hear that. What seems to be the problem?
Well, as you know, I've been going through a tough divorce, and it's been incredibly stressful. I really need a break. I asked my boss for a couple of weeks off to clear my head, but he refused. So I was hoping you could give me a medical certificate for some time off.
I understand how stressful a divorce can be, and I'm sorry you're going through this. However, I can't issue a medical certificate unless there is a legitimate medical reason.
But I'm stressed, Doctor. Isn't that enough?
Stress is indeed a serious issue, and it can have a significant impact on your health. However, issuing a certificate that states you are unfit for work due to a medical condition like depression when you are not clinically depressed would be misleading.
But I really need this time off. It's just 2 weeks. Can't you make an exception?
I wish I could help, but I have to adhere to medical ethics and professional standards. Issuing a deliberately false or misleading certificate represents professional misconduct. It's not only about my professional integrity, but also about the trust between patients and doctors.
I didn't realize it was that serious. What could happen if my boss finds out I'm on vacation instead of being sick?
Misusing sick leave is indeed a serious matter. If your boss questions the validity of the medical certificate and finds out that you were on vacation instead of being ill, it could have serious consequences for your job. It could also undermine your credibility at work and create distrust.
I hadn't thought about that. I just feel so overwhelmed and desperate for a break.
I understand that, and your health is important. While I can't provide a medical certificate for leave under false pretenses, I can offer you other forms of support. Have you considered seeing a psychologist? They can provide you with stress management techniques and coping strategies that could be beneficial in the long run.
I've never really thought about seeing a psychologist. Do you think it would help?
Absolutely. Therapy can be incredibly effective in managing stress and helping you develop healthier ways to cope with your current situation. It can also provide you with a safe space to talk about what you're going through and receive professional guidance.
I suppose that makes sense. I've just been trying to handle everything on my own.
It's completely understandable to feel that way, but you don't have to go through this alone. Taking care of your mental health is just as important as taking care of your physical health. Seeing a psychologist could provide you with the support you need to get through this difficult time.
All right, I'll give it a try. How do I get started?
I can refer you to a psychologist who specializes in stress management and can help you work through the challenges you're facing. Let's set that up, and in the meantime, make sure you're taking care of yourself as best as you can.
Thank you, Doctor. I appreciate your help and honesty.
You're welcome, Mr. Johnson. We'll get through this together. I'll have my assistant give you the information you need to make an appointment with the psychologist. Remember, it's important to take care of yourself, and seeking help is a strong and positive step forward. Hello, Mr. Johnson. Hi, Jake. I see you've had a bit of a rough day.
Yes, Doctor. Jake got stung by a bee about half an hour ago. I'm really worried because his cousin had a severe reaction last year and had to go to the hospital.
I understand your concern, especially given your family's experience. Let's take a closer look at Jake's arm. It does look quite red and swollen, but I don't see any signs of a severe allergic reaction.
But shouldn't we take him to the hospital just in case? I don't want to take any risks.
I hear you, Mr. Johnson, and your worry is completely valid. However, based on what I see right now, Jake is showing a localized reaction, which is quite common with bee stings. It's been half an hour, and he doesn't have any systemic symptoms like hives, wheezing, shortness of breath, or weakness. These are the signs we watch for that would indicate an anaphylactic reaction.
So you're saying he doesn't need to go to the hospital?
Correct. There's no indication at this point that Jake needs hospitalization. What we can do is manage his symptoms at home and keep a close eye on him. If he starts showing any signs of a more serious reaction, we can act quickly then.
What should I do at home?
First, let's help Jake feel more comfortable. You can apply ice to the sting area to soothe the pain and reduce swelling. Just wrap some ice in a cloth and hold it gently against the skin.
Okay, ice, got it.
Next, it's important to clean the affected area to prevent any infection. You can use mild soap and water for this. Gently clean around the sting site.
All right, I'll make sure to clean it properly.
For the itching and swelling, you can give Jake an over-the-counter antihistamine like Benadryl. It will help reduce the itching and make him more comfortable. Be sure to follow the dosage instructions for his age.
Benadryl? I'll get some on the way home. Is there anything else I should watch out for?
Yes, keep an eye out for any signs of a more serious allergic reaction. These include hives appearing on other parts of his body, difficulty breathing, swelling around the mouth or eyes, or if he seems unusually weak or faint. If you notice any of these symptoms, seek medical help immediately.
I understand. I'll watch him closely.
You're doing the right thing by being vigilant. Most children only have localized reactions to bee stings, but it's always good to be cautious. If you have any concerns or if his condition changes, don't hesitate to call us or bring him back in.
Thank you, Dr. Smith. I feel a bit more at ease now.
You're welcome, Mr. Johnson. It's always better to be safe and prepared. Jake, you're a brave boy. We'll get you feeling better soon.
Thanks again, Doctor. We'll head home and follow your advice.
Take care, and let me know if you need anything. Have a good day, both of you.
You too. Goodbye.
Goodbye. Good morning, Mr. Thompson. How are you and Jennifer doing today?
Good morning, Doctor. I'm really worried. Jennifer's cough seems to be getting worse, and she still has a fever. She was up all night coughing, and it sounded really harsh.
I'm sorry to hear that Jennifer's having such a tough time. Let's go over her symptoms again to get a clear picture. Besides the barking cough and fever, has she been sneezing more or had any trouble breathing?
Yes, she's still sneezing a lot. And her breathing sounds raspy at times, especially when she's lying down. It's like she's struggling to catch her breath.
I understand your concern, Mr. Thompson. Based on what you're describing, it sounds like Jennifer's croup symptoms are persisting, which is not uncommon. We may need to take a more proactive approach to help her feel better and manage her symptoms. I'd like to suggest we start her on a course of steroid treatment.
Steroids? Are they safe for her at such a young age? What are the side effects?
That's a very valid question. Steroids can be very effective in reducing the inflammation in Jennifer's airways, which is causing the barking cough and difficulty breathing. However, like any medication, they do have potential side effects. Some children might experience a suppression of the immune system, which can make them more prone to infections. There could also be changes in behavior, like increased irritability, and in rare cases, it can affect growth if used long-term. But for short-term use, such as in Jennifer's case, these side effects are usually minimal.
I see, but are steroids really necessary? Couldn't we just use antibiotics instead?
That's another good point. However, antibiotics are not effective for croup because it's typically caused by a viral infection, not a bacterial one. Steroids are the best treatment because they directly address the inflammation in her airways, which is the main issue causing her symptoms. They can help reduce the severity of her cough and improve her breathing relatively quickly.
That makes sense. I just want to make sure we're doing what's best for her.
Absolutely, Mr. Thompson. Your concern is completely understandable. Steroids are considered the most effective treatment for mild to moderate croup, and they can help Jennifer feel more comfortable and breathe more easily. We'll start with a low dose to minimize any potential side effects.
Okay, if you think that's best, let's do it. How soon will we see any improvement?
Most children start to feel better within a few hours after the first dose, but it can take up to 24 hours for the full effect. To ensure we're on the right track, I'd like to review Jennifer's case in 24 hours. We'll check her symptoms and make sure she's responding well to the treatment.
That sounds good. Thank you, Doctor. I really appreciate your help.
Of course, Mr. Thompson. I'm here to support you and Jennifer through this. If you notice any significant changes in her condition before our next appointment, don't hesitate to contact me. We'll do everything we can to get Jennifer feeling better soon. Good afternoon, Mrs. Johnson. I'm Dr. Smith. I understand you've been having some abdominal pain. Can you describe it for me?
Yes, doctor. It started about 24 hours ago. It's a continuous pain in my upper abdomen, and it's been getting worse. Now it's radiating into my back. I feel nauseated and sometimes hot and cold.
I'm sorry to hear that. You look quite unwell and dehydrated. I see from your chart that you have a fever of 38.5 degrees Celsius, a pulse of 108 beats per minute, and a blood pressure of 124/76 mmHg. We'll need to address this promptly. Before we go further, can I ask if you smoke or drink?
Yes, I smoke about 15 cigarettes a day, and I usually share a bottle of wine with my husband each evening.
Thank you for sharing that. It's important for us to have a complete picture of your health habits. Could you also tell me what your last meal was?
It was a big one. We were celebrating my brother's birthday at a fancy restaurant. I had cream of chicken soup, steak, lobster, cake, ice cream, and quite a bit of wine.
That's quite a meal. Based on your symptoms and the results of your abdominal X-ray, I believe you have a condition called acute cholecystitis. Have you heard of it before?
No, I haven't. What is cholecystitis?
Cholecystitis is an inflammation of the gallbladder. It's quite common in obese, middle-aged women, and it's often triggered by eating a fatty meal, like the one you described.
Oh, I see. But what causes it?
Most often, cholecystitis is caused by a gallstone blocking the cystic duct, which leads to inflammation and infection of the gallbladder.
This sounds serious. Should I be worried?
I understand your concern, Mrs. Johnson. Cholecystitis can be serious, but we're going to take good care of you. I would like to admit you to the hospital for further testing including a chest x-ray to rule out pneumonia and an abdominal ultrasound to check if your gallbladder wall is inflamed.
Will I need surgery?
It's possible, but we'll need to do more tests to determine the best course of action. The important thing is that you're in the right place to get the care you need. The hospital team and I will make sure you're well taken care of.
Thank you, doctor. I'm just really scared about what's happening.
It's completely understandable to feel that way. We're here to help you, and we'll do everything we can to make sure you get better. Do you have any other questions or concerns right now?
No, I just hope I'll be okay.
You're in good hands, Mrs. Johnson. Let's get you admitted and start the necessary tests. We'll take it one step at a time and keep you informed throughout the process.
Thank you, Dr. Smith. That means a lot.
You're welcome. Let's get you settled and begin your treatment. Good morning, Mr. Johnson. I'm Dr. Collins, one of the surgical residents here. I understand you have some concerns and questions about your procedure today. How can I help?
Good morning, Dr. Collins. Yes, I do have a few concerns. My GP assured me that the lump on my back is a benign lipoma, but I can't shake the worry that it might be cancerous. How will the surgeon know for sure?
I understand your concern, Mr. Johnson. While your GP has assessed it as a benign lipoma, we will still take a very thorough approach. During the surgery, the lump will be removed and sent to our pathology lab, where it will be examined under a microscope. This examination will provide a definitive answer regarding its nature. It's a standard procedure and quite reliable.
But why do I have to wait 2 weeks to find out? That feels like such a long time to be anxious about the results.
The 2-week period allows our pathologists sufficient time to carefully analyze the tissue. They look at the cells in detail to make sure nothing is missed. Also, during your follow-up appointment, the surgeon will check on how your wound is healing and discuss the pathology results with you. It's a comprehensive review to ensure you're healing well and to address any concerns you might have.
I see, it's just hard not to worry. Another thing I'm concerned about is scarring. I know the lump is quite large. What can be done to minimize the scar?
That's a valid concern, Mr. Johnson. Given the size of the lump, there will be a scar, but we'll do our best to make it as minimal as possible. After the surgery, keeping the wound dressed with Steri-strips for about a month can help reduce the appearance of the scar. The Steri-strips help the edges of the skin to stay together and heal neatly. The surgeon will go over this in more detail after the procedure.
All right. And what about the lump coming back or other lumps appearing elsewhere? What if the surgeon doesn't remove it all?
Once the lump is removed, it's unlikely to grow back in the same place. Lipomas are generally well encapsulated, meaning they have a clear boundary, which makes them easier to remove completely. While it's possible for new lipomas to develop elsewhere on your body, it's not common for them to return in the same spot. Rest assured, the surgeon will make every effort to remove it entirely. Recurrence in the same location is quite rare.
That's a relief to hear. I've just been so anxious about all of this.
It's completely natural to feel anxious, Mr. Johnson. We're here to support you through the process. Do you have any other questions or concerns that I can address before we proceed?
No, I think you've covered everything. Thank you, Dr. Collins. I feel a bit more at ease now.
You're welcome, Mr. Johnson. I'm glad I could help. The surgical team will take good care of you today. If you think of any other questions later, don't hesitate to ask.
Thank you, Dr. Collins. I appreciate it.
My pleasure. I'll see you after the procedure to check on you. Take care. Good afternoon, Mr. Smith. How have you been?
Good afternoon, Dr. Roberts. I've been okay, but I'm here because I need a refill on my sleeping pills. Work has been incredibly busy and stressful, and I've run out of my prescription.
I see. How often have you been taking the sleeping pills?
I've been taking them every night. They help me relax and cope with the stress from work. I don't think I can manage without them right now.
I understand that they help you feel more relaxed, but long-term nightly use of sleeping pills, especially benzodiazepines, isn't recommended. They can lead to dependency, and they don't actually cure the underlying sleep problems or anxiety.
But they've been so effective for me. I don't know how I'll cope without them. Can't you just prescribe me another batch?
I'm sorry, Mr. Smith, but I can't prescribe more benzodiazepines. It's important to address the root cause of your stress and sleep issues rather than relying on medication. We need to consider other, safer ways to help you manage.
How will I cope then? I have a lot of responsibilities and constant travel. The pills make it possible for me to function. Without them, I'm worried I won't be able to handle my job.
I understand your concerns. There are several non-medical interventions we can try that can be very effective. Regular exercise, for example, can significantly reduce stress and improve sleep quality. It's also important to manage your workload and learn to say no when necessary. Reducing your intake of alcohol and caffeine can also help.
I hear you, but the pills are just so convenient. I promise once work slows down, I'll stop taking them. But for now, I really need them.
I know it's challenging, especially with your busy schedule, but it's crucial to address this issue safely. Stopping the pills suddenly can lead to withdrawal symptoms, so we need to gradually decrease the dose. In the meantime, we can explore other strategies to help you cope with your anxiety and improve your sleep.
I'm really reluctant to stop because they've been so effective. But if I have to, what should I do?
We'll create a tapering plan to gradually reduce your dosage, minimizing the risk of withdrawal symptoms. Alongside this, we'll develop a comprehensive plan that includes lifestyle changes, such as regular exercise, stress management techniques, and possibly cognitive behavioral therapy, CBT, for insomnia and anxiety. These methods can provide long-term relief without the risks associated with long-term medication use.
Okay, I'll try to follow your advice. It's just hard to imagine managing without the pills.
I understand, Mr. Smith. It's a significant change, but I'm here to support you through this process. Let's work together to find a sustainable solution that will improve your overall well-being. We'll take it step by step.
All right, Dr. Roberts, I'll give it a try. Thank you for your help.
You're welcome. I'll make a follow-up appointment to monitor your progress and adjust our approach as needed. We'll get through this together. Good afternoon, Miss Adams. What brings you in today?
Good afternoon, Dr. Thompson. I've been having these throbbing headaches on the left side of my head, especially around the temple area, for the past 3 months. The pain is so intense that I have to lie down, and it often makes me feel nauseous. Paracetamol doesn't help at all.
That sounds quite distressing. How often are you experiencing these headaches?
It happens a few times a week. I've noticed that they often come after I've been drinking red wine. It's becoming really frustrating and worrying.
I see. Have you noticed any other triggers besides red wine? And do you have any other symptoms like visual disturbances, sensitivity to light, or sound?
No, it's mostly the red wine. Sometimes bright lights make it worse, but it's mainly the wine that triggers them.
Given your symptoms and the trigger of red wine, it sounds like you might be experiencing migraines. Migraines can cause severe, throbbing pain on one side of the head and are often accompanied by nausea. However, we should conduct a neurological examination to rule out any other causes and ensure there are no signs of a more serious condition.
I'm really worried it might be something serious, like a tumor. My mother had similar headaches, and she took a strong medication containing barbiturate. Could this be hereditary?
It's understandable to be concerned, but migraines often run in families, so it's quite possible that you've inherited a predisposition to them from your mother. The good news is that migraines are not usually linked to tumors or other serious conditions. Nonetheless, the neurological exam will help us be thorough.
Okay, but if it is migraines, can I get a prescription for the same medication my mother used to take? It worked for her.
While barbiturates were used in the past, they are not commonly prescribed today due to their habit-forming nature and potential side effects. We have more effective and safer treatments available now.
But I know those worked for her. Are you sure they wouldn't be the best option for me?
I understand your frustration, but there are several modern treatments that are very effective for migraines. We can look at both preventative options to reduce the frequency of your headaches and abortive treatments to stop a migraine once it starts.
What kind of treatments are those?
For prevention, we can consider medications like beta blockers, anticonvulsants, or certain antidepressants. Lifestyle modifications, such as regular exercise, managing stress, and avoiding known triggers, are also important. For abortive treatment, triptans are a common and effective option. They work by narrowing blood vessels and reducing inflammation.
That sounds like a lot to manage. Will these new medications actually help?
Many patients find significant relief with these treatments. We can start with one approach and adjust as needed based on how you respond. The goal is to reduce both the frequency and severity of your migraines.
I'm just really worried about dealing with this while I'm teaching. The headaches are so debilitating.
I understand. Let's work together to find a treatment plan that will help you manage your migraines effectively. We can start with a non-barbiturate medication to see how you respond and make adjustments if necessary. Also, keeping a headache diary to track your triggers, symptoms, and responses to treatment can be very helpful.
All right, I'll give it a try. I just want to be able to function normally again.
That's our goal too. We'll monitor your progress closely and make sure we find the best approach for you. Let's start with a neurological exam today, and then we can discuss the next steps for managing your migraines.
Thank you, Dr. Thompson. I appreciate your help.
You're welcome, Miss Adams. Let's get started on that exam and take it from there. Good afternoon. I'm Dr. Smith. I understand your daughter was bitten by a dog. How is she feeling right now?
She's still quite upset and a bit scared. It was such a shock for both of us. I've never dealt with anything like this before, and
I can imagine how upsetting this must be. Can you tell me exactly what happened?
we were at our friend's house. Their dog was playing with my daughter when it suddenly bit her on the face, near the hairline. I quickly washed the wound under cold running water and stopped the bleeding with a sterile dressing.
You did the right thing by washing the wound and applying a dressing. How long ago did this happen?
About 2 hours ago.
And did your daughter have a tetanus vaccination recently?
I think she had one last year, but I'm not completely sure.
That's helpful. I'll check her records to confirm her tetanus vaccination status. Since the wound is recent and you cleaned it well, that's a good start. Let me take a closer look at it now. The wound is small and superficial, which is good news. We'll clean it thoroughly here, and I'll apply a sterile dressing. It doesn't appear to need stitches, just proper cleaning and monitoring.
But what about infection? Dogs eat filthy things, and I'm really worried about that.
I understand your concern. Dog bites can be worrying, but in this case, the risk of infection is low. The wound is fresh, on the face where there's excellent blood supply, which helps in healing and preventing infection. I don't think antibiotics are necessary.
Are you sure? I'd feel much better if she took something to prevent an infection.
I assure you, the best course of action right now is to keep the wound clean and monitor it. Antibiotics are generally not needed for small, superficial wounds like this one. Overusing antibiotics can lead to other issues like resistance. If we see any signs of infection later, we can reassess.
What should I look for to know if it's getting infected?
You should watch for increased redness, swelling, warmth, or pus coming from the wound. Also, if she develops a fever or the pain increases significantly, those are signs to seek medical attention.
How should I take care of the wound at home?
Keep the wound clean and dry. Change the dressing daily or if it gets dirty or wet. You can clean it gently with mild soap and water. I'd like you to bring her back for a review in 48 hours so we can ensure it's healing well.
This whole incident is so frustrating. Our friends assured us their dog was great with kids. We had no experience with dogs and trusted their judgment.
It's understandable to feel frustrated, especially in an unfamiliar situation. Dogs can be unpredictable, even those that are usually good with children. It's always important to supervise children closely around animals.
Thank you, Dr. Smith. I appreciate your help and guidance.
You're welcome. We'll take good care of your daughter. If you have any concerns or questions, don't hesitate to reach out. Good morning, Mr. Anderson. How can I help you today?
Good morning, Doctor. I've come in because I've noticed something unusual with my 8-year-old daughter. Although she seems well overall, energetic, eating well, no recent infections, I found blood in her urine. I'm concerned but hoping there's a simple explanation.
I see. It's understandable to be concerned. How long have you noticed the blood in her urine?
It started a couple of days ago. At first, I thought it might be something minor, but it's persisted.
And you mentioned she hasn't had any recent infections, correct? Has she had any changes in her behavior, appetite, or energy levels?
No, nothing out of the ordinary. She's been her usual self, playing, eating well, and full of energy.
That's good to hear. Blood in the urine is not a usual symptom for a young child, so it's something we should definitely investigate further.
Is this symptom unusual? I haven't heard of other children having it.
Yes, it is unusual, but it's important not to jump to conclusions. It might not be serious, but it's worth looking into. There are several potential causes, some more concerning than others.
What could this symptom indicate?
There are various possibilities. It could be something as simple as a minor infection or irritation, but it could also indicate an issue with her kidney function. We'll need to perform a blood test to get a clearer picture.
A blood test? How soon will we get the results?
We can perform the blood test immediately, and we'll try to get the results as soon as possible. Once we have more information, we can discuss the findings and next steps.
Is there a chance it could be something serious?
It's too soon to say for certain. While it could be indicative of a kidney issue, there are also many benign explanations. The important thing is that we're taking the right steps to find out what's going on.
I understand. I just want to make sure we're doing everything we can to help her.
Absolutely, Mr. Anderson. We're going to do everything necessary to ensure your daughter's health. The blood test will give us a better understanding, and then we can decide on the best course of action.
Thank you, Doctor. I appreciate your help and reassurance.
You're welcome. I know it's worrying, but we'll work through this together. Let's get that blood test done, and we'll take it from there. Good afternoon, Mr. Davis. Thank you for coming in. How are you holding up today?
Good afternoon, Dr. Carter. I'm managing, thank you. Just anxious to hear the results.
I understand. Let's get right to it. We received the results of your daughter Lily's ultrasound, and unfortunately, the news isn't what we were hoping for.
What did the ultrasound show?
The ultrasound indicates that Lily has a form of kidney cancer known as Wilms tumor. It's a type of cancer that develops in the kidneys and is most commonly found in children.
Kidney cancer. What does this mean? How common is this cancer, and what is its prognosis?
Wilms tumor is the most common type of kidney cancer in children. The good news is that it can be effectively treated in most cases. The prognosis for children with Wilms tumor is generally very good, especially when it's caught early and treated promptly.
I see. Who will be coordinating her treatment plan?
Lily needs to be seen by a pediatric oncologist as soon as possible. They specialize in treating cancers in children and will be the primary coordinator of her treatment plan. I'll arrange for an appointment with a specialist straight away.
Do you have any suggestions about specialists we should see?
Yes, I have a few recommendations for excellent pediatric oncologists in the area. I'll make sure to connect you with someone who has extensive experience with Wilms tumor. I'll also coordinate with them to ensure that Lily gets an appointment as soon as possible.
Thank you, Dr. Carter. I appreciate all your help. This is a lot to take in, but knowing there's a plan helps.
I understand this is overwhelming, Mr. Davis. We're here to support you and Lily through every step of this process. If you have any more questions or need anything, please don't hesitate to ask. I'll make those arrangements now, and we'll get through this together.
Thank you. I really appreciate it.
You're very welcome. Take care, Mr. Davis. I'll be in touch shortly with more details about the specialist appointment.
Thank you, Dr. Carter. We'll be waiting to hear from you.
Good afternoon. I've had a look at your cut, and it seems quite infected. Could you tell me if you've taken anything for the pain or applied any medications to the area?
Yes, I've only taken paracetamol for the pain. I've changed the bandage 3 times, each after showering.
Thank you for that information. Have you had a tetanus injection recently?
I had a tetanus injection once as a child.
Given that it's been a long time since your last tetanus shot, I would recommend another injection. The cut looks infected, and it will require treatment, including antibiotics.
Can you give me some antibiotics?
Absolutely. I'll prescribe some antibiotics for you. However, it's also crucial to clean the wound properly to remove any foreign bodies and reduce the infection.
I really don't want the wound cleaned. It sounds very painful.
I understand your concern, but cleaning the wound is necessary to prevent the infection from getting worse. If we leave it as it is, the infection could spread, which would be much more painful and harder to treat.
Okay, I guess you can clean it then.
Great. I'll be as gentle as possible. Now, about the tetanus injection, it's necessary because your last one was a long time ago, and with a cut like this, especially from metal, we need to ensure you're protected against tetanus.
Why do I need another tetanus injection if I had one as a child?
The protection from a tetanus shot you received as a child diminishes over time. Typically, we recommend a booster shot every 10 years to maintain immunity.
All right, that makes sense. You mentioned something about surgical debridement earlier. What does that mean?
Surgical debridement involves removing unhealthy tissue from the wound to promote healing. It's a procedure we consider if the infection doesn't improve with antibiotics and wound care. It's a more aggressive way to ensure all infected tissue is removed.
Got it. So, you'll clean the wound now, give me the tetanus shot, and prescribe antibiotics?
Exactly. and I'd like to see you again tomorrow to review the wound's progress. If it continues to deteriorate, we might have to consider surgical debridement, but hopefully it won't come to that.
All right, thank you, Doctor.
You're welcome. Let's get started. Good morning, Jennifer. How have you been feeling since our last checkup?
Not great, actually. I've had this really irritating feeling in my throat ever since I ate dinner at a restaurant 2 days ago.
I see. You mentioned eating fish for dinner that night, right? When exactly did you start feeling this pain in your throat?
Yes, it was during that dinner. I ate a whole fish, and I think that's when it started. I feel like there's still a fish bone stuck in there.
I understand that must be uncomfortable. However, after examining your throat, I didn't see any foreign objects like a fish bone. It's possible that your esophagus got scratched, which is causing the irritation and swelling you're feeling.
But it really feels like the bone is still in there. Are you sure it's not there? How can you tell?
I can assure you that from what I observed during the examination, there was no bone. The sensation you're feeling is likely due to a scratch on the esophagus, which can feel just as uncomfortable as a stuck bone.
So, will this get better soon? It's very uncomfortable.
Yes, these symptoms usually resolve on their own. I'd recommend soft foods and plenty of fluids to help ease the irritation. If the pain or discomfort doesn't settle in a few days, we can go ahead and perform an X-ray to be completely sure, and if necessary, I can refer you to a gastroenterologist.
That sounds good. I guess that makes me feel a bit better knowing it might just be a scratch.
I'm glad to hear that. Just keep an eye on the symptoms, and don't hesitate to come back if you don't see any improvement or if it gets worse. I'm here to help.
Thank you, doctor. I appreciate your help and the reassurance. I'll follow your advice and hope this clears up soon.
You're welcome. Take care, and make sure to rest your throat. Good morning, Mr. Johnson. How are you feeling today?
Good morning, Dr. Smith. I've been feeling more anxious lately. There's something important I need to discuss with you.
Of course, Mr. Johnson. What's on your mind?
My son wants to become my medical power of attorney, and I'm feeling pressured about it. Is it necessary that I appoint a medical power of attorney?
It's not strictly necessary to appoint a medical power of attorney, MPOA, Mr. Johnson. However, it can be beneficial to have someone you trust to make medical decisions on your behalf if you're unable to do so, but it's important that you feel comfortable with your choice.
The thing is, my son lives interstate, and we've never been very close. I'm worried he might appoint himself as my MPOA without my consent as my mental health declines. This is making me really anxious.
I understand your concerns, Mr. Johnson. Let me reassure you that no one can appoint themselves as your MPOA without your explicit consent. For it to be legally valid, you must have the capacity to understand the implications and consequences of appointing an MPOA.
That's a relief to hear. But I'm also worried that if he becomes my MPOA, he might arrange for euthanasia or refuse palliative care for me.
I can assure you, Mr. Johnson, that an MPOA cannot arrange for euthanasia or refuse palliative care on your behalf. There are strict legal guidelines in place to protect your wishes and well-being. Your end-of-life choices are respected and cannot be overridden by your MPOA.
That does make me feel a bit better. But I still don't know if I should appoint my son or someone else.
You have the option to appoint someone else whom you trust and feel comfortable with. It could be a close friend or another family member. It's entirely your decision.
I see. What can I do to ensure my wishes are respected?
We can prepare an advance care plan for you. This document will outline your preferences for medical treatment and end-of-life care, ensuring your wishes are known and respected. Additionally, I recommend making sure you have a current and clear will.
That sounds like a good plan. How do we get started?
We can start working on your advance care plan today. I'll help you document your preferences, and we can discuss any questions you have along the way. I'll also provide information on updating your will if needed.
Thank you, Dr. Smith. I appreciate your support and guidance.
You're welcome, Mr. Johnson. We're here to support you every step of the way. Let's begin with your advance care plan. Good afternoon, Mr. Smith. How are you feeling today?
Good afternoon, Dr. Jones. I'm feeling a bit anxious, to be honest. I have some concerns about my recent diagnosis of Hashimoto's thyroiditis.
I understand. It can be quite overwhelming to receive such news. How can I assist you today?
Well, the endocrinologist advised me to inform my 2 adult children about my diagnosis because it's hereditary. I'm worried about my privacy. Do I have to inform them?
I understand your concerns about privacy. Your medical records are confidential, and you are not legally obligated to disclose your diagnosis to anyone, including your children. However, I do encourage you to consider it for a few reasons.
I don't see how it would benefit them. It's a late-onset condition and unavoidable. Sometimes ignorance is bliss, right?
It's true that Hashimoto's thyroiditis typically develops later in life and cannot be entirely prevented. However, early awareness could help your children manage their health more proactively. They could adopt healthier lifestyle choices, monitor symptoms more closely, and seek medical advice promptly if they notice any issues.
I'm also concerned that if they know about this family history, it might affect their ability to get life and health insurance policies. That makes me really reluctant to disclose my diagnosis to them.
I understand your concern about the potential impact on their insurance options. While I can't provide specific advice on insurance policies, many benefits can come from disclosing this information. Knowing their family medical history could lead to more accurate diagnoses and appropriate treatments if they develop any symptoms in the future.
But what if this knowledge causes them unnecessary stress or worry about something that might never even happen to them?
That's a valid concern. It's important to approach this delicately. You know your children best and can gauge how they might react. You might consider discussing this with a genetic counselor who can help you and your children understand the implications and manage any anxiety that may arise from knowing their genetic risk.
A genetic counselor?
Yes, a genetic counselor can provide detailed information about the hereditary nature of Hashimoto's thyroiditis, discuss the risks and benefits of testing, and offer support on how to handle this knowledge emotionally and practically. They can help your children understand their risks and take preventive measures without causing undue stress.
I see. I hadn't thought about that. It's just a lot to take in, and I don't want to make things harder for them.
It's perfectly normal to feel that way. Take your time to consider the options and discuss them with your family when you feel ready. Remember, disclosing your diagnosis doesn't mean immediate testing or drastic changes. It's about providing them with information so they can make informed decisions about their health in the future.
Thank you, Doctor. This has been helpful. I'll think about what you've said and consider talking to a genetic counselor.
You're welcome. If you have any more questions or need further support, don't hesitate to reach out. We're here to help you through this.
I appreciate that. Thank you again.
Take care, and we'll be here if you need anything. Good morning, Jack. What brings you in today?
Good morning, Dr. Smith. I've been having terrible stomach cramps after having milk and dairy products. It's really strange because I've been having milk and yogurt every morning for years, but now they make me feel sick and
I see. Have you noticed any other symptoms, like flatulence or diarrhea?
Yes, actually. I've been experiencing a lot of flatulence and diarrhea as well. It's been quite uncomfortable.
I'm sorry to hear that. Have you had any stomach problems recently, like gastroenteritis?
Yes, I did. I had a bout of gastroenteritis about 2 weeks ago. It lasted for 3 days.
That could be a significant factor. Based on what you've described, it sounds like you might be experiencing secondary lactose intolerance. This can happen after an episode of gastroenteritis because the infection can affect the lining of your gut.
But I can't be lactose intolerant. There's no history of it in my family, and I've never had any problems with dairy before.
Secondary lactose intolerance isn't hereditary like primary lactose intolerance. It's caused by damage to the gut lining, often from an infection like gastroenteritis. When the gut lining is damaged, it temporarily reduces your ability to produce lactase, the enzyme needed to digest lactose in dairy products.
I see. So, how long is this going to last? Will I ever be able to have dairy again?
In most cases, secondary lactose intolerance is temporary. As your gut lining heals, your lactase production should return to normal. This process can take several weeks, sometimes longer, depending on how quickly your body heals.
That's a relief to hear. Is there anything I can do to speed up the healing process or manage the symptoms in the meantime?
You can avoid dairy products for a while to prevent discomfort. There are also lactose supplements you can take before consuming dairy, which might help you digest lactose. Additionally, eating smaller, more frequent meals and staying hydrated can support your recovery.
Thank you, Doctor. I'll follow your advice and hopefully this will resolve soon.
You're welcome. If the symptoms persist or worsen, please come back and see me. We'll reevaluate and see if there's anything else that needs to be done.
I will. Thanks again.
Take care and feel better soon. Good morning, Jack. How can I help you today?
Good morning, Dr. Smith. I'm sorry to bother you. I don't usually come to see doctors, but I read something in the paper yesterday that got me worried.
No need to apologize, Mr. Johnson. That's what I'm here for. What did you read that concerns you?
Well, 6 days ago I was out in the garden digging around and a rusty nail went through my sandal and slightly penetrated the sole of my right foot. I cleaned it up with antiseptic and put a sterile dressing on it, but yesterday I read an article about people over 50 getting tetanus from simple garden wounds. I just wanted to make sure I'm okay.
I see. It's good that you came in. Can you tell me if you've had any symptoms like muscle stiffness or spasms, particularly in your neck or jaw?
No, I haven't noticed anything like that. Just a bit of tenderness around the wound.
That's a good sign. Tetanus is a serious condition, though. It affects the nervous system and can cause severe muscle stiffness and spasms. It's not something to take lightly. When was the last time you had a tetanus vaccination?
I had one when I was a child, but I'm not sure if I've had any boosters since then. Does that childhood vaccination still protect me?
Childhood vaccinations are very important, but they don't provide lifelong immunity. We recommend a tetanus booster every 10 years. As we age, our immune systems don't respond as robustly as they did when we were younger. Given your age and the nature of the injury, I would strongly recommend getting a booster shot today.
So the article wasn't exaggerating then? Tetanus is really something to worry about?
Unfortunately, no, it wasn't exaggerating. Tetanus can be very dangerous, especially for older adults. The booster shot will ensure you're protected.
All right, I'll take your advice and get the shot. Is it still safe for me to continue gardening? I really enjoy being out there.
Absolutely. Gardening is a great way to stay active and get some fresh air. Just make sure you wear proper footwear, something strong that covers your feet and has thick soles to prevent injuries like this in the future.
Thank you, Doctor. I appreciate your reassurance. I guess I should have been more careful with my footwear.
It's always a good idea to take precautions, but sometimes accidents happen. It's good that you came in to check. I'll have the nurse give you the tetanus booster, and you'll be all set. If you have any more concerns, don't hesitate to come back.
Thank you so much, Dr. Smith. I'll do that.
You're welcome, Mr. Johnson. Take care and happy gardening.
Good morning, Dr. Smith.
Good morning, Jack. Please come in and have a seat. How can I help you today?
Well, Doctor, I've been having pain in my right hip for years, but lately it's been getting worse. I'm using a walking stick now because it's become difficult to move around. I'm really worried about what this means.
I understand your concern. Let's talk about what's going on and what we can do to help you. Can you tell me more about the pain? When did it start getting worse?
The pain has been there for a long time, but over the past few months it's become much more intense. I'm worried it could be arthritis. What might be causing this pain?
There are a few possible causes for your hip pain. The most common cause, especially in people over 65, is osteoarthritis. This is a condition where the cartilage in the hip joint wears down over time. Other possibilities include bursitis, tendinitis, or even referred pain from your lower back. But given your age and the symptoms, arthritis is a likely culprit.
Why is the pain getting worse now?
Pain can worsen for a few reasons. If the underlying cause, like arthritis, remains untreated, the condition can progressively worsen. Over time, the joint may become more inflamed, and the cartilage can wear down further, leading to increased pain and stiffness.
Is this kind of problem common?
Yes, hip pain is quite common in people over the age of 65. Arthritis, in particular, affects many older adults. It's one of the most frequent causes of hip pain in this age group.
What should be done to diagnose the problem?
To diagnose the exact cause of your hip pain, we'll start with a physical examination. This will help us assess your range of motion, pain level, and any other symptoms. We'll also need to take an X-ray of your hip. This will show us the condition of your joint and help us determine if arthritis or another issue is present.
And what kind of treatment might follow?
Treatment will depend on the diagnosis. If it's arthritis, we can consider several options. These include weight loss to reduce stress on your hip, modifying your activities to avoid movements that worsen the pain, taking medications like paracetamol or nonsteroidal anti-inflammatory drugs, NSAIDs, to manage pain and inflammation, and physiotherapy to strengthen the muscles around your hip. In severe cases where conservative treatments don't help, we might discuss the possibility of a hip replacement surgery.
So, what should happen now?
The next step is to conduct a physical examination and take an X-ray of your hip. Once we have those results, we can confirm the diagnosis and create a treatment plan tailored to your needs. After the examination, we will schedule a follow-up appointment to go over the findings and discuss the best course of action. How does that sound?
That sounds good, Doctor. Thank you for explaining everything. I feel a bit more reassured now.
I'm glad to hear that. We'll do everything we can to help you manage the pain and improve your mobility. Let's get started with the examination and X-ray.
Thank you, Doctor. I appreciate your help.
You're welcome. We'll take good care of you. Good morning, Mr. Johnson. What brings you in today?
Hi, Doctor. Well, I've been having some issues lately. 2 days ago, I fainted at work and blacked out for a couple of minutes. This happened 3 months ago, too, and I was hoping it would go away, but now I'm worried it might be something serious.
I see. I'm sorry to hear that. Fainting episodes like this do need to be investigated further. Can you describe what happened before you fainted?
I felt dizzy and lightheaded both times, and then everything went dark. I woke up a few minutes later feeling disoriented.
It's important we get to the bottom of this. I'd like to perform an electrocardiogram, ECG, right here to check your heart's electrical activity. I also recommend a CT scan of your head to rule out any neurological issues and some basic blood tests to check your overall health.
I understand, but I have some crucial business deals coming up in the next couple of weeks. Is it possible to delay seeing a specialist until then?
I understand your situation, but these symptoms shouldn't be ignored. I strongly advise seeing a neurologist promptly to ensure we catch anything early on. They'll likely perform an EEG to check your brain's electrical activity, among other tests.
Will I need to take time off work for these tests?
Most appointments are fairly quick, but I'd recommend planning for a couple of hours for each visit, just to be safe.
Okay, I'll try to rearrange my schedule. About driving, though, I really can't afford to stop. Is it safe for me to keep driving?
Given the uncertainty about what's causing these episodes, I strongly advise against driving until we have a clearer picture. It's for your safety and the safety of others on the road.
I rely on my car a lot, but I guess you're right. Safety first.
Absolutely. Let's get started with the test today, and I'll arrange a referral to a neurologist as soon as possible. It's important we figure this out together.
Thank you, Doctor. I appreciate your help and advice.
You're welcome. Let's take it step by step, and we'll work towards understanding what's going on. I'll get everything prepared for you now. Good morning, Jack. How can I help you and your son today?
Good morning, Dr. Smith. I'm really worried about my son's growth. He's growing a lot faster than his classmates, and even his older brother wasn't this tall at his age. I'm concerned there might be something wrong.
I understand your concern. Let's take a closer look at his measurements. According to the growth chart, your son's weight, height, and other measurements are in the 90th percentile for his age. While this means he's at the high end of normal, it's not necessarily a problem. How tall were you and your spouse when you were children?
We were both of average height as children. Neither of us was particularly tall.
Thank you for that information. Given that, it's possible your son might be experiencing something called precocious puberty. This is when a child begins puberty earlier than usual, which can lead to a growth spurt and other changes.
Precocious puberty? Is that something to be worried about?
It can be a bit concerning, but it doesn't always indicate a serious problem. Sometimes it's just a phase, and children continue to grow at a normal rate afterward. However, in some cases, it could be linked to higher levels of hormones.
So what should we do next? If he's within normal limits, can't we just wait to see if his growth slows down?
I understand your confusion. While he's currently within the normal range, his rapid growth and other characteristics, like his deep voice, suggest that it might be wise to see a specialist. A pediatric endocrinologist can conduct more detailed tests to ensure everything is okay and to rule out conditions like excess growth hormone or pituitary adenomas.
A specialist? But if he's normal, why is that necessary?
It's a precautionary measure. If your son's rapid growth is related to excess growth hormone, it could lead to conditions like gigantism. Pituitary adenomas, which are non-cancerous tumors, can cause these hormone levels to rise, and won't usually stop growing without treatment. Seeing a specialist can help us manage or prevent any potential issues.
I see. That makes sense. It's better to be safe. How do we proceed with the referral?
I'll prepare the referral for you. The pediatric endocrinologist will be able to provide a more comprehensive evaluation and guide us on the best course of action. It's always better to be thorough when it comes to your child's health.
Thank you, doctor. I appreciate your help and reassurance.
You're welcome. I understand how worrying this can be, but we'll take the necessary steps to ensure your son's health and well-being. If you have any more questions or concerns, please don't hesitate to contact me.
Thank you. We'll follow up with the specialist as soon as possible.
Excellent. Take care, and I'll be here if you need any further assistance.
Thanks again, doctor. Have a good day.
You too. Goodbye. Good morning, Mr. Smith. How are you today?
Good morning, Dr. Jones. I'm doing okay, thanks. Here for my routine checkup.
Great. Let's get started. I noticed from your records that you've gained quite a bit of weight since your last visit. Your BMI is now 35, which puts you in the obese category. Can you tell me a bit about your diet and lifestyle recently?
Yeah, I've been working long hours at my computer, and since I work from home, I tend to snack a lot. Cakes, biscuits, easy stuff to grab while I'm working.
I see. Do you find that you eat a lot of takeaway food as well?
Yes, more than I should, I suppose. It's just convenient.
And how about physical activity? Do you manage to get any exercise in?
Not really. It's tough to find the time with my work schedule. Plus, I have arthritis in my knee, which makes it hard to do anything too physical.
I understand, but it's really important that we address this weight gain. Obesity can lead to serious health issues like cardiovascular disease and type 2 diabetes. Given your family history, with your father having died of a heart attack in his 50s, this is particularly concerning.
I don't think what happened to my father will happen to me. I'm just unlucky with my weight. It's beyond my control.
While genetics do play a role, lifestyle factors are something we can change. We need to focus on making some adjustments to your diet and finding ways for you to get more active. What if we start with small changes?
I really don't think I have the time. And with my knee, it's almost impossible to exercise.
There are still ways to incorporate physical activity into your routine. Even simple things like short, regular walks or gentle exercises that don't put too much strain on your knee can make a difference.
It's just very difficult with my schedule and the arthritis.
I understand it's challenging, but the risks are too significant to ignore. We need to find a way to make this work. How about we start with your diet? Reducing the amount of snacking on cakes and biscuits and cutting down on takeaway food could have a big impact.
I guess I could try, but I really don't see how much I can change on my own.
That's why I'd like to refer you to a dietitian. They can help create a meal plan that's both manageable and effective for you. It's a step towards gaining control over your weight.
I don't really want to see a specialist. I think I can manage on my own.
I understand your hesitation, but a dietitian can provide the guidance and support you need. It's not about making drastic changes overnight, but about finding a sustainable way to improve your health.
Well, okay, I'll give it a try. I'll see a dietitian.
That's great to hear. I'll set up a referral for you. We'll take it one step at a time, and I'm here to support you through this. Remember, these changes are crucial for your long-term health.
Thanks, doctor. I appreciate it.
You're welcome. We'll get you on the right track. I'll see you again in a few weeks to follow up on your progress. Good morning, Jack. How can I help you today?
Good morning, Dr. Smith. I've noticed swollen glands in my neck over the last few months. They don't hurt unless I drink alcohol, then they become a bit painful and my armpits get sore.
I see. That's definitely something we should look into. Have you noticed any other symptoms, like fatigue or weight loss?
Yes, I've been feeling a bit more tired than usual. I think I might have lost some weight, but I'm not sure. Also, I've noticed night sweats, especially when I drink alcohol.
I understand your concern. Have you had any family history of Hodgkin's lymphoma or any other cancers?
Not that I'm aware of. There's no family history of Hodgkin's lymphoma.
All right. Based on what you've told me, I can see why you're worried. Let's start with an examination to check your lymph nodes. From what I can see, you have some swelling in the cervical nodes, but there's no evidence of an enlarged spleen or liver. I couldn't feel any enlarged nodes in your armpits or above your collarbone.
What does that mean? Is it something serious?
Lymphadenopathy is the term we use for swollen lymph nodes. There are many potential causes, ranging from infections to inflammatory conditions, and even certain medications. It's not necessarily something serious, but we need to investigate further to understand the cause.
I read online that these symptoms could be Hodgkin's lymphoma. I'm really worried.
It's understandable to be worried, especially after reading information online. While Hodgkin's lymphoma is one possibility, it's relatively rare, and there are many other, more common reasons for lymphadenopathy. The good news is that your symptoms don't immediately suggest anything severe from the physical exam alone.
So, what do we do next? I really want to know what's causing this.
The first step is to run some blood tests to check for signs of infection or other abnormalities. A complete blood count can give us valuable information. Depending on the results, we can decide on the next steps.
Okay, I'll agree to the blood test, but can you also refer me to a specialist? I want to make sure we cover all bases.
I understand your need for thoroughness. Let's start with the blood tests, and once we have the results, we'll decide on the necessity of a specialist referral. If there's any indication that we need further investigation, I'll make sure you see the right specialist.
Thank you, doctor. I appreciate it.
You're welcome. Let's get those tests done, and we'll take it from there. Try not to worry too much in the meantime. We'll get to the bottom of this. Good morning, Jack. How can I help you today?
Good morning, Dr. Smith. A few months ago, I had shingles on my face just above my right eye. It has resolved, but now I'm experiencing a severe burning pain in that area. When I touch my skin, it triggers spasms. What could be causing this pain? Is it related to the shingles?
It sounds like you're experiencing post-herpetic neuralgia, which is a common complication after shingles. The virus can cause nerve damage, leading to persistent pain even after the rash has healed. This pain can feel like burning or shooting, and the skin can be very sensitive to touch.
That makes sense. What can you do for this pain? It's really bothering me.
There are several treatment options we can consider. To start, we can use standard painkillers like paracetamol or codeine to help manage the pain. Additionally, I can prescribe capsaicin cream for topical application. This cream can help reduce the pain, but it might cause a slight stinging sensation or sometimes coughing and sneezing when you first apply it.
Standard painkillers? Will they really work for this kind of pain?
They can be effective for many people, but if the pain persists, we might need to consider other medications like anticonvulsants, such as gabapentin or pregabalin. These are often used to treat nerve pain and can be quite helpful.
Do you think I'll need surgery to remove the painful skin?
No, surgery is not indicated for post-herpetic neuralgia. The pain is due to nerve damage, not an issue with the skin itself. Surgery wouldn't help and could actually make things worse.
I really dislike taking drugs. Are there any non-pharmacological treatments available?
Yes, there are several non-pharmacological approaches that might help. Techniques like relaxation exercises, meditation, and seeing a psychologist who specializes in chronic pain management can be beneficial. We also have chronic pain clinics that offer various therapies designed to help manage and reduce pain without relying solely on medications.
That sounds better. I think I'd like to try some of those approaches first, if possible.
That's a good plan. We can certainly start with the non-pharmacological treatments and see how you respond. If needed, we can always add medications later. I'll refer you to a chronic pain clinic and provide you with resources for relaxation and meditation techniques.
Thank you, doctor. I appreciate your help.
You're welcome. Let's get started on these treatments, and we'll keep a close eye on your progress. Don't hesitate to come back if you have any concerns or if the pain doesn't improve. Good morning, Jack. How are you feeling today?
Good morning, Dr. Smith. I'm feeling a bit worried, actually.
I'm sorry to hear that. What's been troubling you?
Well, I started taking a daily aspirin 3 months ago to keep my heart and blood healthy. My blood pressure has never been better, but lately I've been feeling lethargic and irritable. And about a month ago, I started having mild to moderate stomach pains.
I see. It's great that your blood pressure is under control, but the stomach pains are concerning. Aspirin can sometimes cause gastric inflammation or even ulcers, which might explain your symptoms.
So what should I do? I really don't want my blood pressure to go back up.
I recommend we try a period without the aspirin to see if your stomach pains improve. We can also start you on some anti-acid medication and a proton pump inhibitor to help with any gastric issues.
But doctor, how will I keep my blood pressure down without the aspirin? I'm really anxious about stopping it.
I understand your concern, but there are other effective ways to manage blood pressure. Regular exercise, a low-sodium diet, maintaining a healthy weight, and avoiding tobacco and excessive alcohol can all help. Aspirin isn't necessary for blood pressure control, especially since you don't have cardiovascular disease, diabetes, or renal disease.
I'm still not convinced. Many of my friends take aspirin and have no problems. What if I have something more serious, like stomach cancer?
I understand your worries. It's unlikely that you have stomach cancer, but I don't want to dismiss your concerns. If your symptoms persist, we can arrange for a gastroscopy to exclude any serious conditions like cancer.
I'm just really scared about stopping the aspirin and potentially having cancer. Can we do the gastroscopy now?
Let's start by stopping the aspirin and managing your symptoms with the anti-acid medication and proton pump inhibitors. If your stomach pains don't improve in a couple of weeks, we can definitely proceed with further investigations, including a gastroscopy.
All right, I'll try stopping the aspirin and taking the new medications. But please, if the pain doesn't go away, I want to make sure we investigate thoroughly.
Absolutely. We'll keep a close eye on your symptoms. Please make an appointment to see me in 2 weeks, or sooner if you feel worse. We'll get to the bottom of this.
Thank you, doctor. I'll do that.
You're welcome. Take care, and I'll see you soon.
Thanks, doctor. See you in 2 weeks.
Good afternoon, Jack. How are you feeling today?
Hello, Dr. Smith. I've been better. I was hoping to get this cast off today, but it seems like my arm is still not healed.
I reviewed your x-rays, and it looks like the healing is slower than we anticipated. I suspect that osteoporosis might be a factor here. Have you heard about osteoporosis before?
I have a little knowledge about it. I know my mother developed osteoporosis when she was 55. I don't get much calcium in my diet and don't spend a lot of time in the sun. Other than that, I don't know much about the condition.
Osteoporosis is a condition where your bones become less dense and more prone to fractures. It's common in people who don't get enough calcium and vitamin D. The use of corticosteroids, like the medication you're on for asthma, can also contribute to bone loss.
That's concerning. How can you be sure that I have osteoporosis?
To confirm if you have osteoporosis, I will refer you for a bone mineral density test at the local hospital. The most common test for this is called a dual-energy X-ray absorptiometry, or DEXA scan.
Can you explain more about this DEXA test? I'm a bit anxious about what it involves.
Of course. The DEXA test uses X-ray beams of 2 different energy levels to measure the density of your bones. The process is safe and painless. You'll lie on a table while a machine scans your body. It usually takes just a few minutes.
Are there any complications with the DEXA testing?
There are no significant complications. The only consideration is a small dose of radiation, which is quite minimal. It's a very safe procedure overall.
That's good to hear. I'll do whatever is necessary to figure this out.
Great. We'll schedule your DEXA scan and go from there. In the meantime, it might be beneficial to increase your calcium and vitamin D intake. This can help strengthen your bones and support healing.
I'll make sure to do that. Thank you for the information, doctor.
You're welcome. Let's get you set up for the test, and we'll take it from there. If you have any other questions or concerns, don't hesitate to ask.
I appreciate it. Thank you, doctor.
Take care, and we'll see you soon for your follow-up. Good morning, Jack. What brings you in today?
Good morning, Dr. Smith. I've been feeling really sick for the past 2 weeks. It started with stomach cramps, nausea, diarrhea, and dizziness right after I got back from a hiking trip with my friends.
That sounds uncomfortable. Let's go through this step by step. Can you tell me more about your hiking trip? Did you eat or drink anything unusual?
Well, we did a lot of hiking and swimming. I did swallow some fresh water while swimming in a water hole. I thought it was clean, but I guess it might not have been.
Swallowing fresh water in natural settings can sometimes lead to infections if the water is contaminated. Contaminants can include microorganisms like bacteria, viruses, or parasites that come from animal or human waste. These can cause the symptoms you're describing.
Contaminated with what exactly?
Contaminated water can have various harmful microorganisms. These include bacteria like E. coli, viruses like norovirus, and parasites such as Giardia and Cryptosporidium. These pathogens can cause gastrointestinal issues and other symptoms.
How can we know for sure what's causing my sickness?
We need to run some tests to identify the specific cause of your symptoms. I recommend we do a stool sample test, which includes microscopy, culture, and sensitivity tests, and checks for parasites, OVA, cysts, and viruses like norovirus. These tests will help us pinpoint the exact pathogen.
I'm really anxious about this. Can we start treatment right away? I've been feeling awful for so long.
I understand your concern. For now, I suggest we manage your symptoms with some antiemetics to help with the nausea and ensure you stay well hydrated. Once we have the test results back, we can provide specific treatment tailored to the cause.
What about anti-diarrheal agents? Can't I take something to stop the diarrhea?
It's best to avoid anti-diarrheal agents until we confirm there is no infective cause for the diarrhea. If it's due to an infection, stopping diarrhea can actually make things worse by keeping the pathogens in your system longer.
But what if I really need something to help with the diarrhea?
I understand it's uncomfortable. Let's wait for the test results. If the diarrhea is not due to an infection, then anti-diarrheal agents can be safely used. For now, focus on staying hydrated with fluids that contain electrolytes and rest as much as possible.
Okay, I'll follow your advice, but can we hurry with the tests? I really want to start feeling better soon.
Absolutely. We'll get those tests done as soon as possible and follow up with the results quickly. In the meantime, if your symptoms worsen or you feel severely dehydrated, don't hesitate to come back immediately.
Thank you, doctor. I appreciate it.
You're welcome. We'll take good care of you. Take care and stay hydrated. Good afternoon, Jack. How have you been feeling since we last met?
Hi, Dr. Smith. I've been feeling fantastic. Ever since I started taking Zoloft, I feel like a completely different person. No more mood swings, and I'm just happy.
That's wonderful to hear. So, it sounds like the medication is working well for you. Have you experienced any trouble sleeping? Any side effects or suicidal thoughts?
No, none at all. I sleep like a baby, no side effects, and definitely no suicidal thoughts. I feel normal again, like my old self.
That's really encouraging. It's great that the medication is helping you stabilize. However, it's important to continue taking it as prescribed.
Actually, that's why I wanted to talk to you. Since I feel so good now, I was thinking maybe I don't need to keep taking Zoloft. I feel like I'm back to normal, and I don't want to rely on medication.
I understand how you feel, but it's crucial to remember that the medication is likely a significant reason you're feeling so well. Stopping it abruptly can cause a return of symptoms or even make them worse.
But I really feel fine, doctor. I don't think the symptoms will come back. Plus, I don't want anyone to find out I have a psychiatric disorder. People might treat me differently.
It's completely natural to feel anxious about that. Many people share your concerns, but your health is the most important thing here. Managing bipolar disorder often requires ongoing treatment. It's like how someone with diabetes needs to manage their condition with insulin.
I get that, but I don't want to be seen as someone who has a mental illness. I'm worried people will look at me differently.
I understand your concern. Mental health stigma is still very real, but it's important to prioritize your well-being. We can work together on ways to manage your condition discreetly. Your health information is confidential, and you don't have to disclose your diagnosis to anyone unless you choose to.
It just feels like a lot to deal with. I'm afraid of being judged.
I hear you, and it's a valid concern. Remember, you're not alone in this. Many people successfully manage bipolar disorder with medication and lead full, productive lives. Continuing Zoloft can help maintain the balance you're feeling right now. We can discuss other support options too, like counseling, which might help with these feelings.
I hadn't thought about counseling, but still, I really feel okay now.
That's a good sign that the treatment is effective. The goal of continuing medication is to keep you feeling this way long-term. Stopping too soon could cause a relapse. How about we agree to continue with the medication for a bit longer, and we can keep monitoring your progress closely. If you continue to feel stable, we can gradually discuss a plan together.
I guess I can try that. I just want to be normal without the fear of people finding out.
That's a reasonable goal. Let's work on this together. Your well-being is our top priority, and we'll take it step by step. If you have any concerns or need support, I'm here for you.
Okay, I'll continue for now. Thanks for understanding, doctor.
You're welcome. Remember, you're doing great, and we're here to support you every step of the way. Good morning, Jack. How can I help you today?
Hi, Dr. Jones. I've been having these heart palpitations lately. It feels like my heart is pounding or beating irregularly for a few minutes. It's been happening at least 3 times a week, and recently it's almost every night.
That sounds concerning. Let's get a bit more information. How long have you been experiencing these palpitations?
It's been a few months now, but it's definitely gotten worse over the past few weeks.
I see. Have you noticed if anything in particular triggers these episodes, like certain activities, foods, or stress?
Not really. My life is pretty stressful overall, being a lawyer and all, but I don't think it's just stress. I'm worried it might be a heart condition.
I understand your concern. Stress and anxiety can often cause symptoms like palpitations, but we'll explore all possibilities. I see from your file that your physical examination and ECG results are normal, which is reassuring and suggests that it's unlikely to be a coronary problem.
I find that hard to believe. These palpitations feel so intense. Are you sure it's not something serious?
While I can't rule out every possibility without further testing, your normal ECG and physical exam are good indicators that your heart is structurally sound. Stress and lifestyle factors are common culprits for symptoms like these, especially in high-stress professions like yours.
So, what can I do to stop these palpitations? It's really affecting my sleep and overall well-being.
There are several strategies we can try. First, managing your stress is crucial. Techniques such as mindfulness, yoga, or even regular physical exercise can be very effective. Reducing your caffeine intake could also make a big difference, as caffeine can increase heart rate and palpitations.
I drink several cups of coffee a day to keep up with my workload. And cooking healthy food is out of the question. I just don't have the time. I eat at fast food restaurants at least 5 times a week.
I understand your time constraints. Even with a busy schedule, there are ways to make healthier choices. For example, many fast food restaurants offer healthier options now, like salads, grilled chicken, or whole grain alternatives. Reducing the number of caffeinated drinks you consume each day can also help.
I guess I can try to cut back on coffee, but avoiding fast food will be tough.
Small changes can make a big difference. You might start by substituting 1 or 2 fast food meals a week with healthier options, perhaps by choosing restaurants that offer healthier menus, or even prepping some simple meals at home over the weekend. There are also meal delivery services that provide nutritious meals, which can save you time.
I hadn't thought about meal delivery services. That might work.
It's all about finding a balance that works for you. These adjustments not only help manage your current symptoms, but are also important for your long-term health. Stress management, a healthier diet, and reduced caffeine intake can significantly improve your quality of life.
All right, I'll give it a try. I'll cut down on coffee and see if I can make some healthier food choices. I really hope it helps with these palpitations.
I'm confident it will make a difference. Remember, these changes take time, so be patient with yourself. If the palpitations continue or worsen, please come back and we can explore further options.
Thank you, doctor. I appreciate your advice.
You're welcome. Take care and don't hesitate to reach out if you have any concerns or questions. Good afternoon, Alex. I understand you're here because you've been experiencing some issues with your ears. Can you tell me a bit more about what's been happening?
Hi, Dr. Jones. Yes, I've been noticing a loud ringing in my ears for the past month. It's been getting worse, and yesterday I even felt faint. I didn't lose consciousness, but it scared me. I'm really concerned it might be something serious.
That does sound concerning. How long have you been experiencing the ringing? Is this the first time, or have you had episodes like this before?
This is the first time it's been this bad. I mean, I've had some ringing after concerts, but it usually goes away after a day or so. This time it's just not going away. And the fainting spell was a first for me.
I see. Tinnitus, or ringing in the ears, can be caused by various factors, but exposure to loud noise is one of the most common. Given your profession, attending many live rock concerts could be a significant factor. Have you noticed any other symptoms, like difficulty maintaining your balance, or any changes in your hearing?
My balance seems okay, but sometimes I feel a bit off. It's hard to describe. My hearing is mostly fine, but the ringing is really distracting.
Tinnitus can develop gradually, and sometimes people don't notice it until it becomes more pronounced. The fainting spell you experienced might be related to other factors, but it's good to be cautious. The constant exposure to loud music can cause permanent hearing damage over time. Have you tried any treatments or methods to alleviate the ringing?
Not really. I thought it would just go away on its own like it usually does. But this time it's different. How could it have progressed so quickly?
The progression can vary from person to person. Sometimes, repeated exposure to loud sounds can cause cumulative damage, leading to more persistent symptoms. Stress and lack of rest can also exacerbate the condition. It's crucial to protect your ears as much as possible.
What kind of treatments are available? I can't really avoid loud music. It's part of my job and I love it.
I understand. There are several approaches we can take. I can refer you to an ENT specialist who can perform a more detailed examination and possibly some hearing tests. Treatments might include sound therapy, counseling, and in some cases, medication to help manage the symptoms. Additionally, using earplugs designed for musicians can significantly reduce the impact of loud sounds without compromising your ability to enjoy the music.
Earplugs, huh? I've never really thought about using them. Would they really help?
Absolutely. High-fidelity earplugs are specifically designed for musicians and concertgoers. They reduce the volume of loud sounds without distorting the music. It might take some getting used to, but they can make a big difference in protecting your hearing and reducing the risk of worsening your tinnitus.
I guess I could give them a try. I just worry they might interfere with my work.
It's a reasonable concern, but many music professionals use them successfully. The key is to find a balance that allows you to do your job while protecting your ears. Consistent use of earplugs can prevent further damage and potentially improve your current symptoms over time.
Okay, I'll try the earplugs. I really don't want this to get worse.
I'm glad to hear that. It's important to take proactive steps now. I'll also set up a referral to an ENT specialist for a more comprehensive evaluation. In the meantime, try to limit your exposure to very loud environments as much as possible.
Thanks, Doctor. I appreciate your help. I hope this gets better soon.
You're welcome, Alex. We'll do our best to manage this together. Remember, protecting your hearing now will benefit you in the long run. If you have any more concerns or notice any new symptoms, don't hesitate to reach out. Good evening, Jack. I'm Dr. Smith. I understand you're feeling under the weather. Can you tell me a bit about your recent travel history?
Hi, Dr. Smith. I just got back from a 3-week trip to a tropical area 3 days ago. I was bitten by a lot of mosquitoes while I was there.
I see. Have you had any symptoms since you returned?
Yes, I've had flu-like symptoms for a few days now. I've had a slight temperature, headaches, and joint aches, but no sore throat or cough. I always feel worse by the end of the day.
It sounds like you've been having a tough time. Have you noticed any rashes or other unusual symptoms?
No rashes or anything like that. Just the fever, headaches, and joint pain.
Given your recent travel and mosquito exposure, we need to consider some potential tropical diseases, such as malaria or dengue fever. However, it's also possible that you have a non-specific viral illness.
My friend thought it might be malaria and convinced me to come here. I hope it's not serious.
It's good that you came in. We can do some basic blood tests to check for malaria and other infections. This will help us rule out serious conditions and guide your treatment.
I understand, but I really don't have time to be sick. I have several work and study commitments, and spending more time in the ED is really not ideal.
I appreciate your concerns. The blood tests won't take long, and they'll give us valuable information to ensure you get the right treatment. It's better to address this now rather than let it potentially worsen.
I suppose you're right. I just don't want to fall behind on my work and studies.
I understand. We'll try to make this as quick as possible. After the blood tests, you won't need to stay here. You can follow up with your general practitioner for the results and any further care you might need.
Okay, I'll stay for the blood tests, but I really hope this doesn't take too long.
It shouldn't take long at all. Thank you for understanding. Let's get those tests done, and we'll go from there.
All right, thank you, Dr. Smith. I appreciate your help.
You're welcome. Let's get started on those tests, and hopefully we'll have some answers for you soon. Good morning, Jack. How are you doing today? I hope you had a pleasant journey coming here.
Good morning, Doctor. Thank you for asking. I'm doing relatively well, though I must admit that there are a few concerns on my mind that have been troubling me lately. That's actually the main reason I've come in to see you today.
I'm glad you could make it in to discuss your concerns. It's always best to address these things sooner rather than later. What specifically would you like to talk about today?
Well, as you know, I opted for early retirement from my academic position. This was primarily because I was finding it increasingly difficult to manage my workload. This decision wasn't easy, but it seemed like the best course of action at the time. I have a fairly strong family history of early-onset Alzheimer's disease, which includes my father and my older sister both having been diagnosed with the condition. Given this family history, I am becoming increasingly concerned about my own risk. I am familiar with the symptoms of Alzheimer's, but I would like to discuss the possibility of undergoing genetic testing to determine if I might be at risk as well.
I can understand why you'd be concerned, especially with such a significant family history of early-onset Alzheimer's disease. It's always better to be informed and proactive when it comes to such matters. Just to ensure we cover everything thoroughly, could you tell me a bit more about the symptoms you're currently experiencing and whether you've noticed any changes recently?
Certainly, I've been experiencing some forgetfulness, which seems to be happening more frequently than it used to. There are moments of occasional confusion, especially when I'm trying to remember details or follow through on tasks. These instances aren't severe, but they are noticeable and concerning, especially given my family's history with Alzheimer's. I just want to be sure that I'm not overlooking any potential risks.
It's good that you're being vigilant about these symptoms. Early-onset Alzheimer's typically presents with memory loss, difficulty in planning and solving problems, confusion with time or place, and difficulty completing familiar tasks. Have you experienced any of these symptoms more frequently or severely than you have in the past?
The forgetfulness and occasional confusion are the main symptoms I've noticed. They're not severe, but they are frequent enough to make me worried. My main concern is whether these symptoms are indicative of early-onset Alzheimer's, given my family history.
Your concern is completely understandable. It's important to consider all possibilities. Sometimes, conditions such as depression or anxiety can mimic or contribute to cognitive impairment. Have you noticed any changes in your mood or energy levels recently? Sometimes these factors can play a significant role in how we perceive our cognitive abilities.
Depression? I don't think so. I understand that you're trying to be thorough, but I'm here to discuss Alzheimer's, not depression. My primary concern is the genetic risk, especially given my family history.
I understand your focus on Alzheimer's, especially given the significant family history. It's important to explore all possible factors, though. Conditions like depression and anxiety can have a substantial impact on cognitive performance. These conditions can sometimes exacerbate or mimic the symptoms of cognitive decline. It would be beneficial to rule out these factors before we proceed with genetic testing. This thorough approach ensures we consider all possible explanations and provide the most accurate diagnosis.
I see your point. So, what do you suggest we do next?
I recommend scheduling an appointment with a clinical neuropsychologist. They specialize in understanding the intricate details of cognitive function and can conduct a formal cognitive evaluation. This evaluation will help us better understand your symptoms and determine if factors like depression or anxiety might be contributing. This step is crucial before we consider genetic testing, as it provides a comprehensive view of your cognitive health.
I'm a bit reluctant, but if it's necessary, I guess I could see a neuropsychologist. I just want to make sure we're not missing anything.
I appreciate your willingness to take this step. The evaluation by a neuropsychologist will provide valuable insights into your cognitive function and help us make an informed decision about whether genetic testing is necessary. If, after the evaluation, we determine that genetic testing is still warranted, we'll need to proceed with genetic counseling. This is an essential step where you'll speak with professionals who have specialized training in genetics and counseling. They will help you understand the potential outcomes and implications of the test results.
Genetic counseling? Can you explain a bit more about what that involves? I'm not familiar with the process.
Absolutely. Genetic counseling is a critical component of the genetic testing process. It involves meeting with counselors who are trained in both genetics and counseling. During these sessions, they will discuss the potential results of the genetic tests, the impact those results could have on you and your family, and help you consider all possible outcomes. The goal is to ensure you have all the information and support you need to make an informed decision about whether to proceed with testing. They will also provide emotional support and help you understand how the results might affect your future health and lifestyle choices.
That sounds thorough and quite comprehensive. I just want to be sure that I'm making the right choices and that I'm fully informed about all the potential outcomes.
That's completely understandable, and it's precisely why genetic counseling is so important. It ensures that any decision you make is well-informed and considers all aspects of your health and well-being. By taking this step, you're ensuring that you have all the necessary information and support to make the best decision for your health. We'll start with the neuropsychological evaluation, and then, based on those findings, we can determine the next steps and whether genetic testing is appropriate.
All right, I'll agree to see the neuropsychologist and undergo genetic counseling. If it comes to that, I want to be as thorough as possible in understanding my health.
Excellent. I'll arrange a referral to a neuropsychologist for you. After the evaluation, we can reconvene to discuss the findings and the next steps. If genetic testing is recommended, we'll ensure you receive comprehensive genetic counseling beforehand. Do you have any other questions or concerns right now that we haven't covered?
No, I think that covers it for now. Thank you for explaining everything so thoroughly. It's reassuring to know that we're taking a comprehensive approach to this.
You're very welcome. It's important that you feel reassured and well-informed throughout this process. If you have any questions or concerns before your appointment with the neuropsychologist, please don't hesitate to reach out. We're here to support you every step of the way.
I will. Thank you again for your time and for addressing my concerns so thoroughly. I appreciate it.
You're welcome. Take care, and we'll be in touch soon to arrange your appointment with the neuropsychologist. Please take care of yourself in the meantime, and don't hesitate to reach out if you need anything.
Thank you, Doctor. Goodbye.
Goodbye. Take care. Good morning, Jack. How can I help you today?
Good morning, Dr. Jones. I came in today because my daughter, who is about to have a baby, has been very insistent that I get the Boostrix vaccine. She's read and heard that some illnesses can be extremely dangerous, even fatal, for infants. While I understand her concern, I think she's being over-anxious about the whole situation.
I see. It's great that your daughter is proactive about the baby's health, but I understand why you might feel she's overreacting. To begin with, let me explain what the Boostrix vaccine is. It's a combined vaccine that protects against 3 serious diseases: diphtheria, tetanus, and whooping cough, also known as pertussis. It's particularly recommended for adults who will be in close contact with newborns because infants are very vulnerable to these diseases before they can get their own vaccinations.
I appreciate the explanation, Doctor, but my concern is that I prefer not to have unnecessary injections, especially when it involves a vaccine for 3 different diseases. I mean, I'm not out in public very often, and I don't usually catch diseases. I don't see myself being at any significant risk of getting diphtheria or tetanus.
I understand your reluctance to undergo unnecessary medical procedures, and it's true that the chances of contracting diphtheria or tetanus are relatively low, especially if you're not frequently exposed to environments where these bacteria thrive. However, whooping cough is a different issue altogether. Whooping cough can be extremely dangerous, even fatal, for infants. Since the vaccine is a 3-in-1 shot, you receive protection against all 3 diseases simultaneously, which is a convenient and effective way to safeguard your health and that of your future grandchild.
I've managed just fine all these years without this vaccine. Why should I start worrying about it now? My daughter means well, but I think she's a bit too anxious about this.
Your daughter's concerns are quite valid, especially regarding whooping cough. Whooping cough, or pertussis, can be particularly severe for infants. Newborns cannot be vaccinated against pertussis until they are a few months old, leaving them vulnerable. Severe, relentless coughing is characteristic of whooping cough, which can lead to hypoxic encephalopathy, where the brain doesn't get enough oxygen, potentially causing brain damage or even death. By getting vaccinated, you help create a protective barrier around the baby, reducing the risk of exposure to these dangerous illnesses.
I didn't realize that whooping cough could be so dangerous for babies. I thought it was just a bad cough.
Yes, it can be much more than a simple cough for infants. Their immune systems are still developing, making them more susceptible to severe complications from infections. Adults and older children typically recover from whooping cough without severe issues, but for newborns, it can lead to very serious outcomes. Having adults around them vaccinated significantly lowers the chances of them contracting these diseases during their most vulnerable months.
That does sound serious. But it's still a lot to take in, getting vaccinated against 3 diseases all at once. Isn't that a lot for the body to handle?
While it might seem like a lot, the vaccine is formulated to be safe and well tolerated. The benefits of getting vaccinated far outweigh the risks, especially when considering the potential severity of these diseases for a newborn. It's a proactive measure that protects both you and your grandchild. The combined vaccine is designed to stimulate your immune system to develop protection without causing the diseases themselves. It's a highly effective way to ensure you're contributing to a safer environment for the baby.
I suppose that makes sense. I want to keep my grandchild safe, but I'm still not thrilled about the idea of getting a vaccine, especially when I've avoided illnesses for so long.
I completely understand your hesitation. It's natural to have reservations about medical interventions, especially when you've been healthy without them. How about this? Why don't we schedule you to come back next week for the vaccine? This will give you some time to think it over and feel more comfortable with the decision. In the meantime, if you have any questions or need more information, I'm here to help.
Okay, that sounds reasonable. I'll come back next week for the vaccine. I do want to make sure the baby is safe, even if I think my daughter is being a bit over-anxious.
That's a very responsible decision. I'll go ahead and schedule your appointment for next week. In the meantime, feel free to contact me if you have any more questions or concerns. Your decision to get the vaccine is a significant step in ensuring your grandchild's health and safety.
Thank you, Doctor. I appreciate your understanding and the detailed explanation. It helps to know exactly why this vaccine is so important.
You're very welcome. I'm glad I could provide some clarity. Take care, and I'll see you next week for your vaccination.
See you next week. Thanks again.
Good morning, Jack. It's good to see you again, even though I wish it were under better circumstances. How have you been feeling since your last visit?
Morning, Dr. Jones. I've been feeling a bit anxious, to be honest. I'm worried about my blood pressure, but I just don't feel comfortable with the idea of taking medication.
I understand your concerns, and it's completely normal to feel anxious about these things. However, your blood pressure readings have been quite high. The last 2 readings from the community nurse were 150 by 102 and 162 by 108, and today's reading is 160 by 100. These numbers are quite concerning and indicate that your hypertension is not under control. Have you been able to follow the treatment plan we discussed, including taking the medication?
Well, I have to admit I haven't started taking the medication yet. I know you prescribed atenolol a month ago, but I just don't feel right about it. I believe I can manage my health with natural therapies and lifestyle changes instead of relying on drugs.
I appreciate your honesty. It's important for me to understand your perspective. Let's talk about your concerns with the medication. What specifically makes you hesitant to start it?
There are a few reasons. First, I don't like the idea of being dependent on pills for the rest of my life. I worry about the side effects and long-term impact on my body. Plus, I've read about natural remedies and lifestyle changes that can help lower blood pressure, and I want to give those a try first.
Your concerns are very valid. Medication can feel like a significant step, and it's good that you're thinking about the long-term impact on your health. However, your current blood pressure levels are dangerously high, and we need to take immediate action to bring it under control to prevent serious complications like heart attacks or strokes. Natural therapies and lifestyle changes are essential and can be very effective, but they usually take time to show results. In the interim, medication can help protect you.
I understand the risks of high blood pressure, but I've read about people managing it with diet and exercise. I think if I lose weight and start exercising more, I can get my blood pressure down naturally.
You're absolutely right that diet and exercise play crucial roles in managing hypertension. Losing weight and increasing your physical activity can significantly improve your blood pressure over time. But given your current readings, we need to act quickly to avoid immediate health risks. The medication can help stabilize your blood pressure now, providing a safer environment for you to make those lifestyle changes.
It's just that I've heard so many stories about people having bad reactions to medication. I don't want to end up dealing with more health issues because of side effects.
That's a completely understandable concern. All medications come with potential side effects, but the most common ones for atenolol are generally mild and can include fatigue, cold hands, or dizziness. The risk of severe side effects is relatively low, especially compared to the risk of uncontrolled high blood pressure. Moreover, I will monitor you closely, and if you experience any adverse effects, we can adjust your treatment plan accordingly.
I still feel uneasy about it. Isn't there another way? Maybe a different medication that's less harsh or a lower dose?
Atenolol is a well-tolerated and effective medication for most people, but if it's causing you this much anxiety, we can certainly consider alternatives or start with a lower dose. The important thing is to start some form of treatment to protect your health while you work on those lifestyle changes. We can reevaluate and make adjustments as necessary. How does that sound?
I suppose that makes sense. I want to avoid any more hospital visits, but I really hope I won't have to stay on the medication forever.
That's a reasonable goal. Think of the medication as a temporary support to get your blood pressure under control quickly. Meanwhile, we'll focus on a comprehensive plan that includes diet, exercise, and possibly other natural therapies you're interested in. Once your blood pressure is stable and you've made consistent lifestyle improvements, we can discuss reducing or even discontinuing the medication.
All right, doctor. I'll start the medication, but I want us to have a plan to gradually come off it as my lifestyle changes take effect.
Absolutely. We'll work together on this. I'll prescribe the medication, and let's set up a follow-up appointment in a month to review your progress and make any necessary adjustments. In the meantime, I'll provide you with resources on diet and exercise plans, and we can explore any natural therapies you're interested in. You're taking a positive step towards better health, and I'm here to support you every step of the way.
Thank you, doctor. I appreciate your understanding and support. I'll do my best to follow the plan and make the necessary changes.
You're welcome. I'm confident that with a combined approach, we can get your blood pressure under control and improve your overall health. Let's get started today, and we'll take it one step at a time. Good morning, Jack. I can see this appointment was scheduled on behalf of your daughter. How is Jennifer feeling today?
Good morning, Dr. Jones. Thank you so much for seeing us on such short notice. My daughter had her tonsils removed about a week ago, and she's been experiencing quite a bit of pain since the surgery. The surgeon prescribed oxycodone for her, and she's been taking it quite frequently because of the pain. However, now she's been constipated for 5 consecutive days, and she's never had issues with constipation like this before. What can we do to help her?
I'm glad you brought her in today. It's quite common for pain medications, particularly opioids like oxycodone, to cause constipation as a side effect. Oxycodone works by slowing down the digestive system, which can lead to constipation. This is a known and relatively frequent issue with this type of medication.
That definitely makes sense, but she's really uncomfortable, and it's been a few days now. What steps can we take to relieve her constipation?
The first step in addressing her constipation is to ensure she is staying well hydrated by drinking plenty of fluids. Additionally, increasing her intake of fiber-rich foods, such as fruits, vegetables, and whole grains, can be very helpful. Prunes or prune juice are particularly effective natural remedies for constipation. We can also consider over-the-counter stool softeners or laxatives, but it's important to use these as directed and not to rely on them as a long-term solution.
Should we be concerned about continuing to give her oxycodone if it's causing these issues? Is it better to avoid this medication in the future?
Opioids like oxycodone are very effective for pain relief, but they do come with a range of side effects, including constipation. While these side effects are common, they are usually mild and short-lived if managed properly. In the future, we might consider alternative pain relief options, such as acetaminophen or ibuprofen, which don't typically cause constipation. It's also important to balance effective pain management with the potential side effects of the medication.
If she wasn't in so much pain, she wouldn't need to take so much of the medication. Is there anything else we can do to reduce her pain without relying so heavily on strong painkillers?
It's essential to manage her pain effectively, but we should also be cautious with the use of strong painkillers like oxycodone. Typically, The pain from a tonsillectomy improves significantly after the first few days. In addition to medication, we can use other strategies such as applying ice packs to her neck, ensuring she stays well hydrated, and providing less potent pain relief more frequently. These methods can help manage her pain without relying solely on oxycodone.
I've read that gargling with salt water might help with her sore throat. Is that something we should be doing?
Gargling with salt water can indeed be beneficial in relieving a sore throat and can aid in the healing process. It's important to make sure she doesn't swallow the salt water, though. This is a simple and effective remedy that can be used alongside other treatments to provide relief.
She's been asking for ice cream because she thinks it will soothe her throat. Is it okay for her to have it? I thought it might be comforting for her.
Eating ice cream can be quite soothing and can help with hydration, which is important for her recovery. Cold, soft foods like ice cream can be comforting after a tonsillectomy. However, it's also crucial for her to try to eat a balanced diet to support her overall healing. So, while it's fine for her to have some ice cream, it's also important to encourage her to eat other nutritious foods.
That's really helpful to know. So, if we manage her diet and hydration, use less potent painkillers, and keep up with things like saltwater gargles, we should see some improvement in her condition?
Exactly. Following these steps should help alleviate her symptoms. If her constipation doesn't improve within the next day or two, or if she experiences severe pain or any other concerning symptoms, please bring her back in so we can reassess her condition and ensure there isn't a more serious underlying issue.
Thank you, Doctor. I really appreciate all the advice and guidance. We'll try these steps and see how she does over the next few days.
You're very welcome. I'm confident that with these measures, she'll start feeling better soon. Just keep a close eye on her progress and don't hesitate to contact us if you have any further concerns or questions.
Will do. Thanks again for all your help.
Take care, and I hope she feels better quickly. If you need anything else, please don't hesitate to reach out.
Thank you, Doctor. We'll follow your recommendations closely. Good afternoon, Jennifer. It's nice to see you again. How have you been since our last visit? I remember we decided to keep an eye on your Baker's cyst. How have things been going for you in the past few months?
Hi, Dr. Jones. I've been okay for the most part, but I'm really starting to think that my Baker's cyst looks larger. As a dancer, it's really important not only how I perform, but also how I look, and I'm starting to get quite worried about it affecting my career. It's just been on my mind a lot lately.
I understand your concern. Let's take a closer look at it to make sure everything is all right. In the meantime, have you noticed any new symptoms like increased pain, reduced movement, or any other changes that we should be aware of?
Not really, doctor. There hasn't been any new pain or reduction in movement, which is good. But visually, it definitely seems bigger to me, and that's really worrying. As I mentioned, I'm really concerned about how it might impact my performances in the future. I'm not sure if it's just in my head or if there's something more going on.
I see. Well, I've measured the cyst, and based on my observations and the measurements, it actually hasn't increased in size. Sometimes these cysts can feel larger due to changes in your activity levels or even from swelling that can occur with overuse or increased physical activity. It's possible that what you're experiencing is related to these factors.
That's interesting. It definitely feels bigger to me, though, and it's really starting to stress me out. I've been diligently following all the recommended treatments, doing my physio exercises, applying ice regularly, and wearing supportive footwear. But it doesn't seem to be making a noticeable difference. I just want to be sure I'm doing everything I can.
It's great to hear that you're adhering so well to the recommended treatments. Even though the cyst hasn't shown any growth, I completely understand your concerns, especially with your busy performance schedule coming up. Given the importance of your performances, it's natural to want reassurance that this won't become a bigger issue. Have you experienced any issues with your performances so far, or has it just been a visual concern?
Not yet. No issues with my performances so far. But I'm really anxious about it potentially causing problems in the future. I have a lot of important shows lined up, and I really can't afford for this to get worse or interfere with my dancing in any way. I need to be absolutely sure that the cyst won't grow anymore and that it won't impact my ability to perform.
I completely understand your anxiety about this, especially given the critical nature of your upcoming performances. Given that there are no new symptoms and the cyst hasn't grown, I still believe observing it is the best course of action for now. The treatments you're following are designed to manage any discomfort and keep things stable. However, I understand it feels like more needs to be done.
I get that, but honestly, it feels like the current treatment isn't enough. I need to make sure this cyst doesn't get any worse. I'm really worried about it affecting my future performances and my career in general. Are there any other options we can consider to ensure it doesn't grow or cause problems?
If you're still concerned, we can certainly discuss some future treatment options that might give you more peace of mind. We could consider a review by a sports physician or an orthopedic surgeon. They might suggest a knee arthroscopy, which is a minimally invasive procedure that allows for a detailed evaluation and potential treatment of any underlying issues, such as an injury or degenerative changes that might be contributing to the cyst. This could provide a more definitive solution if it turns out there's something more that needs to be addressed.
That sounds like it could be a good idea. What does a knee arthroscopy involve exactly? I've heard of it, but I'm not entirely sure what it entails or how it might help with my situation.
A knee arthroscopy is a minimally invasive surgical procedure where a small camera, called an arthroscope, is inserted into the knee joint through a tiny incision. This allows the surgeon to see inside your knee and address any issues directly. If there's any underlying cause, such as an injury or degenerative changes that might be contributing to the cyst, the surgeon can treat those during the procedure. It's generally well tolerated and has a relatively quick recovery time, especially for someone as active and fit as you.
I see. That sounds a bit intimidating, but if it helps, it might be worth considering. I just want to be sure I'm doing everything I can to stay in top form and not let this affect my dancing.
It's perfectly natural to feel a bit intimidated by the idea of surgery, even a minimally invasive one like an arthroscopy. For now, I'd recommend continuing with your current treatments and let's schedule another review in 3 months. This will allow us to monitor the cyst closely and make sure it isn't changing. If the cyst shows any changes or if you experience new symptoms, we can reevaluate sooner and consider the other treatment options at that time.
Okay, I can agree to that. I'll keep doing what I'm doing and see how things go. I just want to be sure I'm taking the best possible care of my knee and not letting this become a bigger problem.
Great. And remember, if you notice any changes or if it starts to impact your performance, don't hesitate to reach out. We'll address it as needed and adjust your treatment plan accordingly. You're doing a great job with the current regimen, and that's important. Let's stay proactive and keep monitoring the situation closely.
Thank you, doctor. I really appreciate your help and understanding. It means a lot to know that you're keeping a close eye on this and that we have a plan in place.
You're welcome. Take care, and I'll see you in 3 months for the next review. In the meantime, keep up the good work with your treatments and take care of yourself. If anything changes, or if you have any concerns, you know where to find me.
Will do. Thanks again, doctor. I feel a bit more reassured now.
Anytime. Have a great day and best of luck with your performances.
Good morning, Jack. How can I help you today?
Good morning, Dr. Jones. I've been having a bit of trouble with my sleep lately.
I'm sorry to hear that. What kind of trouble are you experiencing?
Well, I've been waking up at night with cramps in my calves. It's happening more regularly now, about twice a week, and it's starting to get worse. It's really affecting my sleep.
I see. How long has this been going on?
It started a couple of months ago, but it wasn't too bad at first. Lately, though, the cramps have become more frequent and more intense.
That sounds uncomfortable. Have there been any changes in your general health or lifestyle recently?
Not really. I'm generally in good health. I follow a healthy diet, drink plenty of water, eat fresh foods, and I exercise regularly. I usually sleep well through the night.
That's good to hear. It's important to maintain a healthy lifestyle. Do you do any specific exercises or activities that might be contributing to the cramps?
I'm quite active. I go for walks daily and I do some light strength training a few times a week. Nothing too strenuous, though.
It sounds like you have a good routine. However, sometimes even regular exercise can lead to muscle fatigue or overexertion, which might contribute to cramping. Have you noticed if the cramps happen after specific activities?
Now that you mention it, the cramps sometimes happen after a day when I've been particularly active, but I always make sure to stretch after exercising.
Stretching is great, but it's possible that your muscles are still experiencing some strain. Significant mineral deficiencies are not common in otherwise healthy individuals like yourself. It's more likely that the cramps are related to muscle fatigue or overuse.
I heard that cramps can be caused by a lack of vitamins or minerals. Is there any truth to that?
While deficiencies in minerals like potassium, calcium, or magnesium can sometimes cause cramps, it's less common in people who maintain a balanced diet. Since you mentioned that you eat well and drink plenty of water, it's unlikely that mineral deficiencies are the main cause.
That's a relief to hear. My spouse is getting quite disturbed by my waking up with cramps, and I really need some suggestions to remedy the problem immediately.
I understand. There are several things you can try to alleviate the cramps. Applying an ice pack to the affected area can help reduce muscle spasms. Regular stretching, especially before bed, can also be beneficial. Massage the calves gently when you feel the cramps coming on.
Those are some good suggestions. I'll definitely try them.
Additionally, I recommend you visit a physiotherapist. They can provide targeted exercises and treatments to help manage and prevent the cramps.
That sounds like a good idea. I'll make an appointment with a physiotherapist.
Great. If the cramps continue or worsen, please come back for a review. We can explore other options if necessary.
Thank you, Doctor. I'll follow your advice and see a physiotherapist. If there's no improvement, I'll return for another consultation.
You're welcome. I hope the cramps improve soon. Take care, and don't hesitate to come back if you need further assistance.
Thank you. Have a good day.
You too. Goodbye. Good morning, Jack. How can I help you today?
Good morning, Dr. Jones. I have these ulcers on my tongue that started last night. They really hurt, especially when I talk, eat, or drink.
I see. Can you tell me more about these ulcers? Have you had them before?
Yes, I've had them on and off since I was a child. I've had several attacks in recent months. Usually they clear up after a few days, but they are very painful and bothersome.
That sounds uncomfortable. Are there any other symptoms you're experiencing? Fever, for instance?
No fever, just the ulcers.
How often do you get these ulcers, and how long do they usually last?
I get them maybe once every couple of months. They usually last about a week.
Have you noticed any patterns or triggers that might be causing these outbreaks?
Well, I started a new job as a salesperson 6 months ago. It's a high-pressure job, and I have to talk a lot and entertain clients. The ulcers really bother me when I speak, eat, or drink.
Stress can sometimes be a factor. Let's make sure there isn't an underlying condition. Do you have any history of diabetes or inflammatory bowel disease in your family?
No, none that I'm aware of.
And have you ever been diagnosed with herpes simplex?
No, I haven't.
Do you have any other health conditions or take any regular medications?
No, I'm generally healthy and don't take any medications.
All right. Based on what you've described, it sounds like you might have aphthous ulcers. They don't have a specific known cause, but some research suggests they could be related to an immune reaction, possibly triggered by stress, hormones, a virus, or an allergy.
Is there anything I can do to clear them up within 24 hours? I have an important meeting tomorrow and need to speak clearly.
Unfortunately, there's no quick fix that will clear them up completely within 24 hours. However, we can manage the symptoms to make you more comfortable. I recommend rinsing your mouth with warm, salty water or a medicated mouthwash, applying antiseptic gel, taking paracetamol for pain, drinking plenty of fluids, and avoiding spicy and sour foods.
I've tried the antiseptic gel from the pharmacy before, but it never helps much. Is there anything more effective?
I can prescribe an anti-inflammatory drug to help with the pain and inflammation. That might give you more relief than the over-the-counter options.
That would be great. Thank you. Is there a way to prevent these ulcers from coming back?
It's difficult to prevent them entirely since the exact cause is often unknown. However, managing your stress levels, maintaining good oral hygiene, and avoiding foods that might trigger them can help. Some patients also find taking a multivitamin with B vitamins and iron beneficial.
That makes sense. I'll try to work on managing my stress better. Should I get a blood test to check for any infections?
Yes, a blood test can help rule out any infections or underlying conditions that might be contributing to the ulcers. I'll arrange for you to have one.
What kind of foods should I avoid to prevent these ulcers?
It's best to avoid foods that are spicy, acidic, or sour, as they can irritate the ulcers and potentially trigger new ones. Also, try to avoid foods that you might be allergic to or that you find irritating to your mouth.
I'll keep that in mind. How long will it take for the blood test results to come back?
Typically, it takes a few days to a week. We'll contact you once we have the results. If there's anything unusual, we'll discuss the next steps then.
Thank you, Doctor. I really appreciate your help.
You're welcome. I'll write up the prescription and arrange for the blood test. In the meantime, follow the management tips we discussed. If the pain persists or the ulcers don't improve, please come back to see me.
I will. One more thing, Doctor. Do you think using a soft toothbrush and avoiding toothpaste with sodium lauryl sulfate might help?
Yes, using a soft toothbrush can prevent additional irritation to your mouth. Some people do find that avoiding toothpaste with sodium lauryl sulfate, which can be irritating, helps reduce the frequency of ulcers. It's worth trying to see if it makes a difference for you.
I'll definitely try that. Thanks again for all your advice.
Take care and good luck with your meeting tomorrow.
Thank you, Doctor. Goodbye.
Goodbye.
Good morning, Dr. Jones.
Good morning, Jack. I understand you had a concerning episode this morning. Can you tell me more about what happened in detail?
Yes, this morning I was in the middle of giving a presentation at work, and all of a sudden I felt an intense weakness down my right side, particularly in my arm. A colleague noticed that my speech was slurred for about 5 minutes. I've never experienced anything like this before, and it was quite alarming.
That does sound concerning. Can you describe the weakness you felt in more detail? Was it a sudden onset, or did it gradually build up over time?
It was very sudden and unexpected. One moment I was completely fine, and the next I felt this weakness. It lasted for about 5 minutes, and then it went away just as quickly as it had appeared.
Did you experience any other symptoms along with the weakness and slurred speech? For example, did you feel dizzy, have a headache, or notice any changes in your vision?
No, I didn't experience any other symptoms. It was just the weakness in my arm and the slurred speech.
Have you ever had any similar episodes in the past, even if they were less severe?
No, I've never had anything like this happen before. The only time my speech has ever been slurred is after I've had too much to drink.
Understood. I'm going to check your heart rate, blood pressure, and listen to your carotid arteries to see if I can detect any abnormalities. Your heart rate and blood pressure are within normal ranges, and I don't hear any abnormalities in your carotid arteries. However, to be thorough, I would like to order some additional tests to get a clearer understanding of what might be going on.
What kind of tests are we talking about?
I'd like to conduct a full blood examination, check your thyroid function, measure your blood glucose and cholesterol levels, and assess your kidney function. These tests will help us rule out various conditions that might be contributing to your symptoms.
Are you suggesting that I might have had a stroke?
What you experienced could potentially be a transient ischemic attack, or TIA, which is often referred to as a mini-stroke. It's a temporary period of symptoms similar to those of a stroke, but doesn't cause permanent damage. However, TIAs are important warning signs of potential future strokes.
So does that mean I could have a more severe stroke in the future?
It's certainly a possibility, and that's why it's important to take this seriously. We need to identify the underlying cause of this episode and take appropriate steps to prevent it from happening again.
What other tests do you think I need?
I'd like to refer you for a CT scan of your head to check for any abnormalities in your brain and an ECG to examine your heart's electrical activity. These tests will help us rule out any serious issues that could have caused your symptoms.
Why do I need all these tests? I'm really starting to get worried.
I understand your concern, and it's perfectly normal to feel that way. These tests are necessary to ensure that we don't overlook any serious conditions. TIAs can be caused by problems with your heart or blood vessels, and we need to pinpoint the exact cause so we can take preventive measures.
What can I do to prevent this from happening again?
There are several proactive steps you can take. Managing your stress levels, maintaining a healthy diet, engaging in regular physical activity, and avoiding smoking are all crucial. Depending on the results of your tests, we might also prescribe medications to control your blood pressure, cholesterol, or other risk factors.
I see. Is there anything else I should be aware of?
It's essential to remain vigilant about any new or recurring symptoms. If you experience similar symptoms again, even if they resolve quickly, you should seek medical attention immediately. Early intervention can make a significant difference.
Thank you, Doctor. I'll follow your advice and take all necessary precautions.
You're welcome. We'll get these tests done as soon as possible and follow up with the results. In the meantime, try to take it easy and focus on taking care of yourself.
I will. Thank you for your help and guidance.
Anytime. Take care, and I'll see you soon.